This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber.
Okay, good morning members and thank you. We have a quorum and I call the meeting to order. I'd like to welcome all the members who are participating by video conferencing and to remind members about the protocols regarding the use of electronic devices. So no apologies have been received in advance of the meeting to the committee office. I'll just check with the clerk. Have we?
No other apologies,
No
Chair.
other apologies. Okay, members, so we're then going to move into our first substantive session today, and the first session is a joint meeting with the Disabled People's Parliament and a briefing from the Department of Health. So, members, this is the first joint meeting of the Committee and the Disabled People's Parliament, and I would like to welcome those delegates from the Parliament with us in the Chamber. It's, I feel, a very important, a very historic day, but also a very natural day in a sense of the terms of how this committee have operated since the outset. From the outset, we stated that we would want to be a very inclusive committee, a committee that reached out to people who have solutions, have knowledge of their particular area and expertise, and we wanted to access that expertise and to ensure that that expertise was part of the discussion around health. So we are delighted to have your expertise and your experience with us today. We're delighted that the department have facilitated a panel of officials to take questions from you, and we are delighted that the Minister is here today to present and to take a few questions as well. So it's the outworking of, and I'm particularly delighted, I have to say, the very first APG that I attended here when I became an MLA was the APG for disability, or the APG for disabled people, and actually 3 of the 5 people who are here today, Michaela, David and Amanda, I think we're all at that meeting. But I think it's a nice way to sort of, towards the end of the mandate, to see this event taking place today and to see the important work that we are hopefully going to achieve here today being completed in that sense. So thank you for that. So I'm going to first of all introduce the members that we have with us from the Disabled People's Parliament. We have Amanda Paul, David MacDonald. On Starleaf, we have participating Joanne Sampson, June Best and Michaela Hollywood. So at the special session of the committee, we will be getting briefed by the Minister of Health, and officials are available to answer any questions. We are also delighted today, and I think it's a very important and a significant moment, is the meeting will be signed by British Sign Language signers. Unfortunately, we weren't able today to get availability to have Irish Sign Language possible during the meeting live, but we will endeavour to get an Irish Sign Language interpretation signed version done as soon as possible, and we will put that out publicly as well for people who use Irish Sign Language. So I would now like to go ahead and welcome the Minister and his officials from the Department. So first of all, Mr Robin Swan, MLA, Minister of Health. Robin, can you hear us there okay?
I can, Chair, yes, thank you.
Thank you. Gerald Cassidy, Director of Primary Care in the Department. Gerald, and Will too, can you hear us okay? So we're not hearing you there, Gerald. Just, I'm not sure if you can check your sound. I'll move on and we'll come back to you. Hopefully when we come back to you, we will be able to hear you okay. Mark McGuckin then, Director of Disability and Older People. Are you able to hear us okay, Mark?
Good morning, Chair. I can, yeah.
Thank you, and we're seeing and hearing you. Mark, thank you. Colin Dunlop, Head of Physical, Sensory and Disability. Colin, can you hear us okay? Okay, I'm not seeing or hearing Colin. I'm going to move on and we'll come back to you, Colin. Hopefully we'll be able to hear you when we come back. Jim McComish, Deputy Principal, Physical, Sensory and Disability Unit. Jim, can you hear us?
Chair, I think some of my team are having difficulty getting on, so maybe if we could just introduce them as they get on if we need to. Yep, okay. And we will then also be hearing from Jerome Dawson, are certainly available to take questions, and Jerome is Head of Learning Disability Unit, and Andrew Webb is Head of Elderly and Community Care Unit. So I'll go, and we're also joined by Ryan Wilson, who's a Director in Secondary Care. So I will then go ahead back to yourself, Minister, and ask you to go ahead and brief the meeting this morning, please. Thank you.
Thanks, Chair, and look, thank you for the opportunity to join with your joint meeting this morning with those members of the Health Committee and also the representatives from the Disabled People's Parliament. I'm very pleased to be invited here today to deliver a few opening remarks, but unfortunately due to other pressures I'm unable to be with you in person or to stay for the full session. but I've made a wide range of my officials available today who will be able to continue the engagement with both representatives of the Disabled People's Parliament and the Health Committee. And I commend your committee, Chair, for facilitating the attendance of members of the Disabled People's Parliament here today. I think this joint event actually underscores and acknowledges the very important role of the Disabled People's Parliament and what it has in representing the views of people with lived experience of disability, actually focusing on the person first and their condition or disability second, and actually furthering the rights of disabled people in Northern Ireland. And I wish I was with you yesterday, Chair, when you updated, or sorry, I was with you yesterday, Chair, when you updated the speaker in regard to today's event as a follow-on from the previous meeting that he'd actually hosted. I understand and fully and place great value on the benefits of co-production and co-design of services, actually working closely with people living with a disability. So for example, in late 2021, my department established a regional Disabled People's Forum for Health and Social Care, which is bringing the views of disabled people, carers, the statutory sector and the voluntary and community sectors actually closer to government. And it's that forum that provides feedback at a strategic level to my department on current, new and emerging policy initiatives, which contributes to improving the experience and outcomes of people living with a disability in Northern Ireland. But due to the pandemic, the last few years, sorry, Chair, I'm starting to get feedback.
Okay, there's no feedback in the room, so
okay.
Yeah, you're still clear to us.
Okay, no, that's all right, Chair. So due to the pandemic, the last few years have been extremely challenging for all of us, and in particular the most vulnerable members of our society. Children, the elderly and disabled people, including those who were clinically vulnerable, have endured significant personal challenges as they actually strived to live their lives safely throughout the pandemic. And my department and the health service have sought innovative solutions to the challenges of delivering our services with primary, secondary and social care in as safe a manner as possible during the pandemic. And I want to acknowledge fully the importance of making all our health and social care services, and that includes primary care services, accessible to disabled people. And I understand that whether primary care services are delivered remotely or face-to-face, it's very important that we take the necessary steps actually to enable them and enable every patient to be able to access them. So for disabled patients, this may mean ensuring that our primary care services are able to make use of appropriate support services and technologies. So looking to the future, it's crucial that we work together to ensure primary care services are able to deliver high quality, accessible services for everyone in Northern Ireland. And in order to address the longer term pressures of increasing demand for primary care services, my department has been continuing to invest in our GP workforce. We've increased the number of GP trainees by over 70% since those 2015 levels. And work has also recently commenced on a review of GP trainee places to make sure there are enough GPs to meet our primary care needs into the future. So everyone here today is aware of the key role played also by our domiciliary care workforce in helping to enable people to live independently in the community. But demand continues to outstrip supply, and providers have been experiencing difficulties with staff retention and recruitment. And of course, the recent progression of Omicron cases still means that a number of staff are off sick or isolating. But there's no doubt that the number of people awaiting access to suitable care arrangements is still too high. So in recognition of those pressures faced by the sector, I announced a funding support package of up to £23 million in November, and that was for the independent domiciliary care and wider social care sector, and that was with the aim of facilitating increased capacity across this sector. The aim of that funding was to enable employers to offer improved terms and conditions, training and career progression opportunities and rates of pay, which should assist in addressing some of the immediate issues. and it is hoped that this will provide an incentive to those wanting to stay within the sector and indeed actually attract new staff to the sector with the aim of increasing capacity. The additional funding has already been utilised by employers to offer enhanced rates of pay and better terms and conditions. And it's that funding package that is currently being rolled out. It does not extend to personal assistance employed through direct payments. However, I am considering if there would be scope to address the position of personal assistants who are extremely important as part of our care system. Because I recognise that the way things have been done up until now is no longer fit for purpose. And a new approach is very much overdue, both in terms of how we deliver domiciliary care, but also how adult social care as a whole is delivered. And it's on that basis £800,000 was allocated to the Health and Social Care Board for 2021. And that was in order to test pilots and new ways of service delivery as part of our wider reform of adult social care. The majority of the funding was provided to the South Eastern Trust to support the rollout of their new pilot for a new model of domiciliary care. And the South Eastern Trust model could potentially be adopted as a template or model for the region depending on the outcome of that pilot. It moves away from a time for task model towards an outcome model, whereby people get access to a more flexible service. So the work of the reform of adult social care will actually inform the long-term reform of the sector, and that includes domiciliary care as well. And as you know, Chair, a public consultation on the reform of adult social care was launched on the 26th of January. And that public consultation sets out our proposals for reforming adult care and support and making significant system change. Also, Chair, something that you've continued to push and ask questions on is that of adult care, short breaks and health and social care transport, because we know they were among the essential services that have been greatly impacted by the pandemic. And it's fully understandable that many people have been calling for the full reinstatement of these services. But it should be equally recognised, however, that these services are subject to nationally agreed health protection guidance designed to keep service users safe. And as community transmission of COVID-19 still remains high, there are high rates of staff absences, and that results in the temporary reduction or closure of adult daycare and short breaks to respond to pressures in acute services and supported living. But again, my department is liaising with Trust to ensure that the pressures are addressed and placement breakdown is avoided. So while there have been significant advances in how we live with the virus, remobilisation of services presents increased risk in terms of COVID-19 transmission. It's not possible to fully quantify the COVID-19 risk to increase respite services. Each service user and setting presents a varied level of risk. However, it's recognised that partial service delivery is impacting the physical and mental health of vulnerable adults and carers. That's why I approved the pathway for remobilisation of adult daycare, short breaks and transport back on Monday the 31st of January. And my officials working with the Health and Social Care Trusts have been with them to direct full implementation of that pathway. And trusts will be required to actually outline the time frame to fully restore daycare, short breaks and transport. The review and pathway will be published on my department's website, and the formal review of the implementation of the pathway will be undertaken within 3 months of inception. So, Chair, moving on to our COVID-19 vaccination programme, which follows the advice and recommendations of the Joint Committee on Vaccination and Immunisation. All vaccine clinics should be capable of accommodating anyone with a disability. All our leaflets and materials are available via the PHA website and can be viewed in larger print or using JCVI. JCVI will continue its rolling review of our vaccination programme and that epidemiological situation, particularly in relation to the timing and value of doses for those considered to be at lower risk, and we intend doing that ahead of autumn 2022. Safe and equitable access to hospital services is of course of vital importance to disabled people in particular. And the Belfast Trust has had a proactive disability steering group actually since 2008. and that comprises a broad range of trust staff, disability representative organisations and disabled people. This has helped us to work in partnership to bring forward innovative and inclusive initiatives to improve the experience and promote independence of service users, patients and staff with a disability. And this has really just been a brief overview of the work to date within the health service and beyond, as we endeavour to make our health and social care services as safely accessible as possible to our people with disabilities. Plainly, Len, a lot of work has been done, and there's still plenty more to do. So once again, I would like to extend my appreciation, Chair, to everyone here today who is engaged with my department and the wider health service in that spirit of co-production. And as Chair has pointed out, I'll hand over to my official, Mark McGuckin, who's our Director of Disability and Older People, who will respond, I think, more fully to questions that members of the Disabled People's Parliament have already shared with us. And as you indicated and introduced, there's a wide range of officials here today, and they, of course, will be happy to take questions from committee members as well. Chair, I hope that you've had I hope you will have a constructive conversation today, and I thank you for that. But Chair, as I spoke to you this morning, I'm content to stay for a few minutes and take questions if that's helpful for you and the Disabled People's Parliament at this stage.
Okay, thank you, Minister. Thank you for that briefing, and thank you for taking. So, in light of that, what I will propose then, I'll just go directly to the delegates from the Disabled People's Parliament, and I have an order list here, so I'll go to those in order. We'll get a couple in, and you can indicate, Minister, at what point you're handing over to Mark. But I'll go first of all to David then. David, go ahead, please.
Thank you very much. Minister, welcome. Good to see you again. I want to address the issue of the Independent Living Fund. It was good to hear you talking about the value of personal assistance, because especially in these times, personal assistance keep me safe. And I'm just wondering where we're at with the Independent Living Fund. As you know, financially, legally, socially and collectively, the Independent Living Fund works. Financially, it gives a startling social value return of £10.89 for every £1 invested. Legally, it accords with Articles 10 and 19 of the United Nations Convention on the Rights of People with Disabilities. That's the right to quality of life and the right to independent living. Socially, it affords the most disabled people in this country freedom to choose and control our own lives, freedom to determine and decide what to do, when, where, how to do it, and with whom. Freedom to live a life worth living. Collectively, current stakeholders, future stakeholders, organisations of and for disabled people, and all the trusts agree to it. No. Will you commit to reopening the Independent Living Fund to new applicants by the end of this mandate?
Minister.
Thanks, David. I had difficulty picking up some of that, Chair, unfortunately, but having engaged with David on many occasions, I know fully the point that he'll be making in regards to the value of the Independent Living Fund and the support it brings to people with disabilities, but also how he has advocated greatly for it, not just during my time as Minister, but also in the engagements that he'd had with Richard Pengelly as Permanent Secretary prior to the restoration of the executive back in January 2020. In regards to being able to do anything in the remainder of this mandate, David, I cannot give you that commitment, and you've known me well enough that I've never made a promise that I'll not stand over. But we do, in the department, value what it has done and what it has been able to do. I only wish I was in a position where today that we could be looking to a 3-year budget for the new executive, and any successor in this place after the next election could be making those commitments with the guarantee of an increased budget, but also the surety of a 3-year budget as well. In regards to where we stand with the Independent Living Fund, Chair, I'm sure Mark or some of the other officials can pick up in more detail at a later stage if that would be suitable to you.
Yeah. Are you okay? We'll come back for some more detail on that, David. Do you have anything, a follow-up or?
Another question, maybe?
Yeah, go ahead, David.
Minister, can you hear me clearly now? I'm just checking.
Take your mask off.
No. Can you hear me clearly now? Just to.
David, I actually think it's my connection rather than anything from that side as well. So if you keep going,
No
will
problem.
work.
Sadly, it appears that some domiciliary care providers, private domiciliary care providers, are leaving disabled people that they have contracted to deliver services to absolutely adrift and alone, contacting the trusts, contacting the trusts and cancelling packages they themselves chose. The results are an added burden to the trusts and uncertainty and fear for the disabled people concerned, with the only option on offer going into a nursing home. In November last year, as you said earlier, we allocated an additional 23 million, intended to help such private providers increase their workforce and improve their practices. Given the current climate and this allocation of additional funding, can the Department and Trusts act to ensure private domiciliary care providers do not drop packages and people, at least until alternatives in the community have been identified and secured?
David, in regards to the additionality that were provided, part of our concern back in November and December last year was actually the high number of packages that independent providers were actually indicating they were going to have to hand back because of staff shortages and staff pressures. And that was where I suppose part of the major concern was coming to us as a department, but also the trusts, who were then feeling, and rightly so, were obliged that they were going to have to pick up those packages as well, where they didn't have the capacity either. When we introduced the additional 23 million to support the independent sector in regards to, as I spoke about, the ability for them to increase wages, terms and conditions, but also career progression as well, we saw a significant downturn in those packages that were going to be returned or actually stood down. So we did see a stabilisation of what the independent sector were able to provide. So we didn't see the mass continuation of return of domiciliary care packages that could have happened had we not intervened in November with that additionality of money as well. We're still aware of some challenges as well, and that's why we're compensating with the additional capacity within our trust to make sure that we are getting those packages for those individuals. But as I said in my opening comments, David, demand currently outstrips the supply that we have in regards to complete domiciliary cover, that what we want to provide as well. And that's why, the pilot that we have running in the South Eastern Trust, I think, really sets a model for what domiciliary care could look like in the future, because we know it has to change. We know the demands of the number of packages that we have, the people who want to stay in their own homes receiving the support, as you spoke about earlier, in regards to that through domiciliary care package or independent living fund or personal assistance payments. It's all important that we make sure that we're providing a system that suits the needs of the person rather than suits the needs of the system.
I think, if I may, I think that's part of the difficulty, because it's meeting the system's needs and the private providers' needs. It's also why I'm concerned about the ILF and indeed direct payments, but the ILF in particular, because the Independent Living Fund has seen an awful lot of people safe through the pandemic, because people were able to close their doors, stop domiciliary workers coming in who maybe had more chance of passing COVID on, and look after their own and have a level of money to fund PAs to do so. I think it's essential for future proofing that we have that available to the most disabled people in this society, because it is the most disabled people that are affected by this. And we need to work assiduously, if I may say, yourself and future ministers, to try and get this through. It would be nice to see a consultation come out on the Independent Living Fund before the end of this term. I trust we can maybe try and work towards that. Thank you.
Okay, thank you, David. And I'll move on then to Amanda. And if I could just ask everyone, all attendees, that we have someone with visual impairment, so I'd ask the speakers clearly identify who they are before speaking and before answering. So Amanda, go ahead, please.
Hi, June. It's Amanda. Just to let you know.
Thank you, Amanda.
Okay. Minister, one of the issues prior to the pandemic, and even more so currently, is getting a timely appointment to see a GP. Perhaps a way to overcome this problem, and I'm just setting this as a little seed, would be for GPs to be paid in a completely different way. At the moment, they're paid per patient that they have on their books, whether they see them or not. Would it not be an idea to actually pay them per appointment? Then appointments would come flowing in, I believe. Okay. I'd like to ask what plans are afoot to work in co-production with disabled people to address the issues that we have with primary care. And can you advise me when GPs will open their practices to enable appointments to be booked? GPs were the first ones to close their doors, and it seems like they're going to be the last ones to reopen if they ever do.
Thank you. Amanda. Minister, please.
Thanks, June. Gerald, Cassidy, my Director of Primary Care, is on here. He'll be able to get into greater detail in regards to the specifics of GPs. June, I think you've just suggested this morning a complete rehaul of our National Health Service and how we operate with our GPs. So I'm not sure I'll be able to get that done by the end of this mandate. But I know it's something that has been long looked at, and when I look back, and people, when they know my politics, when I look at the National Health Service that now Bevan wanted to create back in the 40s, it was the complete system. GPs at that point weren't brought into the system as fully as they could have been in the National Health Service, but I know there are conversations happening in other places about how that greater integration works. June, in regards to your comments about...
Sorry, Minister, there's a little bit just of confusion there. It's Amanda, actually, that was asking...
Amanda, sorry,
yeah. Okay.
Apologies.
Okay.
It was you confused me at the start, Chair, but that's all.
Blame the Chair. Blame the Chair, Minister.
Don't worry, Chair, I will, because she usually blames me. Sorry, apologies, Amanda. And look, in regards to the challenges that we've had with the accessibility to GPs, sometimes I think criticism that is levelled to them is unfair. Our GPs are actually supporting an increased number of referrals to what they were previously, even previous pandemic as well. Our GPs are open. They are doing things differently in some cases. But even talking to our GP representatives bodies, they're they're all being tarred with the same brush, unfortunately. And I've visited a number of GPs who have went far and beyond in regards to what they're actually doing to open up their services and making sure they're fully accessible to the people who need them. We invested significantly towards the end of last year in regards to our GP services to make sure they could be more accessible in regards to telephone triage and enabling people to actually get in contact with them directly. Our GP services need more investment, both in regards to financial input, but also how they can be modernised as well. And that's why our multidisciplinary team approach, which was started, is important that we get the continued funding to be able to do that. Funding not just from a workforce capacity point of view, where we can bring in those physiotherapists, pharmacists, social workers actually into GP practice, but also the capital expenditure they need as well to increase the physical footprint that they need to see that wider scope of patients and provide that greater service as well. So there's a lot of work to be done again in our GP models. Our GPs are up for it. But it's in regards to how we actually do that. We've also looked about increasing the number of GPs and GP training places. We've increased that significantly over the past number of years, but like the other challenges that we've seen in workforce, it takes time for those numbers actually to get through and those individuals to get through their training. So in the medical school that was opened last year in Magee will see more practitioners coming out, hopefully more GPs under the practice as well. And as I said in my opening comments, we've increased the number of GP trainees by over 70% from our 2015 levels. Those changes don't result straight away in more appointments, more accessibility, but it's about investing now to redirect some of the underinvestment that we've seen over previous years.
Thank you.
Chair, I'm getting tight in time here, so I know you have a couple of other questions just to get in before.
Yeah, so I'll go then to June. June, go ahead there with your question, please.
Thank you, Chair, and thank you, Minister, for giving us the time. Many disabled people still feel unsafe. They are still taking steps to protecting themselves from COVID. They make choices if and when they go out, but what about feeling safe in their own homes? Last week, I had 2 callers in the same day. One was a telephone engineer and the other was someone to read my electric meter. Neither were wearing masks, face coverings. I couldn't see, but I did ask. Right. I guess that with public health with measures that are currently in place to protect what currently are in place to protect people in their own homes in these situations. When utility workers, engineers, housing executive staff, trust staff, and in some cases domiciliary care staff think that COVID is over and they don't need masks or PPE. And what is appropriate PPE in these circumstances and in homes when they know that someone is clinically extremely vulnerable? Thank you.
Thank you, June.
Thanks, June. Just consider you read out a list of individuals, June, and I think you mentioned domiciliary care workers not wearing PPE.
Yes.
I'd be keen if you could offline maybe pass either through some of the committee clerks as well to get back to my officials so we can address that. Domiciliary care workers should be fully aware of their PPE requirements if they're providing a service to someone in their own home as well. I'll not go into the individual details if you don't mind just on this call, but it's something that I'd be keen to follow up on because we have protocols that they are required to form as well. In regards to those other utility users coming into someone's home who is clinically extremely vulnerable, they should be wearing face coverings and I suppose the utility regulator, if they have employees who have certain conditions or requirements where they can't do that, should be making those who can utilise full PPE and wear face coverings accessible for those homes that have CEV residents possible. There's a register out there, and I'm sure you're aware, for anyone who is clinically extremely vulnerable or requires additional acknowledgement for the use of electricity services and things like that would be flagged. But it's something, June, to be perfect in regards to other utility regulators. It's not something that has been raised with me before now, but certainly something that I'll get officials to follow up on after this meeting, or you can have a wider conversation with those still on the call after, unfortunately, I have to leave.
Thank you. Thank you for that, Minister.
Okay.
Have I time to do a second question?
Briefly, please, June. Yeah, go ahead.
Okay. Disabled people are still experiencing frustration about missing important appointments, medical appointments. As appointments letters are usually sent out and information sent out in paper form. Now, it's not only myself with visual impairment that can't read these. And in fact, during COVID, it has exacerbated the situation because I had 6 weeks before I could get a load of correspondence read as I wasn't in contact with anybody. But for some of my other colleagues and friends and older people, they cannot hold paper sheets or find it difficult to hold paper sheets and so forth. So what can be done what can be done that we can have accessible information to those who need it in this day and age of technology?
Thanks, June. In regards to how we actually change, how we identify patients coming forward, we did see some changes in regards to the utilisation of technology, especially in regards to bringing patients forward at short notice during the pandemic when we were seeing no slots or appointments become available. But the further use of technology to communicate with people with a disability or with a further need, that paper correspondence isn't accessible is something that, again, I would ask officials to follow up on, and just in our interaction with our engagement groups that we already have as well, about what work can be done across trusts. You may be aware, we're talking about introducing a new IT system across the entirety of health and social care and Compass, and it's about how it can be greater utilised, actually about how people access their records or appointments as well. If there's something there that could maybe be looked at even at this stage, because we want to make sure there is an ability that we're not losing slots within the health service because we've sent out a letter that isn't accessible to the person that we want to actually come in and access our health service as well. So I'm just trying to work through where we can actually best place that, but I'm sure Mark will be able to follow up with some of the officials later on. I know that in Belfast Trust, the sighted guide service is one of the outcomes of the pilot project that the Belfast Trust actually involved in every customer counts. And that was an initiative of the Equality Commission for Northern Ireland. So I know that's operational in one of our trusts, is how we just make sure it's rolled out across not just the rest of our trust, but also primary care provision as well.
Thank you. I guess I get very upset when I have to ask my family or someone to read a very personal correspondence letter, and I know that people are having appointments that arrive after the date of the actual appointment, and are missing them as well. So that.
Okay, thank you, June. And Michaela?
Good afternoon, sorry, good morning. I'm way ahead of myself. Good morning, everyone. Thanks, Minister, for taking the time to spend with us. Just following on very briefly from what June said, I would appreciate if I could also reach out on the PPE requirements for personal assistance, because that's not very clear at the moment, and it's certainly a question I have had asked of me. But many people, disabled people, rely on the services provided by our health service, and even when we are inpatients, we require the help of PAs, carers, or family members. But we're experiencing barriers to this. For example, we're experiencing people saying that we're not insured to use ward equipment. So this is in an environment where we're meant to feel safe, and it's making us feel unsafe and putting us at risk. So what is the department going to do to resolve those issues, to make sure that disabled people are experiencing the appropriate continuity of care and that they are actually safe in hospital?
Thanks, Michaela, and I think that goes down to the crux of how we make sure our services are actually supporting the individual in regards to what they need, when they need it, and how that service is actually delivered to them. That it is person-centred, and as I said to David earlier on, that is how we make sure we're delivering for the people rather than actually looking after how the service itself works as well. In regards to challenges around about not being insured to use personal equipment, again, Michaela, I'll get officials to follow up if there's individual cases that you have in regards to that, because I know it does cause certain difficulties, but it's usually can be solved or rectified either due to training or additional enhanced support for those service users coming in. And part of the problem is when we get staff turnover in regards to somebody coming in to support a patient or an individual that maybe haven't received the appropriate training, or because of staff shortages at short notice, have been asked to fill a slot or cover a service that they haven't received that training for. But again, we'll get one of the officials either to follow up in this session or to follow up with you directly after it.
Yeah, I would be more than happy to do that, Minister. It's an important issue. I have another question, if that's okay, if you've got time.
Briefly, please, Michaela. Thank you. Yeah.
So, I mean, none of our main hospitals in Northern Ireland have an outpatient changing places toilet. That includes the Royal, there's none in the newly built down, and there's none, as far as I'm aware, in the Ulster Hospital. So, changing places will be mandatory in certain public buildings in Northern Ireland, with building regulations set to change in June. So, will the department commit to having changing places toilets in all outpatient departments in Northern Ireland?
Michaela, fully aware, of the announcement that Minister Murphy made in regards to that at the start of the week, but can also say fully aware of your part in the campaign as well. So, in regards to achieving that, I hope I have enough a capital budget to build new hospitals in the future as well. But it's also how we look to make sure that all our facilities are suitable for everyone who needs to use them. So it is about how we progress any of those capital builds, rechanges in regards to changing places and making sure those facilities are accessible, but also being able to be utilised by everyone as well. So it's something that we're fully aware of through the campaign and that has been done up until now, but also due to the change in building regulations, that it is something that will be required in any new build going forward as well.
Thank you. And then in terms of finally from the Disabled People's Parliament delegates, Joanne.
My first question is, many of the measures and supports introduced during COVID, such as testing, were not designed to be accessible to disabled people. Going forward, what will be implemented by the department to ensure that lessons are learned to address, foresee and correct such end-user accessibility issues?
Thanks, Joanne. And again, a very important point. And I suppose when we looked at testing, especially at the start, was about mass testing and how we got it rolled out. And that is one of the learnings that we have to take as well on board. And there's the point that you make, to make sure when we do look at those facilities for testing, they're accessible to everyone, and not just in regards to how the tests are carried out, but where they're carried out. And by him as well. So it's actually, rather than self-testing was a very effective measure that we brought in, but it's not accessible to everyone. So it's how we actually set up a supported service then as well, should it be necessary going into the future in regards to where we have, I suppose, COVID or other variants or outbreaks. I hope, Joanne, we're at a point where it is about looking for lessons learned for a future, not something that we have to introduce in the shorter medium term as well, because I do hope that we're fully progressing out of this part of the pandemic as well. So your point in regards to making sure not just is testing accessible, but also what the work that we have to do to make sure vaccination and those other support measures are accessible to everyone as well. So.
Okay, thank you, Minister. And Joanne, do you have a second question, Joanne?
Yes, the Office of National Statistics from Great Britain provided better data regarding the impact of COVID on disabled people. What steps are being taken to ensure the Northern Ireland Statistics and Research Agency replicate data sets in future to improve data collection and analysis regarding disability and disabled people in all future research to enable comparative studies and statistics, furthermore ensuring that disabled people disability no longer gets easily disregarded as a research limitation.
Thank you, Joanne. Minister.
Thanks, Joanne, you're not leaving me to finish with the easy questions, are you? No. Look, in regards to, and I suppose, no, the point you make in regards to ONS, Northern Ireland feeds into the ONS statistics as well, but our own statistical research here in the Northern Ireland NISRA statistics that we produce as well. And again, we're fortunate they actually sit under the Department of Finance. So when they take our health statistics and the figures they provide that, I suppose, arm's length analysis of the data that we're able to provide. I think one of the things coming out of COVID that we've seen is actually the importance of health data and the utilisation of that to make decisions as well. So that's why what we see coming out of NISRA, coming out of ONS, has actually been utilised to enable us to make decisions in certain ways as well. And when you look, the quality and the detail of the dashboards in regards to data that we've produced specifically in regards to COVID over the past 2 years, I think have been highly informative, not just for us as a health department, but also to be able to utilise by the general public as well. Again, I mentioned earlier Encompass, which is our new digital programme that we hope to roll out across all health and social care. Now, it will take a couple of years to achieve that, but one of the main aims behind that is to be able to look to the data that it'll be able to provide to allow us to drill down into regards to population needs, health needs, or the ability for early interventions as well. So it's really about how data captured is utilised to improve health outcomes, not just for individuals, but also for society in general as well. But always one thing that I've been conscious of and very clear on in the past 2 years, when we talk about data driving decisions or driving interventions as well, it's crucial that we don't turn everything into data and numbers. What the health service is good at and what the health service must always be about is looking after an individual. For the individual should always be at the centre of everything we do. The individual should be always about it, but at the centre of every decision that we make as well. So while data is important to look to those bigger, I suppose, society drives or society changes, it's always important that we ensure we have a service that delivers for the individual and for the person.
Yes, I 100% agree, but it's just in future, if there is a data set that informs policy in a disability way, why isn't that being implemented in Northern Ireland in the same way?
And I think it is, Joanne, we don't have the systems in place to collect the data that we need to be able to make those informed situations at present. But one of the things that Encompass will allow us to look at that proactively, so we can make those changes as well. England introduced NHSX a number of years ago, so they are ahead of us in that. But it's work that is ongoing here, and I think it's work that will be valuable for us.
Yes, because qualitative data also tells personal lived experience stories through research. So research can tell person-centered stories as well as statistics.
Very much so.
Absolutely correct, Joanne. And actually, I think it's really a fundamental issue, and it's in terms of the minister's contribution, I think it's a great place to end. I do think COVID has kind of demonstrated the fact that we need better research, better data here, based locally, and just not extrapolated. And just to inform everyone in the meeting that we actually are taking a briefing from Encompass in our next session, and also in reference to the issue raised about GPs, we're hearing from GPs next week. So both of the issues you have raised are on the committee's radar as well. I just want to go back to you, Minister, to check. Thank you for taking those questions and for giving your presentation. And just to check, do you want to make any final closing remarks there before we go over to the other members?
No, Chair. Again, just to thank you for facilitating this session this morning, and to thank the people from the Parliament for attending as well. And and their questions as well. I'll not make any comments about the quality of their questions compared to the quality of the Health Committee's members' questions at this point, Chair, but I found the members of the Parliament's engagement very, very useful and very instructive. The only thing that concerns me now, Chair, is with that round of question, I have a raft of officials on here who have probably nothing left to answer, but I hope between yourselves in the Parliament, but also the members of the committee, that you still have enough questions left for them to make it worth their while being here.
Yeah, well, and certainly I think there will be other questions. But thank you, Minister, and I wish you all the best in the time ahead as well. And we'll certainly take on board the fact that you want the questions to be coming at you more hard and fast. And we look forward to seeing you at our next session. So thank you, Minister. And so I'm going to go now, and I'll take a round of questions from committee members, and then what I want to do is come back and leave some space at the end to come back to members of the Disabled People's Parliament to pick up on issues and to follow up on anything that you feel needs a further follow-up. Can I remind particularly the members of our panel who are now coming in to answer questions, could you please identify your name so that people who are watching in, and I believe there are many people out there, I'm delighted that there are many people out there watching in online, as well as the people in the room. So for anyone with visual impairment, that you identify who is speaking, so to assist those people in examining the evidence. The other thing is that I want to say to the panel is, if you're picking up on an issue that was raised that the Minister indicated, please indicate that, and if you're picking that up as part of another member's questions. But for now, I'm going to go to Paula, and then I have I'm going to go to Colin first, then Paula, then Carol. Go ahead, Colin.
Thank you very much for that, Chair. Colin McGrath here, one of the committee members for the Health Committee, and it's been a great session to watch this because quite often we represent people's views, but whenever people can actually give their real living examples of what they are living with day and daily and the problems that they face, there is just so much more currency to that, and I know that certainly the Minister has highlighted that, so I hope that the officials will also likewise take away what you have heard today and work on responses. But there's just two issues that I wanted to ask, and I'll ask them in one go. One is in relation to the fact that we do have a cost of living crisis that everybody in our community is feeling, but those that have disabilities often have to have additional aids and adaptations and machinery, which costs extra money. Some people living with disabilities will require additional heating, etc. And I was just wondering what the department was doing to try and identify that and work with other colleagues to try and address that. And also in terms of those that are employers, as people directly employing people to assist them as personal assistants, there is a complete lack of support from the department in terms of being at the end of the phone if there are issues that need to be assisted with. And I was just wondering what the officials' views would be on that. Thank you, Chair.
Thank you. So, Mark, could you identify who's going to pick up the question, or a member of the panel identify who's picking it up and who they are, please? Thank you. Mark, you're on mute, we believe. Still not hearing from you, Mark, so maybe if another member of the panel could indicate to come in on that question. No, we're still not hearing you, Mark. So do we have another member of the department panel who can pick up on Colin's question in relation to cost of living and in relation to PAs?
Chair, Gerald Cassidy here. I'm the Director of Primary Care. It's not really an area that I'm expert in, and I'm not really best placed to answer the question. But I mean, I'm very happy to take it back offline and come back with a proper response. In the interest of keeping the meeting going, I mean, I know we're having some connection difficulties. You couldn't hear me speaking earlier, unfortunately. So unless Mark can be heard now, I'm happy to take that question offline and come back to the committee in writing, if that's okay.
Okay, well, I'll just check. We still don't have your sound, Mark, so that could be an issue. So what I'll do, Colin, is I'll move on to the next questioner, and we'll come back to that, and we'll either get that information back for you in writing, or we will, if we get Mark online, maybe he can pick up on it. But I'm going to go now to Paula.
Thank you, Chair. My name is Paula Bradshaw, Alliance Party representative on the Health Committee. I'm very concerned about the rate of the reform and transformation agenda within the Department of Health, and I know it's a massive issue, especially during the COVID process, COVID pandemic. And I'm just wondering, what big reform packages is the department thinking of to look at the services that are in place to support those people living with disabilities?
Yeah, so can a member of the panel indicate picking up on that, on transformation?
Again, thanks, Chair. Gerald, Cassidy, Director of Primary Care. I can answer from the primary care point of view. And as you alluded to, I'll be back next week to talk about primary care access as well. So, if I don't cover it in full now, you can get a second bite next week. Prior to my working in primary care, I actually worked in transmission program as well. So I do have a kind of a degree of familiarity with it. In primary care, our single biggest project or priority would be the multidisciplinary team program. It's the flagship primary care intervention. We've been rolling it out in earnest since 2018, and in terms of specifically for disabled people, the aim of the program is really to boost access for everyone, and that will include and benefit the disabled community as well. Being able to provide more services closer to home, avoiding need for onward referral into secondary care services, which are, as everyone understands, very stretched. Those are kind of key aims for us. Program has been it's been on the ground since 2018. We're currently we're taking a kind of a federation by federation approach to the program. There's 17 GP federations in Northern Ireland. We currently have a presence in 7 of those 17 to a greater or lesser extent. I would say it's fair to say that the COVID pandemic has had a significant impact on our ability to roll out. We effectively had to through redirection of resources in health service and also kind of within the department and in the board as well, just kind of priorities focusing on addressing those issues. We have had as progress has been slower than we would ideally have liked. That said, we have a good level of coverage and a good level of service across those areas where we have it. The priority is to come up with plans for how to roll it out more widely. We've been working on a roadmap for that. So the first kind of product of that is an outline running order for where we will go next. That's been agreed, and the next challenge is to really get a kind of detailed plans in place for how it will be rolled out in those remaining areas, and the timescale for that. Cognizant of the fact that we are in a very uncertain budgetary position, and there also are significant workforce pressures, which will determine how we do that. Key to our approach in doing that is working in partnership. That's working in partnership on a local level with federations and trusts, and also with our professional colleagues to see what scope we have for creativity and for innovation in our approach, and also what would be to maximise what is deliverable in those areas within the kind of financial envelope and within the kind of the constraints of resource. I don't know. That's probably quite a narrow answer to your question, Paula. But if you've any, I can take any more further questions on that at all.
No, thank you. I suppose in some ways I don't think it was specific enough to those people living with disability, and certainly towards the end of your response there, it looked like you were consulting, sort of within the federations or within the department, and I'm just wondering in what way you would be engaging going forward in terms of a specific package of transformation measures that would actually meet the needs. Certainly some of them being outlined today, and I'm sure there's a long list as well. What is going to be done specifically in terms of co-production with those people living with disabilities? I'm not sure you can answer that today, but it is something that I think needs to be addressed.
I can answer as far as I can answer, Paul, and that's picking up on one of the Disabled People's Parliament. Amanda raised a similar point as well, so that was kind of keen to come back on. Co-production, I mean, as you'll be aware, goes through the heart of the overall transformation agenda. We primarily, I suppose, we look to work through the Patient Client Council as a kind of conduit to engaging with particular stakeholder and patient groups. But I'd be very open to working with the Parliament as well. I mean, to kind of to provide briefings and take their views and work with them on how we can better reach disabled people and reflect their needs and their interests and concerns as we can make plans for development.
Yep, thank you, Gerald. Thank you, Paula. I'm going then to Carol. Yep, go ahead, Carol.
Thank you, Gurmagad Caherly. Carol Killen, Sinn Féin MLA for North Belfast. I'm also sitting on the Health Committee. So thank you for being here with us today as part of our questioning to the Minister and the officials. I'm not sure if Mark is back on, and I appreciate that everything that's been said up until now is probably the right thing to say, but in the middle of it all we have a crisis in workforce, and unless that crisis is addressed, that the questions that were asked, every single one of them are completely valid, then how can we have better access to respite? How can we have better access to multidisciplinary teams? How can we ensure that GPs are more open and accessible? So that would be the main thrust of my question, Chair.
Yep. So on workforce issue, can I ask someone on the panel? I don't see Mark online there, so I'll ask someone else on the panel to pick up on the issue of workforce and its impact on developing and delivering services.
Chair, if I can just come in briefly. This is Ryan Wilson. I'm Director of Secondary Care in the Department of Health. Mark is unfortunately having some technical problems, so he has joined me in my room here, so he will have missed most of Carol's question, but if you wouldn't mind, I think if I can just sort of summarise it, the question is around workforce issues and how they might be addressed. Carol, I'm sorry if I haven't captured that fully, but would you mind summarising just for Mark as he's now?
I'll ask Carol to repeat the question. Carol, go ahead and repeat the question, please, just for clarity.
Mark, it's good to see you. We've all had technical problems, so what we usually do in here is what you've just done. We scoot into each other's rooms to make sure we don't miss anything. So to make sure you've heard all the questions, I'm going to repeat it again. Most of the questions that everyone has asked up until now, at the heart of it all, in my opinion, is a crisis in workforce. So, for example, around co-production, around access to GPs, around domiciliary care packages and access to respite care. In the middle of it all, there is a crisis in workforce and workforce planning. So what can be done to ensure that that is addressed as a matter of urgency? And if you don't mind, if you could speak up a wee bit, because I'm having difficulty just hearing, and maybe it's just technology, but I'm having difficulty hearing. So, please.
Thank you.
Thank you, Carol. Mark McGugan, Director of Disability and Older People, and apologies, Chair, I've had a nightmare with technology this morning, so as I am with Ryan. In terms of workforce, my primary area would be in relation to domiciliary care and care homes workforce and what we do in terms of trying to bolster the independent sector. As Minister noted earlier, we did put significant additional resource into the sector in November. That's primarily stabilised the sector and has attracted new people into a number of the major firms. We are also delivering what we call a Fair Work Forum, which is a co-produced piece between ourselves, the department, a number of the regulatory bodies, the unions, and a number of the domiciliary care and care home providers. This is in terms of trying to set a fair standard across the board. We will be appointing an independent chair to take this work forward, and this work will dovetail with the consultation on the reform of adult social care. So we are trying to do a number of things, Carol, to ensure that the workforce is there. In terms of respite services, the Minister did mention around the PHI pathway, which he has now approved. We're working with trusts, and we have written out the trust to ensure that they do reopen respite and daycare services as quickly and as safely as is possible. We have responses in from all trusts now in terms of the rebuild plans, and we're analysing those and challenging the timescales and challenging the work that needs done to reopen the respite services and daycare opportunities. But you're right, staffing is a huge issue. The ongoing long COVID and the impact of Omicron has had on services has meant that some services in the community have had to be stood down or reduced to tackle some of the pressures in the acute services. So it's a situation which we're trying to tackle. In terms of other workforce issues, I will pass on maybe to Ryan or Gerald to deal with those.
Thanks, Mark. There's just one point I think worth adding to that. Members of the committee at least will be aware of the department having published a workforce strategy a number of years ago. And I think Carol quite rightly points out that most of the pressures do boil down to a workforce or a need to train and recruit more people and right across specialties and across primary, community and hospital services. So I think the point needs to be made that a lot of that depends on investment and had been factored into our plans for a 3-year budget. So we really need some progress on the future investment and the future budget in order to be able to begin to really meet the root cause of some of those workforce shortages, in addition to the issues that Mark has mentioned around sickness and turnover.
Yeah, and Gerald, were you going to come in there briefly if you can?
Yeah, Chair, thank you. Just to add, and kind of the Minister has alluded to this already, I mean, we're keenly aware of the workforce challenges in primary care, in particular around the number of GPs. We've done a lot in recent years to increase the number of GPs. I think Minister referenced there's been a 70% increase in the number of trainees over 2015 levels. So it brings up to 111 trainees on an annual basis. We're just embarking, or have recently embarked on some work to review the number of GP training places that's required to make sure that we do have the right numbers going forward. I mean, that work is not yet complete, but that will give us a very strong sense of what we need. And as Ryan's indicated, what we can deliver on that will be subject to the budget and kind of wider funding position.
Yes, Chair, can I just have a small follow-up question? Look, I appreciate we're all in a situation that's not of our making. We don't have an executive because the DUP walked off the stage. We can't go beyond budgets because we'll need to live from budgets from week to week. So we know all that, but the issue is, and no one's answered it, and I'm not being awkward, but the talk about the importance of MDTs has been talked about and won't be addressed until we tackle the workforce issues. And if the MDTs aren't addressed, and all the services that are needed won't be addressed either, it'll be piecemeal and it'll be by postcode. So I just want to put that. The last question I have, Chair, is this. Has the £500 payment for recognition been paid to everyone in the independent sector? If we could get that confirmed, because that is still something each of us are getting raised in our constituencies. Sinead,
Carol, Agus Arish, Gojian panel. Could someone pick up on that question around the £500 payment on independent sector, please?
Yes, Chair, Mark McGugan again here. I can confirm that the £500 payment is being actively rolled out as we speak. There's been a number of elements to this, and that we are currently working now for people who have left employers during the qualifying period. So we've written out to employers to ask them to make contact with previous employees to ensure that we can pay that to those employers or those employees. We're rolling that out at the minute. The next stage of this then will be launched on the 21st of March, which will be in terms of payments to personal assistants, Independent Living Fund and survivors of thalidomide fund. So that will be launched. We're using a portal through the colleagues in ILF Scotland to manage those payments directly. So it is rolling through. We've progressed this significantly. We have had a few hurdles along the way, if I'm honest with you, Carol, but we're working very, very hard to make sure this is rolled forward. We've been able to move the money into next year to allow us to continue on with that. So we're working through all of the cohorts, but we are trying to make sure that everybody is covered in this payment that is eligible for it. So that work continues, and we are still putting significant resource into getting that through as quickly as we possibly can. But it is rolling forward.
Thank you, Mark. And I think David wants to come in briefly on this one.
Yep. David MacDonald, Disabled People's Parliament. Mark, I just want to, you were talking about domiciliary care providers there. I'm wondering what the situation is with PAs, particularly on the direct payments. We have not seen any money increased. So for 3 months, as direct payment users, we've been sitting on the same amount of money we had before Christmas, which in itself came along late. So how on earth do we compete? How do we stop our workers leaving and going to try and get more money from providers, and therefore creating another crisis amongst disabled people who are, quite frankly, freely and without any charge trying to look after ourselves?
Yeah, so follow up there, Mark, in relation to the PAs.
Yes,
500.
Chair. In terms of PAs, we are working with trusts to gather the data on how much we pay out in terms of PAs and how much that would cost them to give an uplift to PAs. As David is aware, we uplifted the domiciliary care hourly rate to £18 an hour to those providers who are delivering domiciliary care. My understanding is that the rate for personal assistance at the minute is in around £13.50 mark per hour, and that is paid directly to the individuals. We are, as I said, we're working on trusts to get the data. There's a significant amount of money paid out by trusts in terms of personal assistance, and this will sound like a broken record, but as we go into next year, the financial position is very, very difficult. We will put in place to the Minister as soon as we possibly can in terms of what it will cost both this year and going forward next year, and seeing what is deliverable about that. But that is something which we're actively considering, and I totally take on board David's comments that it is very difficult, and we are getting a lot of correspondence on the fact that people who are employed through direct payments are starting to leave to take up employment at a higher rate with domiciliary care firms, and we are really alive to that. And I can only apologise that we haven't been able to progress this quicker than we have at the minute, but it is something which we're actively considering, and we'll be putting advice to the Minister as soon as we have an appropriate figure work in place to do that.
But did you say £13.50?
I think I have a figure, £13.58, David, correct me if I'm wrong.
In the reform of adult social care, the differential is between £18 for private providers and £15 for direct payment users. Why are we keeping it so low when the providers are getting
David, sorry, I had a figure in my head of £13.58. I've ran in another office and I haven't lifted my folder, if I'm honest with you. So I will come back to you on that, David, if that's okay.
I'm simply saying it should be equitable. So if you're paying private providers an extra, £3 is what it would be, from £15 up to 18 odds. Direct payment users should get getting the £3 too.
Well, I think we do have to look at what overheads, etc., major providers would have in delivering that service across the board, compared to what somebody employed in a direct payment would have. You would suggest we should have an equitable rate of £18 an hour. We have to see if that is affordable, and what we can do to make sure that we do not allow people to leave direct award contracts or direct payment facilities to go into domiciliary care. So we are looking at it, David, and we're actively looking at it.
Some providers are currently offering, the most I've seen is £15 an hour. Generally I'm seeing £12.60. How can I possibly do that on £13.50 when you take into account my contributions to national insurance, which is 13.8%, and will go up 1.25% come April. Also have to pay towards a pension. There's no way on £13.50 I can match what the domiciliary care providers are making, and they're doing it for a profit. I'm doing all the work for nothing. I don't charge for the work I do to provide management of the care, and I think we need to reconsider the £13.50 and look at maybe what was recommended in the adults, the reform of adult social care, which is £15. The care providers are offered £18 and they're getting £18.
Thank you, David. David, I have Michaela looking to come in on this issue as well, so I will bring Michaela in. The last members where we indulgences will go to Michaela because I think it's an important issue. Michaela, go ahead, please.
Yeah, sorry for that. Thanks very much, Gerald. Appreciate it. I just want to ask the department when the last time that they actually assessed what the overheads are for individuals who employ personal assistants, the cost that would be, because as David says, we are doing this for free, and if they haven't done it, we'll commit to doing it now.
Mark, please.
I can certainly commit that we will consider that, Michael, as part of the outworkings of the Reform of Adult Social Care consultation. That the consultation will come to me to implement after the consultation responses have been analysed. So I'm more than happy to give that commitment that we will consider that as part of the wider Reform of Adult Social Care work going forward.
And okay, and I will move on, but just to indicate that we have raised in committee previously our disappointment at times with the lack of bids that have been put in by the department for additional pressures, and I think that's relevant to that discussion. So, Mark, there is some important information you've committed to providing back to the members of this meeting, and if we could ask that to be done urgently, just in the circumstances that we're in time-wise. Thank you. So I'm going to move on then. I'm going to go back to Colin, who lost his opportunity to ask Mark his question due to the technical difficulties. So Colin, I'll go back to you, please, as brief as you can.
Thanks very much indeed. I suppose maybe the members of the Disability Parliament that have joined us today will understand sometimes our frustration, Chair, because Mark, that was a great civil service answer, that you would commit to consider something as opposed to actually doing it, and that sometimes is the frustration that we have, and we've got to keep that check and keep that pressure, and that's the importance of having the likes of a health committee to keep those checks in place. But the questions I had, Mark, I'm sure you remember them. They were about the cost of living crisis that people are facing at the minute, and how that would be more severely felt by those from the disability community because of the additional costs that they have, and if the department has done anything with on an interdepartmental basis to see if there's ways to resolve that. And then just following on from that conversation there about personal assistance, where people are actually the employers but they don't have any of that access to support in terms of employment rights and insurances and other bits and pieces, and is there something that could be done on that front as well? Thank you.
Yep.
Thanks, Colin. In terms of the cost of living crisis, I would suggest that's more an executive matter rather than directly a Department of Health matter, because obviously other departments are providing additional grants for heating and additional grants which are already being rolled out. So I'm not sure that the department would have the funding or the virus to actually deliver that directly. In terms of personal assistance, I do take on board there's been a number of questions raised today in terms of personal assistance, in terms of insurance, and in terms of the actual cost of delivering that service. So I am committed, and you're right, I take pride in being a good civil servant. So, but I will give a commitment that we will look at those issues directly, and we will come back to the committee as quickly as possible.
Okay, Colin.
Yeah, Chair, that's grand. I think we've lost the word consider there, so that's good. I appreciate that. Thank you very much, Mark.
Okay, thank you very much, Colin. And going then to our Deputy Chair, Pam Cameron. Go ahead, Pam Lanneray, Liddehall.
Thank you, Chair, and thank you to the panel for being here today. And I want to say particular thanks to our delegates from the Disabled People's Parliament. I think it's been a really powerful session this morning, and I think your questions are just fantastic and so relevant, and I think it's a great opportunity for you to challenge the Minister and the Department directly on the issues that affect you most. We understand that there are almost 1 in 5 people in Northern Ireland are living with a disability, so it is essential that disabled people and their advocates have a forum to make their voices heard. And we need to ensure that those living with disability are to the forefront of shaping new legislation and policy. And disabled people must also have a substantive role in health recovery. I am concerned, I suppose, about how we collect or don't collect data, and about how we consult or don't consult with interested parties, and how we plan, and ultimately how provision is rolled out. And I know the question was asked and around consultation. I think the answer was it's done through the patient-client council. Maybe you could confirm that's right, and that suggestion that there is an openness to possibly consult going forward with the Disabled People's Parliament. I think that would be entirely appropriate, and there may be other groups as well that could be included in that. So if you could just talk a bit more around that, and whether, obviously we will be getting the much awaited briefing on Encompass soon today, and what role will Encompass have in improving that data collection and gathering those data sets in order to plan going forward in terms of workforce issues.
Yep, so we'll go back to yourself, Mark, maybe initially, or do you want to indicate another one of your officials?
No, I'm happy to take that, Chair. As the Minister noted in his opening comments, we have established a Regional Disabled People's Forum for Health and Social Care, and we do engage directly with the sector. Deputy Chair will also be aware of the Autism Forum, where we have a co-produced an Autism Forum where we have people with lived experience of autism on that forum in helping us deliver and shape policy. David also sits on the ILF working group, where we have developed proposals for ILF going forward. So, and indeed, each consultation will have its own set of specific stakeholders that we will engage with. So it's not a one-size-fits-all, but we do engage extensively with the disabled sector and other sectors as well. And the work today that the committee have done, I have to commend as the Director of Disability and all the people in the department. I do commend the work that the committee has done today. And it's an example that we will take forward, and we will try to engage more fully with the Disabled People's Parliament as we develop policies going forward. And that is a commitment. It's not a consideration. That is something which we will engage more fully with the Disabled People's Parliament as we move things forward in the reform of adult social care.
Okay. Pam?
Yes, thank you for that. And I wanted to also ask around access to GPs, and as other members have already mentioned, the rollout of MDTs, and in particular the concern there is around the rural areas within Northern Ireland. And I should have, Chair, earlier passed on Deborah's apologies for this meeting. She's has COVID and has been sick and not able to attend today. But I know she would have been very keen to ask around those MDTs, and she's very concerned, obviously, about the GP provision in the west of the province, and that sustainability going forward into the future. So what more work is being done to ensure that we will have the GPs there that we need? And we know, we've heard before from GPs, and we've heard now about how new GPs are working differently from the older generations of GPs, and that we really need to be real about this and understand that we need much more in terms of quantity and numbers of GPs, because part-time hours often equate to full-time hours in terms of GP services. And we also know that obviously females within those roles throughout all of the health service actually often have caring responsibilities throughout their lives, whether that's for their own children or caring for older members of the family later on in life. But there are circumstances in life which mean that people can't not always work full-time with their profession throughout their lifetime. And I think there has to be a realisation of that. So what plans and preparations are being put in place to ensure that we have the numbers, not just in GPs, but of all the different health professionals, that the numbers actually stack up to meet the needs of the future?
Yeah, and just before a member of the panel, could I remind the panel just to state who you are, so for those who are watching in on the meeting or attending the meeting who are of visual impairment, and also just to remind members that we are seeing simultaneous British Sign Language interpretation, and we will be arranging for Irish Sign Language interpretation to be made available for those who wish to follow the meeting, to pick up on the meeting later. So I'll go back to the panel then in relation to the GP question. Is it yourself, Gerald, and will Tussa? No, Mark.
Thank you, Chair. No, I'll take this one. I'm Gerald Cassidy, Director of Primary Care in the department. And thank you, Pam, for the question. It was something I was keen to come back on. Amanda had asked questions in a similar point from the Disabled People's Parliament. There's quite a lot in the question. I mean, in terms of the GP practices and accessibility, I think there is the kind of, certainly Amanda's initial point was around GPs not offering appointments. I think it's probably more accurate to say that there has been a change in how appointments are being offered. The committee will have been briefed before, and I'm sure I'll be here next week as well. We can go into some more detail then. But there has been a move towards a telephone-first model for consultation. That really is a means of managing increasing demand for services. It predates COVID. COVID has accelerated the trend towards doing that, but strategically and aspirationally, that this has been the kind of intended direction for a while now. It has had through the pandemic, it has had the benefit of it's been able to make sure that services were able to remain open and accessible to people in a time when there was a limitation on the physical number of people who could come into practice due to IPC measures. The challenge is obviously for us to make sure that system works as well as it can work. I mean, I would say we've put in considerable investment over the past 2 years, 1.7 million in each of the last 2 years, specifically on improving the telephony systems, but also then improving the use of those systems to make sure that it's not just the telephone there, but there's someone there to answer the phone and to take action, be it for a repeat prescription or for an appointment. I think the first thing the GPs would say as well is that they do still offer face-to-face appointments where it's appropriate. It's it's just that there's a level of the consultation starts via the telephone. For the majority of people, it means that
Gerald,
effectively.
Gerald,
Sorry,
can you hear me? Gerald, I'll have to interrupt there and ask you to be as brief as possible. We are under pressure of time.
Specific. Well, no, so I mean, I can come back and talk in more detail about the access issue. In terms of the workforce issue, I've already mentioned we're doing a lot of work to understand what we need for GPs. I mean, and that is driven. Part of that is understanding what's driving. We've increased the numbers of GPs in training, but at the same time, the number of FTEs being worked has decreased in the same period. That's due to a kind of different lifestyle expectations and the realities of people's lives, as Pam's indicated. That work is being factored into our review of the requirements for training places. And finally, in terms of rurality and MBT, I mean, I'm very aware that rural practice in particular are under pressure. I met with Fermanagh and Omagh Council a month ago, and I'm due back in a couple of weeks' time with colleagues from the board to really talk to understand their issues and to help them understand what we're doing to help with that. MBT is a very important part of that, and as I've indicated, we are putting together, doing detailed work on how we can move forward in what is a very difficult financial and also personnel time. But I'll leave it at that for now, and I can come back on any more details next week.
Okay, if you could provide the committee with detailed information of the planning that's going on. Also, can you give us a date, Gerald, for when the roadmap will be published for MDT roadmap? What's the date? Well,
the roadmap, we've been finalising a version. The roadmap's been through several kind of. It's been a long gestation.
Sorry, Gerald, I do want to apologise. I just don't have time to go into. I'm just looking to know a date if I can.
I'd say in the next couple of weeks.
Okay, thank you. That's useful. I'm going to go then to our.
I think just one of the members were looking to ask a question.
Well, I'm going to be coming back to the members. I'll go to you early, and I'll be coming back to the members. And I do want to. We are under pressure time, but I will come back to the members and ask Dave Dewey for another brief question or final comment or whatever. But I'll take our latest question and then come back to the Parliament delegates.
That's great. Thanks very much. And just first of all, a very warm welcome to all the members of the Disabled People's Parliament. I know virtually and the guests that are in the room with us. I think the Minister was right. Your lines of questioning, you have definitely showed up the committee members today. So well done for that. And maybe just to follow on from one of the other questions that was raised by one of the members directly to the Minister, it might be for Mark. It was just in terms of the Independent Living Fund, and I know the Minister couldn't commit to funding that before the end of this mandate. But does any of the officials on the line have a detailed update as to where that is actually sitting within the department? I know the lobby that we received says that the proposals might be with the Permanent Secretary, and is there any chance or likelihood of even getting that proposal out for consultation before the end of the mandate? That's my question. And then just secondly, to make the point that I do want to welcome the investment that's recently came from the Department of Health from the Mental Health Support Fund. There was a pot of money that has went into disability action to help provide mental health supports for disabled people, and sometimes I think that's one of the big issues that can be sort of overseen and forgotten about. So I want to welcome that investment, and hopefully you might have a bit of a positive update in terms of the Independent Living Fund. Thank you.
Thank you. Go ahead, Mark, please.
Mark McGugan, Director of Disability and Older People. Yes, I can update that the submission in terms of next steps in the Independent Living Fund is currently with the Permanent Secretary. There's been a number of iterations on that, and as the Accounting Officer, the Permanent Secretary has come back and challenged a number of the the consultation, or sorry, the proposals within the submission to him. At this stage, it'd be very difficult for either the Permanent Secretary or the Minister to commit to doing anything next year in the absence of a 3-year budget. And I know you keep hearing that, but that is the reality to it. The proposals that came forward from the ILF working group were to reopen the fund, which would have cost either 7 or 14 million, depending on what option was agreed on. At this minute in time, the department quite simply doesn't have that additional money to commit to new resource going forward next year or in following years. But I said that submission is with the Permanent Secretary at the minute. It went back to him this morning, actually. It says it's been backwards and forwards with the Permanent Secretary because he has challenged some of the workings in the submission and the proposals within the submission. So we hope to get that submission to the Minister, but I cannot give a commitment to go out to consultation on reopening the fund at this stage because we simply do not have the funding available to do that. But that will be a decision for the Minister to take on advice from the Permanent Secretary.
Okay, Mark, and thank you for that response. And just to say, I do think it would be helpful whenever those conversations have concluded with the Permanent Secretary and the Minister, if it is in fact a case of this can't be taken forward because of the lack of the 3-year budget and the lack of First Minister. I think that needs to be provided in writing to the Disabled People's Parliament because it's too important an issue.
Yep. Thank you, Aurelia.
Chair.
Go ahead, Mark.
I'm just saying I'm happy to commit that, Chair. We will get the Minister to write once the decision has been taken.
Okay, and I'm conscious we are, as always, under pressure of time, but there may be questions that haven't been asked. But if members of the meeting want to forward questions, we'll forward those on to the department and seek a response to those. So what I want to do then is, and I know I have an indication there from both Amanda and David, but what I want to do is take another brief question, and it will literally only be a minute or two now that we have each. If I could take a brief question or a comment from each of you, and what I'll do is I'll go in reverse order from what we did originally. So I'll go to Joanne, Michaela, June, Amanda and David. So back to Joanne then on screen. Joanne, do you have any comments or anything you want to follow up on very briefly there, please?
Thank the committee for the time today, and also to ensure the department plans to ensure that disabled people are meaningfully involved in shaping decisions of health and social care in the future, particularly in relation to the trust.
Absolutely. And I think that is the overarching lesson of the day, and why wouldn't they as well, in a routine, a regular, and just that is essential. It's in everyone's interest. I say this often. It's in the department's interest as well to take that expertise on board, rather than it's direct, it's very valid, and it's very accurate. So thank you, Joanne. Michaela.
Thank you. I just want to thank everyone involved in making today happen, and also for being so open to answering our questions. I do have one final one. I pressed the Minister earlier on committing to having change in places when it's available in all outpatient departments. But in terms of being an inpatient, very few hospital beds have overhead hoists. If you need to be able to be hoisted onto a CT scanner, that can be also very difficult. And there are other physical access problems, both as an inpatient and an outpatient. So I would like to ask the department to commit to investigating what those issues actually are and to addressing them.
Yep, Mark, do you want to pick up on that one?
I think, Chair, that would be a matter for us to take forward with trust. I would suggest that what is available within a hospital is a matter for the trust to deliver as opposed to the department. So, but I'm more than happy if the committee want to write to it, so we will take that forward with the relevant trusts.
Yep. Okay, thank you. And going then to June. Go ahead, June, please.
Thank you for your time, everyone. And I just want to say that I want to go back to communication, because communication is key right across the whole of the health service, everyone and the trusts. And I'm just wondering, I know Minister answered my question well, but I just wonder how long we've got to wait for appropriate information to make sure that all patients have appropriate and accessible information? And also, what are the departments and trusts doing to communicate with people whose first language is not English?
Yep, back to yourself, Mark. So go ahead, Mark.
Again, Chair, I'll come back with a detailed response on that. One of my colleagues, Colin Dunlop, who wasn't able to get onto it, dealt directly with that on my behalf. So if I can get back with a response to the committee on that, it would probably be more helpful than me trying to bluff my way, if I'm honest with you.
Okay, thank you, Mark, and we look forward to receiving that. Amanda.
Just two things actually. The first thing is, I hear time being bandied about as if a year, 2 years is tomorrow. But for a disabled person, that may be their only tomorrow. Please keep in mind, we are talking about very severely disabled people here, and you talking about training GPs in 2 years' time may be too late for some of us. I've also a question that there's evidence in Great Britain of blanket DNR orders being used inappropriately with disabled people during COVID. Is there any similar data, again that word, or statistics that show how disabled people in Northern Ireland were treated during the pandemic? Why is it that we can choose a DNR, we can choose to die, but we cannot choose to live? The consultant has the final say.
Good for you.
Thank you,
Well
Amanda.
done, Amanda.
Thank you. And Mark?
Actually, Chair, I can come in on that one. It's Gerald Cassidy, Director of Primary Care.
Go ahead, Gerald. Thank you.
Yeah, Amanda, I'm sorry, thank you for the question. I mean decisions of CARDO CPR are best made as part of a holistic approach to advanced care planning. I'm aware of the case from England, and my understanding from that is that whilst there was the Care and Quality Commission England published a report in March 2021, which highlighted a number of concerns in relation to DNA CPR. They found few examples of blanket policy, but they did recognise that in about a third of cases there was inadequate discussion with patients, and I think that kind of discussion and consultation is really important. You're probably aware we have out for consultation at the minute a policy in advanced care planning. That is looking to kind of really broaden the conversation around end of life care, around advanced care planning, and part of which is around the DNA CPR issue. It's any blanket approach to that would be unethical, and I don't have any evidence or any data to suggest that that has been the case in Northern Ireland.
Can I just say, from my point of view, I'm 57 years of age. I went into the chair when I was 50. I had never, up to the age of 50, been offered a DNR. So far, I've been offered it 7 times, minimum 7 times. There's something going on. It needs to be looked into.
Yeah, no, that's a crucial and a very well-made point, Amanda. Thank you. David.
David MacDonald, Disabled People's Parliament. Marcus, addressed to yourself and indeed to the department. I think the department might be in danger of being seen to put money out to private providers who are looking to make a profit, and ignoring how disabled people can help themselves. We don't just sit here and as groups meet with people, try and improve the lives of other disabled people and ourselves. We actually run our own services. We look after and employ PAs, be that with direct payments or be that with the Independent Living Fund. And I appreciate that money is tight, but I see no money going towards disabled people themselves to run their own staff. And I think the department needs to reflect on that, because when you do say you have no money, but 23 million is going to domiciliary care providers who make a profit, I think some of that money should be considered for disabled people who do not make a profit, who save the department money, and who look after ourselves with a wee bit of help. Mark, thank you, and thank everybody, Chair, Deputy Chair, for this today. It's been well worthwhile.
Okay, listen, thank you, and I want to very sincerely thank everyone for what I think, and include the panel, include the Minister, and in particular the delegates from the Disabled Persons Parliament and those who are here with them today, their PAs, family members in the gallery, and you all. I think it has been a very important day, but more importantly than that, a very productive day. I'm not in the least bit surprised about that. I have witnessed your calibre, your capacity and your ability to influence decisions around your own care on your own behalf and on behalf of other people, so that's of no surprise to me at all. My principal wish coming from this meeting is that this will no longer be an unusual or an interesting day in that sense, that it's just routine and regular and happens. In respect of that, I do want to very sincerely welcome the commitment from the Minister and the officials that they will open up an ongoing engagement with the Disabled People's Parliament, and I think that's appropriate and welcome and will be useful for all concerned. I think it's been a huge benefit to have you with us today. I want to thank each and every one of you for your time, for your commitment, for your preparation, which was very clear, had been in place, and I think made this a very effective session. And again, that doesn't surprise me in the least. So, Goramila Mayagov, I wish you and all of the people who you represent here today the very best in what are difficult times, but I know that you are leading in terms of addressing the challenges that people with disability face. We must do much better. I didn't get a chance to ask any of the questions today, but I do have some I want to ask in relation to European social funds, in relation to UN CRPD and how that's going to be implemented, but I will pass those on to the department via the clerk. But listen, Goramila Mayagov, Big Islan, please take care. Thank you.
Well done. Well done.
And members, we're going to take a short pause there and we'll resume our meeting at 11:30. We'll resume our meeting at 11:30. Thank you.
Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber. Programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound.
It's live now. Yep. So thank you, members, and we're going to continue then with the rest of today's committee meeting. And I just want to say before I move on that I want to very sincerely thank the engagement teams from both the Assembly here and the Disabled People's Parliament for putting together and facilitating what has been a very productive initial session with the Disabled People's Parliament delegates. I also want to thank the clerks and the team here from the committee for facilitating that. Okay, members, moving on to Chair's business then. In terms of next week, we are facilitating a very important and a very moving and informative art event here in the Assembly next week in the Long Gallery. I would ask all members to encourage their other MLAs, the ministers from their parties and party staff to attend that presentation. Lunch will be available from 12:45 and the presentation will be at 1:15, and I know myself and Pam Cameron have engaged with the group already, and we can assure you that that is going to be a hugely significant event from women presenting an art installation around secondary breast cancer and the issues arising for them. The other item that I want to touch, a couple of things I want to touch base on this week. I did attend an event yesterday where the Royal College of OTs, Occupational Therapy, were launching their report, and I have to say it just was another very clear example of the range of solutions and expertise that allied health professionals bring to the whole delivery of health and social care, and the importance of having their voices and their expertise included in the design and development of, and delivery of services. I also want to note the fact that the Autism Bill has passed its final stage in the Assembly. I think that's a bill we worked extremely hard on. We were delighted to be able to, I think, as a committee, improve even further that bill, and we look forward to seeing its implementation, improving the situation for those who are struggling with to get a diagnosis of autism, or who have received and then are struggling to get the services that are required. I also attended here in the building a launch of the BDA, the British Dental Association manifesto, and we have discussed that the fact that there are significant issues in dentistry, and I would like to ask members then if we should write to the department urgently to ask them to outline the issues around the impact of the recent statement that they have made, and how that's impacting on people's ability to access dentistry on an NHS basis right across our community, including out in rural areas. So we'll ask the department we'll ask the clerk to send a letter to the department in relation to that. And the final one that I just want to touch upon there was the Policy Forum event on mental health that took place this week, again underlining significant issues of concern around the provision of services for mental health and the deterioration in some regards in terms of provision of service to that sector. So thank you, members. I'm going on then to draft minutes at a tab of the 24th of February, which are tab 3.1 of the pack. Are members content with those minutes? Yeah, members content, thank you. I refer members to the draft minutes of the meeting of the 1st of March at tab 3.2 of the pack. Are members content with those?
Agreed.
Yeah, thank you. Pam, I see your hand raised there. Was that in relation to the matters arising? Or, well, I'm on matters arising now, Pam, but I see your hand raised there.
Yeah, Chair, I just wanted to come in just on a couple of things there you'd mentioned. I wanted to thank the committee and the members and the team behind the committee for all the work that they've done in terms of processing the Autism Amendment Bill. I think it was a very proud moment for us in the Chamber, being able to pass that piece of legislation, and something that should make an incredible difference going forward for the autism community. So I think, especially in light of we're talking about disability today, it's very appropriate that does get another mention. And just to put on record my thanks to all of you as members for your support in this bill, for the all party group work that has happened. And the other item I want to mention was you'd mentioned the BDA event, and I think there are significant issues with dentistry, and could we also add to maybe that communication with the department and ask for an update on what will happen with the follow time. Obviously, when the pandemic hit, it was 60 minutes in between those aerosol generating procedures, and then it was just substantially down to I think maybe 10-15 minutes, but it's obviously still going to have an impact on capacity and how dentists operate. So I wonder, could we just include that to get an update on where that is and whether that's going to remain for the foreseeable future, or if there's going to be any change, maybe on a UK-wide basis.
Thank you, Pam. Members content that we add that? Yep. Yep, members content, thank you. The other issue that I want to just flag up that we will be discussing in more detail, but just to flag at this stage, we have received some serious and significant correspondence from the Royal College of Nursing highlighting their concerns. We will be discussing that in correspondence, so just to flag that to members. So members, there are no matters arising then other than that from the minutes. And moving on then to our next briefing, which is a departmental briefing on Encompass. So I refer members to the departmental paper at tab 6.1 of the pack, and I would now like to welcome to our committee a presentation this morning Mr. Dan West, who is Chief Digital Information Officer, Department of Health.
Dermot and Dan, I'd sit in between Dermot and Dan. I'll sit here.
Sorry, Amanda.
Where do you want me? Do David, I can go wherever. Where do you want me to go? But I'm just waiting for you to get in the position.
You're waiting for him to get himself sorted out, Amanda, before you could.
You're bad, right?
Yep.
Oh.
Use that one, I'll get you another one.
I could put it over and use that square.
I'm going to sit in here. Oh, he's got one sitting here.
Okay, thank you. So we're joined by Mr. Dan West, Chief Digital Information Officer in the Department of Health, and Dr. Dermot Hughes, who is Senior Responsible Owner in the Ulster University. So I'm delighted to have you here today. This has been an issue of significant importance, and it's become routinely now mentioned around the issue of data, so it's good to see you here to brief the committee today, and we're delighted to have the opportunity to explore and drill into in some more detail the issues around Encompass and how it can benefit us and where it's at in terms of delivery at the present time. So Dan, I'll go to yourself then in terms of initial remarks, and if you want to make those, I'm not sure if Dr. Hughes is making remarks. If you are, then we'll go to committee members, and if we could keep the remarks as brief as possible, and we'll go to committee members for questions.
Brilliant. Thank you, Chair, and thank you, committee members, for the opportunity to come and talk to you on this topic today. Members should have received a document in your packs for today that we'd submitted last week that sets out the goals of the programme and what it means for people in Northern Ireland, both our service users and our staff, as well as some of the benefits in our delivery approach. I'm going to share the opening remarks here with Dr. Hughes, and together we're going to summarise some of what you've already read, posing and responding to 4 simple questions. Why are we doing it? What does it deliver? How are we approaching it? And when will it all happen? So I'm going to start with the why are we doing it question, and I'm going to open with a little bit of our strategic context. And I don't think it's necessary to rehearse for members all of the detail in the strategic backdrop, that being the Donaldson report of 2014, the Bengoa report of 2016, and then the sectoral strategy Health and Wellbeing 2026 that was launched in 2016. However, just to put Encompass into a bit of context, I'm going to draw out 3 challenges that you will all recognise. A rapidly ageing population that brings more complex needs. So by 2039, the population aged 65 and over will increase by 74%, and over 85s will increase by 157% compared to 2014 position. And by the age of 70, nearly 80% of us will have one or more chronic conditions, and by the time we're 80, nearly 2/3 of us will have 3 or more chronic conditions. So my second point is about health inequalities. Despite living longer, health inequalities continue to divide our society. While overall people are living healthier lives, socio-economic determinants still influence health outcomes. Life expectancy for males in the most deprived areas of Northern Ireland is on average 7.5 years less than their counterparts in the least deprived areas, and the most deprived areas also experience higher prevalence of mental health and higher rates of suicide. And my third context point is about increases in overall demand and changing expectations. So the increasing prevalence of lifestyle diseases increases demand on the HSC. The ability to offer better, more sophisticated treatments increases demand, and the ability to offer people a better, longer quality of life also increases demand. So the way that most public health economies are currently dealing with these challenges, this rising demand, is in a linear fashion. The more demand there is for services, the more financial and human resources are needed to meet that growth and demand, and this is clearly unsustainable. Every health economy globally needs to find ways to break that linear relationship between demand and supply. And while digital technology is not the only jigsaw puzzle piece, there's growing evidence that it's an important one. The Encompass programme, our flagship investment amongst a portfolio of digital programmes and projects that addresses this opportunity and enables delivery of the transformation strategy for health and care. Dr. Hughes will talk in more detail in a moment about what the Encompass programme is seeking to achieve, but at a high level, the business case focuses on 4 things: patient safety, quality and efficiency, rising demand and constrained resources, support for regional reform and urgent ICT replacements. In my role as Chief Digital Information Officer for the sector, I'm going to add a 5th driver, which is to support and enable innovation and research through better quality data and more mature information systems. Dr. Hughes will pick up the second question here about what it is that we're doing.
First of all, thanks for giving us the opportunity to talk about this. Encompass is not simply an IT project. Encompass is an IT project that enables transformation. It's a unique implementation. It includes acute care, mental health, and social care. How we deliver it is that we agree standards of care for all patient pathways of care, be it social care or acute care. We do that working with trust members and HSC staff in general. Our first step was in September, where we had 5,000 staff for the engagement piece over 3 days. And then the next step was we formed what they known as e-design groups, where we detail all the patient pathways, and that's done by staff members across all of Northern Ireland. So we have one solution for all of Northern Ireland, and that's followed on for the next stage, which is going to start in what has started on the 1st of March actually, where we have 3,000 people going into focus design groups, where we go into the detail of every care pathway. So if you go into the community, there's 1,400 care pathways, and that will be replicated in the acute sector. The really important thing is that if we standardise against best practice, we will get evidence about how people have been treated, if they've been treated, and the quality of treatment. This will be near real-time data. Northern Ireland is plagued by not quite knowing what's happened and having retrospective look-backs. This will transform how we manage outcomes and how we manage services. It will mean that we can transfer people to separate areas, but the standards of care will be identical and the processes of care will be identical. The really, really important thing about this, and it's unique to Northern Ireland, is that it includes social and community care. It will derive the health outcomes based on socioeconomic data, and it will transform how we commission services. Currently, if you're in social class 1, you have really good outcomes. If you're in social class 5, you're not so lucky. And people should not be dependent on luck for their healthcare outcomes. And this is a way to transform what we do and how we do. So we can shape how we deliver care, but we can shape how we commission care.
Brilliant. So how are we doing all of this? I think Dermot's actually touched on a few of those points. Using evidence of what's worked elsewhere is the first point. Partnering with this company, Epic, who are bringing us their software tool and learning from their experiences and methodology, developed over 500 large hospital deployments in the US market, now 6 NHS hospital trusts that use the same system, and a number of regional deployments, including social care across Europe. We're going to use a foundational system built from those implementations, including those NHS trusts, to start with a tried and tested best practice and tailor it only where required for Northern Ireland specific requirements. We're building a large, clinically led, multi-professional blended team across the core programme, importantly the trusts and these guys from Epic. And I've got some numbers on the number of resources if it becomes relevant to dip into that in due course. We're going to work really closely with the trusts. This is a key point. It's not a programme being done from the centre to the trusts. This is something that the trusts are going to be pulling through, given the benefit to them and their service users. And all of that is based around clinical and operational input. And there are large numbers of staff that have already engaged in those processes that Dermot was just describing. And we're building a large governance and decision-making apparatus that puts the design of end-to-end services into the hands of these clinical staff, social workers, nurses and midwives, pharmacists and allied health professionals. And we'll finish up just in our opening remarks in the evidence session with a little bit of a view on some of the dates. And I think, Dermot, you're going to pick that up. When are we delivering the programme?
Yeah. To date, we're in the initial phases, and we hope to do the first implementation is due for post-summer in 2023, and we're going to do it stepwise, by trust by trust. We have an end date of the end of 2025. That will not change. We have legacy systems that need to be replaced. The programme is replacing 70 systems. So we have a set end date, and it's, as we learn as we go along. It's an iterative process, though, that if we learn something new, it will be applied to all the trusts as we go forward. And we leave a period of 6 months at the end to optimise the systems. So it's quite a unique implementation that elsewhere it's normally been done onto one healthcare system. There's a whole province, and of course it's unique because it's the community. The other added benefit that we're going to implement is a thing called My Chart. It's a patient portal where patients have access to their own notes, records, results, and that will be in a structured way. So it empowers patients, and it changes the relationship, I believe, with healthcare professionals and patients attending. And so that's a cultural change, and I think it's an important cultural change because my personal view is that healthcare can be patriarchal at times and not open and transparent as it should be. And this will be a radical change, and this is a challenge as well.
Okay, thank you. And I suppose it is certainly something that we have sort of from the very outset of the committee looked at as something of huge importance. We've discussed now earlier today the issue of data collection here, the issue of how we capture. So the data is flowing through the system in every health interaction there is. It's a question of how we're capturing it and then how we're analysing it and breaking it down. So I suppose it is disappointing that it's not further along the pathway. And I note that you said there, Dermot, around post-summer 2023, but there had been a previous indication that the South Eastern Trust, and this was a department press release, the South Eastern Trust will be the first trust to go live in 2022. So why has the programme not met its dates in relation to that, and how many delays have there been in the programme?
There have been 2 delays in the programme, and they have been related to availability of staff. While you can build the IT system, if you don't have the staff intelligence and the staff knowledge about the pathways and how you build it, you will not have a meaningful system. So that during the COVID pandemic, we could not take the risk of removing patients from frontline staff to do this piece of work because the numbers of staff we're removing at any one time, 5,000 for the engagement piece, 800 for the EDG group, and then now we're doing 3,000 staff. And to get people to focus on the future when we're dealing with the pandemic, we had to make a decision. What was safe was in the best interests of patients, and the delay was the best interest in patients at that time. Post-pandemic, although we're not quite really post-pandemic yet, staff are in a different place and ready to move on with this. It's a substantial piece of work and a substantial ask of the clinical staff and the social care staff to give up their time and to agree against international best practice and then build that into a computer system. So it's not a simple task, and it's not an easy task, but it's a really worthwhile task. I think the delays, while disappointing, are understandable, and I think in the best interests of patients at that time, given the state of the health service.
And so you've dealt with the post-pandemic ones. Were there delays pre-pandemic that have impacted on the rollout?
No. So there's the 2 delays. The first one was decided upon in early 2021, and that was a delay of 6 months that accumulated as a function of trying to launch the programme in the course of a global pandemic, wave 1 and wave 2 of the pandemic in Northern Ireland. We then, when Omicron was upon us more recently, it was clear that we weren't going to be able to attract in the design phase that we were in at that point in time, earlier this year and kind of tail end of last year. We just couldn't bring clinical staff out of frontline facing clinical roles into this conversation about the future. It wasn't practical. And frankly, if we tried to do it, it wouldn't have been safe to then deploy a product that came out of the back of that because we didn't have a consensus on how we wanted to engineer these pathways of care in the future. So we took a pause in concert as a kind of senior level decision in the department with the Chief Medical Officer and others for 7 weeks, basically January and February. We are dealing with now a replanning exercise that handles the repercussions of that delay on the programme and all aspects of the programme ranging from buying the infrastructure. There are global supply chain delays on all IT infrastructure as a function of what's happened in the world over the last couple of years. So we have to bake that into a replanning exercise that's going on at the moment. The programme board decided just last Friday that we'd be going for a post-summer date, and that's the second official delay in the programme. And we're finalising exactly what that means. It's probably a September, October date for the first go live next year.
There's a delay, but not the end. The end date will stay the same.
Okay, and if you could come back to us with an update on that when you've completed that analysis of that.
Absolutely.
That'll be useful, Dan. The second one was then that I wanted to ask you in relation to engagement. So how are you facilitating the patient voice in relation to that? And we have had a very useful session this morning with the Disabled People's Parliament as one example of people who are obviously have a very huge vested interest in good data and data available in a way that improves services. So how have you been engaging, and what are your plans for engagement into the future and throughout the rollout?
So during the earlier stages of the programme, where we were designing what this programme was about and choosing in particular the product, which has both the staff side functionality, but also, as Dermot mentioned a moment ago, there's this portal that we would offer to patients, and they can book appointments, interact with their healthcare professionals, receive test results, and also receive coaching and guidance.
I'm referring to their input into designing the system rather than using the system.
Got it. So the reason that it was important to involve them in the selection of the product was to make sure that we had their opinion. So the Patient Client Council was engaged, and they provided a number of citizens who came and sat in on those early stages of the programme. That's become more challenging recently. Our plan is to review with Patient Client Council continued citizen and patient involvement in the programme during deployment. At the moment, we don't have a great deal of patients involved right now, although in previous stages of the programme we have had heavy patient involvement in decision making.
And why wouldn't you have them throughout?
The ability to provide patients into meetings and boards has been very difficult during COVID.
What about Zoom, Dan?
Yeah, there's loads of techniques.
You would expect the department's tech guru be able to involve people through the medium of Zoom, if nothing else.
Got it. I'm not trying to defend where we are. The place that we're in at the moment, just being completely honest with you, is we don't really have a great deal of patient and client involvement in the programme processes today, and we're not happy about that, and we're going to do some work to make sure that we correct that.
Yeah, it shouldn't be. It needs to be absolutely intrinsic. It shouldn't be an add-on.
I agree.
We fully take that on board. We do interface with many of the networks who have patient representation, but I believe my portal, the patient, my chart, the patient access point is so critical that really needs to be patient designed. And
actually,
that.
that's and I make this point all the time. That's not solely, although it would be to patients' benefit. Actually, the greater beneficiaries of it would be yourselves. In realising what the issues are, how to navigate around them. So that's the. Okay, listen, so I do welcome that commitment, and I would like to see some detail maybe presented back as to how that's going to actually happen.
No problems.
On an ongoing basis, and to be an intrinsic part of that process. Okay, thank you. The final one for me then, before I go to members, is around cost. So what is the expected overall cost at this point in time? What have been the cost to date? And how much money has been paid out to third-party consultants at this point in time?
There's a table in the pack, so rather than read out a load of figures for you, I would refer members on that question to the table in the pack that shows the overall budget, and we'd split that capital and revenue. The total budget from a capital perspective is that 261 million number, and the total budget from a revenue perspective is 224 million over the project life cycle. You can see the amount of spend that has been occurred to date over the couple of years that we've been running the programme. That's in the table as well. The exact figure that we've paid, splitting it up to external versus internal costs, I'd have to get back to you on that. I don't have that at my fingertips just now. Okay, and that was so. Okay, well, listen, do come back to me with that. And it's worth, I guess, being clear. Sorry, in your question, you talked about external consultants. So we don't have external consulting resources doing management consulting on the programme. We have a staff substitution arrangement where there are external parties who are providing us resources on a staff substitution basis for staff that we are unable to attract and recruit within the programme. So there is a bit of a distinction, given the approval process for management consulting is different than a staff substitution approval process. But I'll split it out so that you see what we're paying to Epic, the software vendor, and what we're paying to external parties that are helping with programme delivery.
So are you saying essentially you're using an agency arrangement to backfill staff who are working on this programme? Is that what?
Yes.
Okay, so if you can give me the cost of that to date and the predicted costs for that. Thank you. Okay, thank you, Dan. Thank you, Dr. Hughes. I'm going to go to members now, and the first member I have then is Paula. Go ahead, Paula, please.
Chair, would you come back to me at the end? I've got a big long list, and I'm hoping other people get to my questions first.
Okay, so I'll go ahead then to other committee members. Now, I do see Pam's hand raised. I'm not sure if that's from previously. But Pam, do you have a question, or do you want to come in at this point, Pam, with a comment or question?
Yes, please, Chair. Thank you. And thank you, Dan and Dr. Hughes, for your attendance today. I've been waiting for this presentation for a considerable length of time. I've been bleating on about hearing more about Encompass, so very welcome and thank you for the information provided. This is, I think, an exciting project, and it's something we want to see. And I am disappointed to hear that the project has been delayed twice, but obviously we are where we are, and the pandemic has had a very negative effect on so many areas. It's just unfortunate that whilst our waiting lists are rocketing through the roof, that the one thing that could actually help in terms of transformation is this Encompass programme, that this too has been delayed because of the pandemic. So it feels like we're running around in circles at times. But I wonder, could you answer a couple of questions and then maybe give us some practical examples of the outworking of the Encompass programme? So I wanted to ask, first of all, why the South Eastern Health and Social Care Trust was selected to go live first. And if you could talk to us about if there are working estimates of roughly how much staff time will be freed up as a result of the new digital solution. And could you also tell Encompass will be agile enough to flex to whatever transformation agenda is agreed by a new executive coming in the new mandate? And then in terms of the practical working examples, if you could talk us through what it would mean practically for a patient on the ground, and maybe give us another example, for instance, a social worker, what Encompass might mean for their workload, because we hear often about how they are bogged down with paperwork and don't actually have time to do their trained professional work because of that. So if you could talk us through some of those issues, please.
Very good. Thank you. I'm going to split those 4 questions up. I'm going to try and tackle the first 3, and then I'm going to go to Dr. Hughes for the last one about sort of worked examples and what it means from a social care perspective. One of the questions that we had prepared an answer to, because we thought you might ask it, is how is this investment actually going to help with the macro level problems in healthcare, like, for instance, waiting lists? So I think some of what we'd prepared there might actually be quite interested in responding to that. So why the South East Trust? They're not the biggest. Going for Belfast first, based on the guidance that we got from experts and the company Epic that we've brought in, is don't go for your biggest trust first. So that put Belfast something other than first. The advice was probably go for your big one second, because you've ironed out some of the kinks with another trust, and then you get the big bang for your buck by rolling out in the big centre, which has the tertiary services like the Belfast Trust. The reason that we chose the South East is because they fit the characteristic that I've just described, and they volunteered to go first. So as simple as that, and they are pretty technologically advanced as a trust, and they were enthusiastic and ready to embrace the change and embrace the challenges that this change brings with it. On how much we are able to liberate in the efficiency that the system will bring, the benefits are a combination of, in the business case, cash releasing benefits, and then capacity benefits, so capacity that will be liberated within the system that won't be cashed out, and that annual benefits profile, both across cash releasing and non-cash releasing, is 77 million. About 5 or 6 of it is the cash releasing bit. So just in the interest of rounding, let's say about 70 million's worth of capacity benefits within the system across the 5 trusts is what's described in the business case, and the challenge then for the programme team and the trusts to deliver, to liberate that capacity in a way that's meaningful in terms of addressing, you know, the big challenges and problems within healthcare in Northern Ireland. On the third part of your question, the agile transformation agenda, if the new executive decides that we need a new strategy for transformation of health and care, is the platform scalable and flexible in a way that would allow us to bend to the needs of a new transformation agenda? Yes, in theory, what we're building is a platform that allows us to collect better data and collect better data better for in particular, our staff members. And that's a good thing and would underpin, at least from my perspective, any transformation direction that we take in the future. But it's a bit difficult to say definitively until we see what the new transformation objectives and priorities are. I'll hand to Dr. Hughes for the fourth part of your question.
Thanks very much for your question. The principle for social care is actually the same as all pathways that we're discussing. The process is about getting staff together to agree Northern Ireland-wide pathways of care, and that's benchmarked against best evidence, NICE or other national guidance. And the process is not simply about replicating what we currently do, because obviously what we do currently sometimes isn't productive and doesn't work. It's about streamlining what we do. It's about making it a system that supports, a system that reduces the onerous paperwork. And we've evolved into situations where the paperwork is so onerous that it prevents the care, be that social care or health care, and that's what we want to strip out of the system. We want to have an intelligent system that gives aids, hints and reminders, and we want to change our interaction with our patients, especially our social care users, especially through the MyPortal process, where people can seek advice intermittently at distance as well as having face-to-face visits. I'm very conscious of the social care aspects, because people are so busy doing their day-to-day job and the onerous paperwork that sometimes the change could be challenging just to free up time to do that. But the service will not improve unless we go through that process of agreeing what's necessary, what's unnecessary, what documentation is essential and what's superfluous, and building in systems that actually make that doable and achievable.
Yep. Pam, go ahead.
Thank you for your responses there. I wonder, could you then tell us a bit more about how, obviously this will be huge change, and whilst I'm complaining that there's a delay, it's also not too far away from starting, and you know, it's a year and a bit away, and that's very exciting. But it'll also be very new. It'll also be a huge change for patients and staff. So, you know, how will that training be rolled out, and how will you communicate the huge change, huge cultural change you've already alluded to, for both patients and staff in the use of this new system?
Yeah, I think the first thing we do is we collect the intelligence of implementations to date. We look at where it's gone right and where it's gone wrong. We're very upfront and clear with staff, the areas that we need to make sure that are addressed in advance. I think the training is the sort of primary factor that, around the system EPIC. They train people individually. There's an accredited programme, and you have to achieve competencies before you can use the system. But as well as that, they have a super user programme, and we try to have maybe between 1 and 4 to 1 and 6 people trained up in this super user status. So it means that if you're on the ward or if you're in the operating theatre, you're sort of have an expert at elbow's length, so that you're never left struggling with the system. That there will be a downturn in productivity at the process of implementation, and we have to understand that and manage that very clearly on a day-by-day, week-by-week basis. The good news is that once you use this system, you have day-by-day, week-by-week data to measure and monitor, and then that comes back. the important thing is not only must it be safe for staff, but it must be safe for patients using the service at the time of implementation. So we have to put checks and balances in, and perhaps maybe reduce outpatients for a very short period of time, so that when the implementation happens, and we're very conscious of that. The other good thing about doing it in Northern Ireland in a stepwise fashion is that we can learn from trust to trust, so that we can have a range of super users ready and willing once the first trust go in, but they will have some experience in working in the first trust.
Yeah, I would just add to that the super user training and training is such a huge part of the deployment programme, and it's a very large part of the investment. Getting everybody accredited and comfortable using the application is going to be one of the key things. There are very personalised bits of training that we do, particularly for senior clinicians, medics and other professionals, where we don't just teach them in a classroom how to use the application, but we actually work with them to figure out how best they want to interact with those services. So it's a very personalised training approach. And then there's something called at-the-elbow support, which is really important. So you can sit somebody in a classroom and train them about an application and all of the different things that it does, and it may then be a number of days or weeks before they actually need to use it to do that thing. So really crucially, they either turn to a super user, or there'll be floor walkers at the elbow support that can drop in and say, look, you might have forgotten exactly how to do it. Let me remind you, and work through what's the best way to do that. So a combination of mitigations in this great big business change program that we're running to make sure that people are comfortable and content to use it before we press the go button on a trust-by-trust basis.
Okay,
thank you.
Okay, thank you, Pam. So I'm going then to Carol and then Colin.
So nice to meet you, and thank you, Carol Mugget. In relation to, so in the department's press release, it said there was 300 million of ICT investment over 10 years, and it'll create around 200 jobs. So additional jobs. So it's not to backfill from what's there now, it's additionality. So my first question is, what is that additionality? Is it all agency staff? And how are they all recruited? So if you could answer that. My second question is this. So in terms of procurement and tendering, what procurement exercises, tendering and commissioning have taken place to ensure that there's openness and transparency around all this? So if you could just answer those, and I'll come back to my third, which is very small. Thank you.
Okay, perfect. So our plan is to recruit resources as either permanent or temporary HSC staff members into the programme team. And as you say, the number's about 200. It's actually 231 at peak.
Okay.
So there's 162 resources at peak in the regional programme team, 44 in the trust side programme teams, and then 25 professional leads, 5 across each of the 5 trusts. So that's a total of 231 at max. The plan was to have those 231 all be permanent or temporary staff members. Our recruitment has not allowed us to appoint staff members at the rate that we need to based on Plan A, which is all of these people being HSC employees. So as a tactical decision last year, in order to maintain momentum on the programme, we've brought in these external agency workers to come in on a temporary basis currently. And that was a tactical decision just to keep the thing moving, because recruitment's been particularly challenging during COVID. It's particularly challenging all of the time at the moment, let's be fair. But it was really difficult during COVID for people to think about coming out of frontline roles and coming into a programme which isn't about the day-to-day of management of the burden of the pandemic. We are working through the recruitment plan to try and attract these resources on a permanent basis, and therefore reduce over time our dependency on this external agency approach that we've used at the minute. So that was the recruitment question there. On procurement, the programme is working alongside PALS, which is part of BSO, the Procurement and Logistics Service, which is the Centre of Procurement Excellence for Health and Care in Northern Ireland, that takes all of the Northern Ireland-wide procurement policies used in government generally and applies them in the health and care sector and brings the procurement expertise to programmes. And we have followed the kind of due process and policy around how you would buy software through using well-trodden publication of RFIs and associated documentation to receive bids from vendors in the marketplace. I don't know whether that actually answers the question that you're seeking.
No, but we can follow up at the end, rather than hogging this, we can follow up at the end. My last question is just the small one is, have you briefed the Permanent Secretary, and will you be briefing the Permanent Secretary when the Assembly is dissolved until a new Minister is put in a new mandate?
Yes, our Perm Sec is well briefed on what's going on the programme. And yeah, we'll continue to do that.
When was the last briefing with the Perm Sec?
We met with Richard a week last Friday.
Okay. Thank you, Chair. I'll follow up at the end.
Thank you, Carol. Going across on the video screen then to Colin McGrath. Go ahead, Colin, please.
Thank you very much, Chair. And I suppose you'll have to get a new Permanent Secretary up to date if what was announced last night is to be implemented. I suppose, Chair, I suppose these questions are maybe a wee bit more about the practical side of this project. And what I was thinking of is, there's an opportunity for people to be able to interact and book appointments and do other bits and pieces as part of this project. And I was just wondering what consideration there would be, A, for people maybe that aren't able to avail of technology, and then B, about maybe where the services might break down. Is there a backup plan or something that's there to be able to step in place if things shouldn't work? And then we did see in various places in Europe, and I think in the south, about where cyber attacks can come in and people's information could be garnished. So I'm just wondering what sort of inbuilt protections there are on those fronts.
Okay, so I've got backup plan and cyber attack as two questions. There was something at the start of that about how people would interact and book appointments. Could you just clarify the question that you're after there, please?
So just when this system is up, is there will there be interactions for patients, for example, to be able to use technology and use the system to book appointments or to be able to avail of services? And it's just what would happen for those that aren't au fait with technology? Will there be alternative routes or for them to be able to access services or access their information?
Yeah, I'll take the first question. The My Portal or the My Chart, patients will be able to access and book their own appointments. The caveat is if the people are not comfortable with digital, the normal service will stay in place, and that's our standard of care. The digital access means that people should be able to book and choose, and as we have standardised care across Northern Ireland, you may be able to book and choose in different areas, and that's part of the transformation programme that this will enable. People will have standardised access pathways for all care. If they're going for surgery, they'll have standardised pre-assessment across Northern Ireland, so that will enable more efficiency in the system, a more flexible system. But we're very conscious that not everybody's IT enabled and not everybody can access the system that way. So the old-fashioned way or the current system will still exist.
And then on the two other parts of the question, the sort of business continuity implications of implementing one big system to support business operations. So there is already business continuity plans in place in each of the organisations in health and care, as you would expect. And that surfaces in the Joint Emergency Response Plan in the event that there is a business continuity impact across multiple different organisations, as we have seen recently with the pandemic. Those plans, both at the individual organisation level and at the Northern Ireland-wide sectoral level, deal with what to do in the event that there is an outage of one or more IT systems that means that there's a loss of functionality and data to support delivery of clinical and operational services. I think the point you're making here is, given that we are buying this one great big application that's replacing lots of other IT systems, have we thought about any enhanced risk that brings in terms of our business continuity plans and the overall Joint Emergency Response Plan? It's a good point. I'll go away and work with the team and just make sure that we haven't forgotten to go back and just check the business continuity documents. I don't know definitively the answer to that, but I think it's a good question, so we'll take it away. The infrastructure that we're building for supporting the application, recognising how critical the EPIC system will be to healthcare and social care in Northern Ireland, we've designed it in such a way that it's got all of the fail-safes that you would expect from a modern IT system. So we've got, not one data centre that might have a problem. We've got 2 data centres and replication of the data across those 2 data centres and all of the associated infrastructure resilience that you would expect at the network level. So all of that has been designed in. I can give you assurances that that's how we're building and buying the technology. Cyber's another really good question, and actually has a relationship with business continuity and the Joint Emergency Response Plan. Obviously, these are sort of adjacent to one another. The infrastructure procurement and configuration part of the programme that I've just described briefly in relation to business continuity, that is being done in accordance with our policies to reduce and avoid the likelihood of cyber attack. But the cyber threat landscape in healthcare economies around the world isn't just about our systems and data. The biggest threat vector for cyber attack these days is human beings. And people responding to spear phishing attacks from cyber criminals that would then give them access to networks where they can secure privileged account details, log into Active Directories and breach an Active Directory, which is part of the issue that happened in the Republic of Ireland recently that's been so detrimental to health and care services there. So what we have in Northern Ireland outside the Encompass programme is a portfolio of digital investments that includes a new cyber investment where we're going to be building some new technologies and also focusing on the human aspects of cybersecurity with training and phishing attack synthesization and all of those kinds of things that help people to realise that they have an accountability and a responsibility around privacy and security of data. So that programme is a separate part of my portfolio of investments and is key to making sure that all of our applications, including the EPIC one, are safe and secure.
Okay, really interesting, and thank you for the answers, Chair. That's grand. Thank you very much indeed.
Yeah, and just picking up on that issue, and I'm not sure if it was fully covered, but in terms of the outdated system, some of the systems being outdated and the transfer across, has that an impact on patient delivery of care, or how is that going to be managed?
Is the question about migration of data and functionality from existing systems to the new system?
Yeah. And the fact that, as you say on your website, that many of the existing systems already are outdated. So how's that migrating across?
So the programme includes migration of data to make sure that we have all of the information that we need to continue to provide patient care, and migration of functionality from one system to another system as part of the training exercise and our go-live preparations for each of the trusts to make sure that if you work in radiology, you know what part of the EPIC application is going to replace what part of your current systems, and the same logic applies to all medical clinical disciplines. The reduction of risk is part of the programme plan and methodology that we're bringing from our vendor, who's done this hundreds and hundreds of times across large hospitals around the world. And Dermot mentioned earlier that we are expecting some productivity reduction.
Vendor.
What?
Vendor?
Vendor. Yeah, vendor.
Yeah,
the vendor.
And what is their input?
The plan that we're using in the programme, the basis of the methodology for delivering this new application comes from EPIC, which is the vendor. Yeah. They've done this hundreds of times.
Okay. The vendor, yes,
yeah,
sorry,
vendor,
I misunderstood. Sorry.
That's my funny accent.
Go ahead.
Sorry about that.
That's fine. Okay, thank you, Dan.
Did you want to come in on any of that, David, particularly about productivity?
Yeah. Okay, so I'll come back to you, Paula.
Okay, thank you, Chair, and thank you. Okay, my first question is in relation to inter-family linkages, and is there the opportunity within this system to call forward for screening those people who would be genetically more disposed to certain health conditions? First question. Second question is in relation to the yellow cards. when I've supported patients to the management or leadership of the Department of Health around hernia mesh implants, for example, they said they just didn't have the data around where there had been complications, and I'm just wondering to what degree will this system allow patients to feed in any complications they have with the treatment? Third question is in relation to support for self-care. During the pandemic, I found sending people the link, for example, to the Royal College of Midwifery's advice on handling COVID. To what degree will there be parts of this portal that you will actually direct people to external sites? And finally, you mentioned there, Dr. Hughes, all care pathways. You'll be aware that there's disparities in some care pathways, for example, ME. And to what degree will this actually flag up where there are deficiencies in postcode lotteries in terms of care pathways? Thank you.
Do you want to pick those up?
Yeah. So start at the back with care pathway. Before I did this job as the medical director of the West, but before that it was the medical director of the Northern Ireland Cancer Network, and part of that work was about making sure people had a standard of care, because there's disparities hidden throughout the health and care, social care system. And part of this process, and probably the most important part of this process, is the robust discussion amongst staff to say what is the way forward for Northern Ireland. So there will be one standard of care for all patients for specific disease, and drive that variance out, and make sure that it benchmark it against international best standards. So that will be embedded in the system. So it's not simply a system to record information, it's record every step in that patient's pathway, so that you can get assurances and you get real-time data to ensure that that's happening. So that will be addressed. The issue about the yellow cards, that's a part of the safety issue, and so, some of the data that we sent out in the pack freeze has some figures from there about medicines, complications, and how that data is collected.
And will there be transparency for the patient around that? Because, in terms of informed decision making,
Yes. Yeah, it will be transparent, because the patient will have access to their notes through my patient portal.
Sorry to labour this, Chair, but part of the issue is that if somebody then is sitting with their consultant and saying, here's what we recommend your treatment pathway, then somebody else could, so they could then look to see what other people's experience has been of it, for example. And that's the issue, because they just didn't have it hadn't quantified how many people had actually had difficulties with that certain procedure, for example.
Yeah, the system has great ability to collate data from multiple people, and that will be part of the information they collate. You're talking about the yellow cards that are currently filled in by hand when there's a side effect from medication.
Yeah, but I'm saying not all patients are aware of that system and stuff. So it's more that somebody can say, going into my charts, I'm having difficulty with this and finding, isolated pain or, trouble sleeping and stuff like that. It's really just to give feedback in terms of what complications there are for surgery, for example.
The patient portal will give patients, clients and their carers access to information about the patient that actually currently is really hard for patients to get access to. That will allow them and kind of galvanise them in their care continuum in a way that we haven't been able to before. Not everybody will be able to avail of that or will want to. Some will want a more traditional relationship with their healthcare professionals, and that's fine too. But those that are a bit more digital enabled, and actually last time I was here we were talking about the Stop COVID app. So there are people in Northern Ireland, there's a growing evidence that lots of people in Northern Ireland do want to interact with healthcare services digitally. That will improve their experience. If there are contraindications about medication, the yellow card process and submission of that back to the Medicines and Healthcare Products Regulatory Agency isn't really in the public consciousness. I think some people understand that, many people don't. The informed conversation between a healthcare professional and their patient is going to be better because there's more availability and access of information. It's not going to be a panacea for appropriate recording of yellow card type information through that interaction, but it's down to the healthcare professionals to make sure that they're capturing and then submitting that information in an informed way, would be my view. And I think there's a similar question here about the point you made about signposting of people to information resources outside of health and social care offered communications platforms like the Health and Social Care Board website, for instance. The portal isn't going to proactively signpost people to other resources, but I think there is a broader sort of communications opportunity. where we can have a single place for people to go that sits alongside the patient portal, which is where they access their data and information, where we can provide links to useful resources and signpost people to the Royal College of Midwifery if there's good advice and guidance there. But I don't think that's, well, I know that that's not part of the Encompass programme scope at the moment, to think about that broader communications opportunity. It's a good thought, and I might have to come back to you on what collectively we want to try and do with that.
I just think self-care, obviously, we don't have all the resources to deal with it. I think the last one was around inter-family linkages in terms of patient records so that people can be identified earlier.
So it's technically possible to look at family relationships in the application, but you've got to be a little bit careful here about consent and information governance and privacy. So you will use healthcare information stored within the system to provide primary healthcare services to an individual based on the consent that they provide for their information to be stored within the application. You need to think about how you then create that consent model for identifying individuals based on a family linkage that you hold within that system, to then go and offer them a service or interact with them about their healthcare needs. And that question actually came up this week. We'd need to look at that from an information governance perspective as to how we would try and have that kind of propagating family linkage done within the application. Dermot, do you want to come in on that?
No, I mean, I think it's a very important question, because with growing molecular technology, this will become a bigger and bigger problem, and it's how you share data appropriately with consent in the electronic system. It's a very unidirectional process. It's your record, it's your consent, it's your information, and it's more of a legal construct around it rather than an IT construct. Sharing the data electronically is probably not difficult. It's getting the legal structure around it is the important thing.
Okay, as long as it's on your radar. Thank you. Thank you, Chair.
Thank you. Orlia, go ahead.
Thanks very much for your presentation today. So my first question was around, you mentioned earlier, around the 2 delays during the pandemic, and I'm just wondering, was there a cost to those delays? So has the cost increased to implement the Encompass programme as a result of the delays that you have undergone?
Not currently. As I said earlier when we were talking about the second of the delays that we took recently during Omicron, we're still dealing with the repercussions of that. And we've got the programme board just last Friday aligned around the need to move the date to incorporate the Omicron slippage, as well as other delay factors like the global supply chain for infrastructure implementation. That date, the new date, September, October probably, is going to allow us to do a reprofiling of the finances. We don't currently think that we have breached the original approved spending envelope. We're just moving the dates around and thinning out some of the activity that's been going on, particularly during the pandemic. But we'll know that in due course. I've already agreed to come back to Chair with the confirmation of that plan date. So maybe once we've done that financial reprofiling, I could perhaps include that in a briefing for you guys.
Yes,
the contract with the vendor, it wasn't lump sums every year. It was based on time and materials. So as the workflow decreased, their cost decreased. So that was a bit of the protection when there was a downturn in clinical work.
Yep, no, and those updates would be great, because I know in previous sessions that we've done around the budget, and obviously the significant investment that's gone into the Encompass programme, it would just be obviously beneficial to be utilising all of that towards a programme. So, any other money, as you know, there's 1,000,001 things that we need to be investing in alongside it. But yes, that would be much appreciated then, a wee update on that. And then I was just wondering, I can't remember who raised it earlier, but you were touching on then, so the training for the staff when the programme is up and running, and then also then giving people the ability to go online to make bookings or whatever way that process will work out. And I'm just wondering then, so aside from the training of staff, is there going to be any sort of public PR element to communicate out to the wider population so people are aware of the consent issues and the sharing?
We're just in the process of launching a website, and that's a public-facing website in the first instance, and we will put out extensive information and training on that. Obviously, we can't train one-to-one the population, but we believe there's quite a lot of digital intelligence in the community, and that we will provide supportive information in that way. Certainly, we invest heavily in training of staff, and part of the roles that some of the implementations have done, when people have changed jobs, they actually take that role on to train new staff and train members of the public who so wish to learn that when they're up for their appointments, and we can do innovative things like that.
No, that's really helpful, thank you. And then just finally, so you'll be aware that there's obviously work underway at the moment to create a regional mental health service. And in some of the discussions that I've been having with some of the individuals and the groups that are involved in rolling out that regional sort of model, there's been some talk about, you know, like their input into then how the Encompass programme will be rolled out. And I'm just wondering, so how you are finding, you know, the different input from the different sectors, and are you encountering any challenges in terms of, you know, will this Encompass programme share information between statutory, community and voluntary, primary care? Is it right across the board, and how you're sort of getting a feel for all that, how it'll work out?
The information will be available in primary care on a read-only basis. They can't amend it. Sharing with statutory bodies is again, that'll be in the same basis. Sharing with voluntary bodies is more of a challenge, and in voluntary bodies are so important in mental health as opposed to maybe acute care or other sectors of the healthcare, and that's something we're trying to work through at the moment, whether we can accredit them and give them read-only access, but that we haven't resolved that at present.
Okay. No, thank you very much.
Thank you very much.
Okay, thank you, Orlia. Yeah, thank you, and that's interesting. And I think I don't have any other indications from members there, but it is one that, and it was raised earlier in the session around the need for data to be human and qualitative, as well as the, I suppose, what you could refer to as the cold data, and they're both important. And you know, I think in terms of transformation, we absolutely need the data. We need it to be accurate. We need it to be encompassing, for want of a better word, all of the areas, because that old truism about what gets measured gets done. So we need to make sure the right things are being measured, that things are being measured equitably. But also, I think it is important, as Joanne raised earlier, the need to have a human and a qualitative, both input and output from the system. How will that be managed, or how do you bridge that, or include both? You don't. How do you include both of those within a data system?
I can respond to that. It's remiss of me of not saying the patient portal, the MyChart piece, is the tool for that. We can communicate directly with patients and service users and people who've experienced, so that they can give, you know, real-time experiential information that we can qualify and quantify. And you're very right, because we get numbers, but that doesn't tell the story. And we need to be a bit smarter, but we will have outreach to all our patients who choose that tool. And I suppose we have to be very careful, because it may only be a certain section of the population that choose to use the tool, but that will immeasurably improve on the qualitative data we currently have within health services. It's usually very small surveys and retrospective. We can now do very large services in real time, or surveys in real time.
Okay, thank you. And the final one then from me is in relation to there's considerable spend obviously needed now in the incoming financial year. Are there any issues in terms of the budget allocation for 2022-23 that are or could impact upon this work?
We don't have a budget for 22-23, and I'm working through the implications of the position that we find ourselves in departmentally at the moment with my financial colleagues. We are assuming at the minute that our going in position is going to be our baseline from last year. We have bid for additional monies that cover other programmes. The Encompass programme is in, from both the capital and revenue perspective, the baseline allocation. So I think from the Encompass perspective, we're in an okay place. But for the other key programmes, cybersecurity is one that we've talked about here today. There is currently an issue with securing budget for those. Yeah, budget's a problem for all of us at the moment.
So and you're working from a set of assumptions, and if those were to be incorrect, what would the potential impact be on delivery of Encompass?
Well, if there's no money, we'd have to stop the programme, I think, at a very simple level, but we're doing all of the work that we can to make sure that is not an eventuality that we have to deal with. And that's just a function of time and where we are in the year in order to establish an agreed upon budget for next year. I agreed with our finance director yesterday that I'm going to write to our minister and just set out some of the kind of key, high priority, essential things that that do need additional budget, and in doing that, set out what the business impact would be of not being able to fund those things next year. But it's very timely at the moment that we're all wrestling with what the budget position looks like for next year.
Yeah, that's a massive worry, I have to say.
Yep.
Okay. Listen, I want to thank both yourself, Dr. Hughes, and yourself, Dan. This is a really important element of work, and one, in fact, that we as a committee had indicated at the very outset we'd be hoping to focus on and to work with you on. COVID has obviously challenged that in many ways, but it's unfortunate that we have those delays. But we do look forward to your further information and to continued good progress on this important piece of work.
Thank you for your questions and your support. Thank you.
Yeah, that's very helpful.
Thank you very much. Okay, folks. So yes, we can let you go. We'll carry on with the meeting. Thank you. Okay. Okay, members, so we'll continue on. We're still okay for, yeah. So we'll continue on there, members, with the next items of business. So, members, moving to SL1, Regulation and Improvement Authority, Fees and Frequency of Inspections, Amendment Regulations 2022. I refer members to the Clerk's memo at tab 7.1 of the pack and to the SL1 at tab 7.2. The Department is proposing to make a statutory rule to reduce the frequency of RQA inspections of dental practices from once every year to a minimum of once in every 24-month period. Do members have any comments in relation to that rule? No? Members broadly content that the Department makes the rule? Yeah. So I will put the question officially. Is the committee content that the Department makes the statutory rule?
Great.
Yep, committee are content, thank you. Item 8 is SL1 on the recovery of health services charges amounts amendment regulations 2022. I refer members to the Clerk's memo at tab 8.1 of the pack and to the SL1 at tab 8.2. The Department is proposing to make a statutory rule to apply an inflationary uplift to the current tariff levels of the scheme that provides for the collection, of the costs incurred by hospitals in treating the casualties of road accidents. So that's one that I think we've seen now several times in committee. Do members have any comments they wish to make?
No.
Members, is the committee content that the Department makes the statutory rule? Yeah,
great.
Thank you. SL1 in relation to the Pharmaceutical Services Amendment Number 2 Regulations 2022. I refer members to the Clerk's memo at tab 9.1 of the pack and to the SL1 at tab 9.2. The Department is proposing to make a statutory rule to amend and omit references to the Health and Social Care Board within the pharmaceutical regulations. The rule will not have any impact on the underpinning policy which governs the arrangements for the provision of pharmaceutical services. Any comments, members? No? Thank you then. Is the committee therefore content that the Department makes the statutory rule?
Great.
Committee content, thank you. And item 10 on our agenda then is SL1. The Health and Personal Social Services General Medical Services Contracts Amendment Regulations NI 2022. I refer members to the Clerk's memo at tab 10.1 of the pack and to the SL1 at tab 10.2. The Department is proposing to make a statutory rule to broaden the list of healthcare professionals permitted to prescribe in primary care. The Department advises that this is part of an ongoing programme to expand the number of non-medical healthcare professions who may prescribe drugs as independent or supplementary prescribers to support multidisciplinary working and contribute to transforming how healthcare is delivered. So I suppose just from my own point of view on looking at this one, I actually would welcome this. I think it's good that we see a kind of creative solutions around how we take pressure off certain parts of the system. I think it's also useful that we have a host of professionals out there, including nurses, paramedics, a range of people who actually are very keen to ensure that they have progression, and we have too many of our nursing and our health and social care workforce currently working at the top of their band. So it's good, I think, to see areas opening up and relieving some of the pinch points and bringing more of those professional expertise to bear. Carol, are you looking to make a point on this?
So will it be a position that their responsibilities will be reflected in their salary? Because prescribing, I mean, you can't be a prescriber unless you're at a certain level, so we need to find that out. And we need to find, are they moving around their bands, and if they're not, that's a lot of responsibility.
Yep, I think that's something that we do certainly need to clarify to ensure that that's being reflected in the additional responsibility should certainly be attracting that recognition in terms of pay. Colin?
Yeah, Chair, I think I agree with yourselves that this is probably a good idea because it sort of spreads the workload out, but I would maybe just have some concerns that it's actually putting additional pressures on some professionals who are already equally busy with their homework and what they're actually doing in the role as it is at the moment. And I'm looking, for example, there, like if we're talking about paramedics then prescribing, does that then add additional workload and expectations on them whenever they go out to see patients, and therefore it detains them longer at the scene, which then means that they're less able to provide the service. It's almost like every bit that you move on the board in terms of health transformation will have an impact somewhere else. But in welcoming this, is there a way of just checking that has been considered and thought through?
Yep, so I'll just check with Claire, can we
can follow up on that, no
correspond
problem.
In relation to that? Yep. So those concerns or suggestions and concerns will be reflected. Pam, go ahead, yeah.
Yeah, thank you. I was just wondering, obviously this is going to impact on and it'll support multidisciplinary working, which is something we're really keen to see it rolled out in all areas of Northern Ireland. But could we also ask how many multidisciplinary teams are currently in place and ask if these changes will benefit the staff within these teams?
Yep. Members content we seek that information?
Yep, content.
Okay, members, thank you. So therefore, in respect of the information we've asked for the department to consider, in taking that on board, is the committee content the department makes the statutory rule?
Great.
Yep, thank you. Okay, members, so we are now going to move into closed session to consider the committee legacy report. So I'll ask the clerk just to bring us into closed session, please.
This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Yep. Okay, members, so thank you, and we are moving on then to item 12, which is in relation to correspondence, and I want to draw members' attention to several items today. First of all, item 12.4 there is an update on the implementation of the elective care framework. Do members have any comments on this? I thought it was light on detail, to be quite honest, and I think actually we should almost seek further detail and breakdown in relation to that framework. Would members be content, or any other comments?
Great.
Yeah, members content with that, thank you. Yep. Item 12.07 is correspondence from the Minister advising the Committee of the publication of the independent review into failings at Dunmurry Manor Care Home. Do members have any comments in relation to that item? No? Members content to note?
Yeah.
Yep, thank you. Do members have any... Go ahead, Paula.
Thank you, Chair. I appreciate the update, I suppose. In some ways, there's a frustration that we're getting so close to the end of the mandate that we can't actually, get our TIA and others in to actually start interrogating this. So it's good to have it, but I think that we could, in the next mandate, hopefully really get back to this issue properly. Okay, thank you. Do members have any comments to make in relation to any other particular items of correspondence in the main pack? I'm going to take several from the table pack as well. But are members otherwise content to note the actions on the correspondence memo?
Yeah, Chair, I'm just trying to go from table pack to correspondence. It's around the neurology stuff as well I want to raise, but it might be under AOB.
Okay, yeah. Okay. We'll take it in AOB then.
Okay, thank you.
So, member, in terms of table papers correspondence, there's a couple of items there I'd like to draw members' attention to. At tab 12.33 of the table pack, we have correspondence from the Royal College of Nurses stating that it believes that the safety of patients in emergency departments across the north can no longer be assured. Now, I have to say that's a very, very worrying letter from the RCN, and this is from the front line, and this is a warning that we cannot afford to underestimate and to act upon. We're due to hear from the RCN at our meeting on the 24th of March. However, would members agree that we urgently write to the department and the trusts for an urgent response to this letter?
Yeah.
And are there any other comments in relation to the letter that people want to make, Paula?
Thank you. I suppose in some ways written correspondence is one thing, but for them to actually get the departmental officials to sit down with RCN and actually see if there's any very quick, robust actions. Because as you say, we can't let this go just from a letter to letter, I think. Members agree. Pam, you were looking to come in on this issue as well, I think.
Yeah, Chair, and I think I would maybe even take it a step further from Paula's and maybe suggest, if at all possible, I know we're really tight for time, but if we could even have a dedicated session, we actually ask the department to meet with us to discuss this letter in its entirety.
Yeah.
Yep, okay, members agreed, and that is, yep, okay. And I think that does reflect the seriousness of the situation that we're hearing from the RCN. Colin, go ahead.
Yeah. Chair, it's just maybe on the back of it, of course, our role in going to the Minister is critical and important, but maybe just to get the feedback, what's the normal turnaround time for a response? Because we've only got 2 weeks left, in the sense that of us being able to hold the Minister to account on this in terms of the department rather than the individual Minister. But these issues are massive, and they're being amplified just from the front line. And if we simply write a letter, I don't know if we're actually cutting it in terms of our role. So totally agree with what Pam has said. We really need somebody in front of us to have a conversation about this. And in reality, we've only got Thursday fortnight to do it, because I don't think we're in next Thursday.
Yeah, and so I'll check with the clerk in terms of turnaround times.
Turnaround time for responses. Normally we request 10 working days. For urgent, we can reduce that, and we would do in this case. Generally, the trusts are quite good in responding quite quick, but certainly if members wish, we can have a look at schedules over the next certainly try next week or early the following week to try and identify a time and date.
Yeah, If I come in, I'm thinking just because of the urgency of it, even if we could, if it needs to be, you know, like an evening meeting or whatever, but if we can just get the point across that we need to come together, we're requesting officials and obviously the groups involved and the Health Committee with our support, an urgent meeting, even if it's during the day, but maybe an evening one might suit better with the members in the chamber.
Yep. And given pressure, given pressure in the chamber. That go ahead, Paula.
Thank you to let me back in. I suppose there's one thing the Minister and his officials, but there's also then the Chief Executives of the Trust, and I don't want a massive meeting, but in terms of urgent response, I think the CEOs of the Trust would be necessary for that meeting too.
Okay, thank you, members. Have members any further comments on items within the table pack? And no, I just want to make then, members, there are a number of outstanding items of correspondence. There's almost somewhere between 60 and 70 items of outstanding correspondence from the Department. Are members content that we write to the Department to request they make every effort to answer those questions before the end of this mandate?
Yeah.
And they've been with them for an extended period of time in many cases.
Absolutely.
Yep.
Right.
Members content, thank you. Okay, member. Yes, go ahead, Pam.
Yeah, Chair, just to say, or to check through the clerk there, I mean, presumably if all that correspondence, if it's unanswered at the end of the mandate, simply just falls away. It doesn't remain in place or anything.
Yes, that's correct, Pam.
Yep.
So I suppose then, given some of it may be very important and you would like to think it would be answered eventually, is there any way of even putting into that legacy report something around the correspondence to ensure that anything that's really critical in that is actually resubmitted or asked again?
Okay, we'll ask the clerk to take a look at that as to how that could be managed. Yep. Okay.
I just don't think it's good if we've 60 pieces of correspondence. We've written on all those issues for very important reasons, and just to let it fall away just seems to be wrong. So I would like to think we could maybe make efforts to ensure that the issues are raised again if they are going to fall away and not be answered.
Yep. No, I absolutely agree. And actually, even if they are answered now, some of them will have been timeliness will have been an issue with them, and it's regrettable that the answers will be coming through late. But I think you're right. I think we need to absolutely every one of those pieces of correspondence was considered, and we only ever wrote to the department on issues that we thought were of significant concern. So each of them individually are important correspondence. Yep. Okay, thank you. So members, moving on to the forward work programme then, I refer members to the forward work programme at tab 13.1 of the pack. Are members content to note the forward work programme, and given that the clerk now has a further piece of work to do in trying to restructure everything that we're dealing with? Paula?
Thank you, Chair. I just want to put on record how disappointed I am that we're not going to get an update from the Department of Health on the commissioning of abortion services. I thought we would have received that within the timescale of the end of March, so just want that noted.
Okay. Thank you, Paula. Okay, members content to note the forward work programme, and then moving on to any other business. And I know, Carol, you had indicated.
Yeah. So I think everyone has raised concerns around the correspondence from the department. I mean, they're massive items. And my kind of concern would be that some of those items that the committee asked for are going to fall if they're not answered and may not be picked up. And one of the things that we've been very consistent about certainly is around, I mean, Paula's mentioned the abortion services, but certainly around the neurology inquiry. If there is a plan for that inquiry, because I mean, my understanding was the report would have been out and all. So just to try and even ask the inquiry itself, when does it anticipate themselves to be reported? But we're still waiting on word back from the department. They made a statement some months ago saying there'd be redress schemes and then there was recall schemes and recall and a few recalls, and it's now, it feels like whatever was announced, there's no tracking or following up on it because we're not getting the information. So I think even just to top and tail that is one thing. Sure, I want to go back.
Before you, is it another issue you're going back to?
Completely.
Yeah. So just in relation to neurology, I also would like to add to that the The review of RQIA into the deceased patients has not been, and I think that needs to be urgently followed up for a date as to when that report is going to be published. Yes. That's an outstanding item of business in neurology as well.
So my next item was on RQIA. RQIA have done several reports, including neurology, but others.
Yep. So okay, go ahead then. Yep.
So can we get because it isn't just while getting the word from the department is critical. That these people are independent and looking at things that went wrong and things, particularly in the pandemic. Yep. So can we just get, because Paul is right, or whoever raised it, we won't get them in front of the committee. So can we get almost a legacy report from the RQIA? And then, Chair, I want to go on to something else completely different, my last point.
Okay, so we'll just check with the clerk. Do you have specific items that you want RQIA to respond to?
Well, I mean, the issue, we looked at the Muckamore and the Murray home. We've also got the care homes in respite during COVID. We've got the RQA report into the deceased patients who were under the care at the time of Michael Watt. Whatever other issues that RQA have been asked to report on from January 2020 until March 2022, we need those topped and tailed.
Yep. Thank you. And then the other item then of
so, Chair, it was just looking at the Encompass presentation, and for the life of me, I can't understand that any initiative that's given substantial amounts of public money, 485.9 million, is asking for additional bids for cybersecurity. I mean, I have to say, I think that's bonkers. You would imagine it would be built into the original business case. So it says version 2.54 of the full business case. I don't even understand what a 2.54 version is. It's either 1, 2 or 3. Yeah. So, and I'm not being pernickety here, but I want to find out why. That's why I asked about the Procurement Commission and tendering. Why then is there additional bids in the Department for Cybersecurity? Why was that not built into the original? Because it's not like cybersecurity just happened a couple of weeks ago. So, and I do think that's, to be honest, that's not good accounting, and it's not good practice in terms of commission and procurement. And the other aspect of it is the whole cost and the budget approved in the full business case. Is there any optimum bias built into that in terms of contingencies and whatever else? And I think it was, I can't even say, is it Dan? Dan, yeah. Daniel Dan mentioned several bids. He mentioned one about cybersecurity. I didn't hear him mention the others. What was the other bids he's putting into the department for? Sinead?
Yep.
Rocket,
members agree that we seek those pieces of clarification? Yep. Okay, thank you, members. And then Alan, I have indicating for an item of any other business. Go ahead, Alan, please.
Sorry, Chair, I was having difficulty there on mute. Chair, I just beg your indulgence under any other business to bring up the subject of the private members bill going through at the moment in relation to the preservation of historic documents. And just would be seeking the support of the committee for the accelerated passage mechanism to be deployed here. I can't speak to it and the rationale and reasons for it if you wish, Mr. Chairman.
Is that, Clerk, is that appropriate that we take that right now, or do we need to schedule that in for Alan was going to outline the reasons?
No, he can outline the reasons, no problem. Yep.
And then can you see what other steps need to be taken to ensure that that the process is correct?
Well, the process just requires Alan to outline to the committee the reasons.
Okay.
It's then down to the committee to decide whether it wishes to take a position or not.
Do we have to take that decision today?
No.
Okay. So what I propose then is, Alan, if you set out the reasons, take the opportunity to set out the reasons, and we can then consider that. So back to yourself, Alan.
Thank you, Mr. Chairman. Chairman, the preservation of documents are an important ask of the victims of this scandal. Unfortunately, it was impossible to add legislation compulsion on organisations to preserve documents. The inquiries or indeed may wish to be accessed by victims in the Adoption and Children's Bill. Now, a lot of these documents are stored in very, very poor conditions and are deteriorating, and some quite old. And much of the documents held by institutions may contain information that could prove it's absolutely vital that they are preserved. Now, the bill was considered to be the only mechanism available to secure legislation before the end of this mandate, and perhaps even for some time into the future. And so it has only been with the sympathy of the Speaker and the support of the Business Committee and party whips that it has been possible to at least create a hope that legislation could be put in place now. Accelerated passage can ensure that we can produce legislation before the end of the mandate, this mandate, and I would respectfully ask the committee to support this initiative. As it is, it's fully supported by the department and fully supported by victims groups and their families. Thank you.
Okay, thank you for that information, Alan, and then we can return to a future consideration on that. So, members, I think that's everything then for today, and I want to thank members for what has been a very important and a really enjoyable session in a sense, but also a very focused and a very, I believe, will be, looking back, seen as a very important one in terms of the input of the Disabled People's Parliament and the fantastic contribution that made to our meeting today, and hopefully as a part of shaping the future delivery and design and delivery of health and social care, which we're all so passionately interested in, and just to once again thank them for their time today. Thank you, members. Our next meeting will be on 12:30 on Tuesday, 15th of March in room 30, when we will have briefings from the Chief Dental Officer and the Health and Social Care Board on the provision of GP and dental services. Thank you, members.
Thank you, everybody.
This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Okay, order. Good afternoon, members, and welcome to this afternoon's meeting of the Northern Ireland Assembly's Public Accounts Committee. We have quorum and we're now in public session. Members, I must point out that mobile phones must be set to airplane mode or turned off. It is not sufficient to put mobiles on silent mode as they continue to interfere with the Assembly recording. The session is being recorded in video and audio and can be accessed live via online streaming on the Assembly website or Democracy Live. So, in welcoming you to PAC's meeting today, we have two evidence sessions and will therefore be going in and out of open and closed session. Agenda item 1 is apologies and any delegation of votes. Can I ask the clerk if we have any apologies this afternoon?
None received. Yep.
Okay, there are no apologies or delegation of votes. Agenda item 2 then is the minutes of the 3rd of March 2022 and the minutes of the 8th of March 2022, which are in your packs, pages 7 to 17 and 2 to 6. So can I ask the committee for permission to sign the minutes as being a true and accurate record of those meetings? Agreed? Agreed. Okay. Agenda item 3 then is the declaration of members' interests. Members at each meeting, members are required to register relevant financial and other interests in the members' register of interests. Today's subject matters include educational special needs and planning in Northern Ireland. So I declare an interest at the outset of the meeting as a governor of Belfast Girls Model School and Edenbrook Primary School in Belfast. Mr. Beggs.
Declare an interest as a governor of Rodensfield School in Larne and also as a committee member of Horizon Sure Start.
Any others?
Declare an interest as a member of Priory Integrated College Board of Governors.
Okay, that's Mr. Muir. Any others, members?
Chair.
Mr. Boylan.
Yeah, member of the Board of Governors at Clay School, Katie.
Okay. All right, thank you. So, agenda item 4 then, matters arising. Are there any matters arising from the minutes? Okay. Can I ask, can Mr. Patrick Barr be brought into the meeting? And I think Jonathan Stevenson, have you joined us, Jonathan? Good afternoon. Stuart, even as Jonathan Stevenson from another life. Yes. Good afternoon, Stuart. Can you hear me okay?
Good afternoon, Chair. Yes, I can hear you.
Okay, thanks. And can I just ask, Kyle, are you able to hear me okay? Kyle not there?
I don't think Kyle is there.
Dropped off.
Okay, so we've
Okay. So agenda item 5 then is the correspondence, pages 21 to 24 of your pack. And we're joined this afternoon by Mr. Kieran Donnelly, CB, the Controller and Auditor General for Northern Ireland, Colette Kane, Director, Roger McCants, Audit Manager, and hopefully Kyle Bingham, the Assembly Sport Officer. And we're also joined by Mr. Rodney Allen as well. Members, I refer to correspondence dated the 4th of March 2022 in your pack, pages 21 to 23, from Edward Cook regarding Section 75 screening at Queen's University. Mr. Cook highlights the concerns in respect of recording of students' complaints, and he has also written to the Committee of Finance regarding Section 75 screening of the allocation of PhD students and the marginalisation of unionist staff and students. Mr. Donnelly, have you any comment on this?
Yeah, Mr. Cook has also written to us and a number of other regulators
Okay.
So we'll be responding to him and consulting with some of the other regulators as well before we do that.
Okay. Members, are you content that we note and forward Mr. Cook's correspondence to the Northern Ireland Audit Office and write to Mr. Cook to make him aware of our action? Agreed?
Agreed.
Okay. Members, I refer to correspondence dated the 7th of March 2022 in your pack, page 24, from Alison Allen of NILGA regarding policies and procedures at councils to deal with any potential conflicts of interest and routine auditing of same. Ms Allen has stated that she has no concerns have been raised with NILGA by any party in relation to how conflicts of interest are managed for planning officers. She also comments on qualified majority voting. Are members content for the correspondence on to the Audit Office?
Agreed.
Agreed. I refer to correspondence from Mike Keeley in your pack, pages 8 to 10, which he had previously sent to the Economy Committee on the 17th of February 2022. Mr Keeley has forwarded this to the PAC to include in our broadband investment in Northern Ireland inquiry. Members, are you content to forward this to the Audit Office? And we include Mr Keeley's email and the report's appendices. Agreed?
Agreed.
Okay, members, we will continue in public session for our next agenda item, which is ministerial direction. And can I ask at this stage if we can bring in Tomas Wilkinson for this agenda? Tomas, can you hear me okay?
Yes, I can, Chair.
Okay, good afternoon. So, basically, members, ministerial direction, agenda item 6, COVID and Employment and Skills Initiative, pages 26 to 33 of your pack. And I refer to correspondence in your packet, pages 26 to 27, from Mr Kieran Donnelly, CB, the Comptroller and Auditor General, dated the 7th of March 2022, regarding a letter from the Department for Communities Permanent Secretary, Ms Tracy Maharg, who wrote to the CNAG on the 22nd of February 2022 to advise DFC Minister Deirdre Hargey, MLA, issued a ministerial direction to deliver COVID recovery programme Employment and Skills Initiative, which cost up to £20 million. The initiative will provide funding for the next 3 years for grants to support individuals from not-for-profit organisations with costs of a variety of new or enhanced roles within the arts, heritage, creative industries, sports and voluntary and community sectors. The initiative is being delivered by 4 main partners: Future Screens NI, Heritage Fund, the Rank Foundation and BBC. Members, the relevant correspondence is at your pages 28 to 33 of your pack. Mr Donnelly will keep this matter in view as the audit of 2021-22 financial statement progresses. Mr Donnelly, at this stage, do you have any comment you want to make around that?
Well, I think key point here is there was a business case for this, but the accounting officer didn't approve it because they couldn't demonstrate value for money in the time available. We certainly will be examining this expenditure in the next audit if there are any issues, and we'll come back to the committee.
Okay, members content? Agreed?
Agreed.
Members, we will remain in open session for our first evidence session today. A further update on the SEN report published on the 21st of February 2021. We have had 2 MORs, first in April 2021 and a second MOR dated 29th of October 2022. So can I ask if we can bring in Dr Mark Brown, the Accounting Officer and Permanent Secretary of the Department of Education, and Sarah Long, the Chief Executive of the Education Authority. Okay, so agenda item 7 then is the PAC review of special educational needs impact evidence session, pages 35 to 107 of your pack. We're joined this afternoon by Dr Mark Brown, the Accounting Officer and Permanent Secretary of the Department of Education, and Sarah Long, the Chief Executive of the Education Authority, and we're being joined remotely then by Ms Una Turbot, Ricky Irwin and Lindsay Farrell. Can you all hear me okay?
Yes.
Can all of you hear me? Yeah?
Yeah, I think they're all together in Bangor.
No, they're not.
Yes, all good here.
Okay. So, good afternoon. And what we'll do is, Mark, Sarah, over to you to make presentation, opening remarks, and then members will ask some questions.
Thanks very much, Chair, and thanks for the opportunity to update you on the Department's Memorandum of Reply to the Committee's 2021 report on the impact review of special educational needs. You've mentioned the colleagues that I have here today, Lindsay Farrell, who's the Head of Education Policy and Children's Services, and Ricky Irwin, who's the Director of Inclusion and Wellbeing. And also, obviously, Sarah, along with Una Turbot, who's the Interim Director of Children and Young People's Services. So firstly, Chair, I'd like to assure the Committee that both the Department and the EA are committed and continue to work together to ensure that the recommendations of the PAC report are fully addressed and that remedial actions are implemented. Many of the recommendations are operational matters for the EA, which has already commenced a significant programme of improvement and review across all its SEN services under its SEN and Disability Strategic Development Programme, or the SEND SDP. And Sarah will be happy to provide more detail on progress to date in that area. Perhaps I could just take this opportunity to give the Committee a brief high-level summary of progress against each recommendation. Under Recommendation 1, an independent review team has been appointed and has completed Stage 1 of the project, which is desktop research. Stage 2 of the project, the stakeholder engagement element, is currently underway, and the project is on track for completion by end April 2022. Under Recommendation 2, the tender evaluation process to appoint an external consultant to carry out an independent review of SEN service provision and processes is complete, and subject to confirmation of the funding that we have for 2022-23 financial year, and I expect to have that funding. The contract will be awarded and commenced in April with a timescale of around 6 months. Under Recommendation 3, rigorous performance monitoring and monthly reporting processes are now in place for the statutory assessment process. Under Recommendation 4, following an independent review of governance arrangements and committee structure in March 2020, a new EA committee structure is in place and is working well. In respect of Recommendation 5, the EA's corporate data strategy has been established, which identifies high priority initiatives to improve data management and support effective business analysis and decision making. A data quality framework has been initiated to assure that data is fit for purpose and meets the needs of data consumers, and a data governance programme has commenced in September 2021. Under Recommendation 6, part of the proposed data audits across the EA's pupil support services will focus on pupil outcomes and how to enhance analytical capabilities in the short term. The wider pupil support service reviews under the SEND SDP will include specified pupil outcome data requirements, which will inform the effectiveness of SEN interventions and their value for money. The wider pupil outcome picture will also be added to through the review of the SEN service provision and processes under PAC Recommendation 2, and also the rollout of digital personal learning plans under the 2016 SEND Act. Under Recommendation 7, a report on the diagnostic analysis of SEND tribunal trends is proceeding through the EA committee approval processes and will then be considered by the SEND SDP board, Programme Reference Group and the SEN Governance Group before publication. Overall, the Department has increased its governance and accountability oversight of the EA on SEN issues and continues to maintain strategic oversight of all work via monthly SEN Governance Group meetings, which I chair. And complementary to the ongoing work I've just outlined and underpinning the drive for improvement in SEN provision, work continues to complete implementation of the new SEN framework. So following consultation on new SEN regulations and a new code of practice last year, further engagement has taken place with stakeholders, and we continue to work with the Departmental Solicitor's Office on a number of significant changes to take account of the feedback that's been received. And once finalised, it's anticipated that DE officials will present amended regulations to the Education Committee, subject to ministerial approval. It's intended that the legislative journey will then begin later in 2022, and the provisions of the 2016 SEND Act will be commenced via a phased approach. As part of PAC Recommendation 2, assessing the impact of the new SEN framework will be taken forward by the ETI in the term following its full rollout to all schools, which is likely to be sometime in 2023. In conclusion, Chair, real and significant progress has been made in the field of SEN since the NIAO published its SEN report in 2017. As we look to the future, we continue to face significant challenges, not least in view of the ongoing financial pressure on the education sector as we face into an imminent budget settlement with around 366 million of pressures next year, rising to around 543 million in 2024-25. And those pressures will inevitably have potentially significant impact on our capacity to deliver key SEN services and our ability to implement the necessary changes to our current service delivery arrangements. However, in seeking to maintain continuity of service delivery, we will continue to rely on the commitment, dedication and professionalism of our school principals, teachers and wider education workforce. Thank you, Chair. I'll now hand over to Sarah for her opening remarks, and we'll be happy to take questions after that.
Okay, thank you, Mark. And thank you, Chair, for the opportunity to provide a further update on this very important issue. Driving forward the transformation of Northern Ireland's SEN system remains a central priority for the EA, its corporate leadership team and the EA board. There has been much work undertaken since the NIAO report of 2020 and the subsequent PAC report last year, and it is fair to say that the EA and the wider system has been on a journey of improvement. Significant progress has been made, but there is still much more to be done. The establishment of the SEN Strategic Development Programme has been a major step forward in bringing the many complex strands of this work together in a strategic and holistic way. It has also allowed us to strengthen our engagement and partnership working with the establishment of the Programme Reference Group, which brings together the voices of parents, children and young people, key advocacy groups and our wider education and health colleagues. As the Permanent Secretary has highlighted, significant additional investment will be necessary in order to fully deliver the vital changes at both systemic and school level which are still required. This includes sustaining our progress in improving the statutory assessment process, introducing new evidence-based intervention models, tracking the outcomes of those interventions more effectively, and ultimately delivering the high-quality services that our children and young people need and deserve. This is something that the EA, together with all of our partners, are absolutely committed to doing. And if we look back 2 years to the publication of the NIAO report in 2020, significant changes in the SEN system are already evident. An ambitious improvement project was put in place to drive forward significant transformation in the statutory assessment process. This has included revising the process itself in terms of decision-making, quality assurance, information flows and standard operating procedures, improving the management information systems, analytics and reporting, rolling out a revised procedural handbook and professional development programme, and all of this work has allowed us to reduce the backlog of assessment cases which had been open for more than 26 weeks from over 1,000 at the end of November 2019 to 0 at the end of March 2021. Despite significant increases in referrals over the last year, we have been able to largely maintain this compliance, and at the end of February 2022, 11 cases had been open for more than 26 weeks. Whilst this is one part of a much bigger picture, nevertheless, the assessment process is in a much better place, and we are working hard to sustain that and to build on this progress. Looking at other areas, we have driven forward our corporate performance framework and our data governance strategy right across the EA, with expert teams in place improving performance management across all our services. As part of this work, the statutory assessment process was prioritised across 2021, leading to substantial improvements in the quality of data analysis and reporting, which in turn have driven the wider service improvements. These same teams are currently initiating similar work across our SEN pupil support services. In preparation for the current school year, a cross-directorate project was established within the EA to tackle the significant increases in demand for special school and specialist mainstream provision. This project allowed £21 million of additional investment to be secured and an additional 61 special school classes and 39 specialist mainstream classes to be provided. This intensive work ensured that every child or young person with a statement of special educational needs was offered an appropriate placement for September 2021. This work now continues, focusing on meeting additional increases in demand for September 2022. And looking to the long-term provision, we are delighted to have launched our consultation in January on our draft Special Education Strategic Area Plan for 2022 to 27. This is the first regional plan to specifically focus on creating a special education system for the future that can offer all pupils the opportunity to achieve their full potential by having the best educational experiences and pathways to meet their individual needs. We recognise that there is still a significant amount of work to do, and sustaining progress is always challenging. But we are absolutely committed to continuing this transformation journey to ensure we meet the needs of all our children and young people and give them the best educational opportunities and start in life. This remains an absolute priority for the Education Authority and all of our partners.
Okay, thank you. Can I just ask those who are joining us remotely to mute their devices? Throughout those two presentations, it sounded as if Jack Clouseau was joining us for the meeting. So if you could just mute your devices, and obviously unmute when you're called to speak. For members, then, just the briefing paper is at pages 35 to 40. For those who are new members of the committee, it would, just so that you're aware, the Review of Special Educational Needs report at pages 41 to 64 of your pack. The SEN MOR dated the 30th of April at pages 65 to 73, and the SEN MOR dated 21st of October, pages 74 to 78, and the Northern Ireland Audit Office report closing the gap, social deprivation and educational needs, pages 79 to 103, and witness biographies 104 to 107. So you've heard the presentations from the Permanent Secretary and the Chief Executive. Before I bring Mr. Muir in, who's the first member to indicate he wants to ask a question, can I just ask you both, in terms of our report, Impact Review of Special Educational Needs, could you tell us, do you think that report helped in how you shaped the review and the recommendations that were made, how they have actually improved a lot of the young people and their families with special educational needs on the ground?
Sure, maybe I'd make a few comments on that. I think the report has been extremely helpful, in particular in identifying key areas where additional information is required that can help us to identify both the extent of need and where there are gaps in that information. Also in identifying how we know that we're actually meeting some of the requirements that are set out in the legislation and the expectations in the policy, and in providing a focus, I suppose, for the Department and the EA to work together to take forward that work. I think a report from the PAC is always taken very seriously by the Department, and I know by the Education Authority, and also by ministers, obviously, and that does provide significant support for us in allocating resources, both human and financial, to dealing with the issue. So I think the framework that is there has been important. It's also a very significant amount of work. It's a comprehensive range of work that has been requested by the EA. It will take some time, by the PAC. It will take some time for all of that information to be gathered through the various reviews, to be systematised and to be delivered, but it will give us a very strong basis going forward. And in the interim, I should say, we're not waiting for all of that. There is work that we are doing at the moment to try and ensure that we are enhancing the existing services and taking forward and progressing services where we can, consistent with what the PAC has asked for and consistent with the policy direction and indeed the legislative direction. Sarah, I don't know if you want to add anything.
Yes, Chair, I would agree with the Permanent Secretary. I think it has been incredibly helpful in shaping the agenda, and as the Permanent Secretary has said, some of this work will be ongoing now for a number of years, so it will continue to be. So, if, for example, if we look at the independent review of SEN services and some of the research that has been commissioned as part of that, that will have a longer-term ongoing impact on how we shape, change and redesign our services. And I would also agree that the focus on the information requirements to help us drive our improvement, to monitor our performance and to be able to account for that more effectively have also been incredibly helpful in terms of shaping the SEND development programme itself. And many of the strands of work are directly connected to some of the recommendations from that report.
As you'll be aware, 2 independent reviews were recommended by the committee. Have these reviews commenced?
Well, the first one, Chair, is the review, the landscape review, as it's called, of the Education Authority, and that has commenced and is actually in its second stage. It is due to report by the end of April, and as part of that, there's been widespread engagement with stakeholders, both in the department, in the Education Authority, and out in the schools, in the school sector. So that is on track. In respect of the second review, which is the broader review of SEN provision and processes, that has taken a little longer to put in place. We are at the stage now where we have received tenders, they've been evaluated, and we're ready to award. The reason it took a while was that initially we didn't attract viable proposals, and there's also been a process that has to be gone through of tender evaluation.
What do you mean didn't attract viable proposals?
Well, any time you put out a specification, you're reliant on the market responding. So we didn't receive very many proposals on those that were there. We didn't feel were sufficient to meet the requirement.
So over a year since we produced this report, that work hasn't commenced?
We expect to actually award that contract shortly.
Yeah, but why? I find it. I mean, this committee. I'm disappointed with this. I have to say, there hasn't been a more important report that this committee has done in its more than 2-year work. And for the department and the EA and whoever's responsible within both, not to have commenced work over a year after this report came out, in terms of an independent inquiry, is, I think, absolutely scandalous. I'll come back to that. But in terms of the first recommendation, the first report, who's carrying that out?
That contract was awarded to Baker, Tilly, Mooney, Moore.
Mm-hmm. When was that contract awarded?
The contract was awarded, I think it was October.
October?
I think it was October, yeah.
So it was, what, 8 months after the report? Neither of those are particularly complimentary, I have to say, in terms of response. Mr. Muir? Mr. Muir.
Thank you very much, Chair, and thank you everyone for joining us here today. Just a couple of questions. I have one question, which probably we need to take it when we go into private session, and it's just in relation to the ongoing HR issue, and just for an update in relation to that. So would you be happy, Chair, if we took that in private session, or do you feel we could do that in public?
Yeah, we'll stick to this, if you don't mind.
That's no problem at all. The other issue is just in relation to appeals, because I know that was a very significant issue, and just want to understand what the current the lay of the land is in relation to that, and how much sitting here now as the pandemic and lack of budget certainty going to affect future work in terms of addressing this.
Okay, thank you, Mr. Muir. I am going to ask Una Turbot, who's joining us remotely, to provide an update on the extensive analysis that has been undertaken regarding appeals, and as a result of that analysis, some of the actions that are now planned in terms of taking it forward. We felt very strongly that it was important that we understood the reasons and did a very detailed piece of work in coming to our conclusions. So I will ask Una to provide some of the detail on that.
Okay, thank you. Yes, I suppose at the time we were all very conscious that the number of appeals that were being taken was concerning, and it was impacting on public confidence in that, and raised questions about the decision-making processes that that were being had in relation to decisions as to whether or not a child would be moved forward for a statutory assessment and review. And certainly since 2015, the number of appeals to the report in 2021 had almost tripled. So it was decided that a forensic review of the appeals would be undertaken, and it was undertaken by a team within the AA, but independent of the Children and Young People's services. And it basically has provided us with very useful information. I suppose what it has highlighted is this is not just a straightforward matter of a poor decision being made. There's a lot of complex factors that are taken in, that are impacting on this. For example, the access to quality stage 3 report. So what we are finding is the number of requests for statutory assessments are related to the fact that we don't have early intervention services at the sufficient level, and that because families didn't have, or children didn't have those services available to them, that families then asked for a statement to be referred forward to the statement process. There was also, we found some inconsistencies in relation to our procedures and our guidance and our professional development, and that is something that we will need to address. We know that we need to move to use our DARS service, that's the Disputes Avoidance Resolution Service, much more effectively in order to get earlier resolution to some of our situations, and we think that can help moving forward. We need to get additional information to parents about the statement process, and in particular making sure that we have all of the information available to us to allow us to make the right decision at that time. What we found is that something like 50% of the concessions are not actually, I suppose it's the terminology, it's the concession, we're conceding because additional information is subsequently provided to us when asked for by the statement team, and whenever that information is available to us, then the criteria for the decision to proceed is actually met. So that's a big factor, and we're going to have to work better with families in relation to that. We're also very keen to work with the tribunal service itself, because it has become apparent that that the way that the guidance and legislation is being interpreted, there's some misalignment, and I think it's important that we sit down with the tribunal service and with ourselves and with our legal team, just to make sure that we have a common understanding in relation to this whole area. We're also very keen to work with the community and voluntary sector in relation to supporting us with this work moving forward, and that is again about the engagement with families. The report is in a final draft format. It has been shared with the SEND Strategic Development Programme Reference Group that includes the organisations that our Chief Executive has outlined earlier. We've presented the information to them. They have given us some very constructive verbal feedback, but they're going to give us written feedback within the next 2 weeks, and we will finalise that report for submission, and we will then take forward the recommendations emanating from that work.
Okay,
thank you.
Mr. Muir, are you content?
Yes, thank you. And just in relation to the budget situation and COVID, how much is that going to impede the future programme of work in terms of addressing the recommendations from the PAC and the lack of budget certainty, and then the historical impact of COVID?
I think there's no doubt that as the Permanent Secretary made reference to, that the budget position may have an impact on the pace potentially of this work, but the work itself will remain an absolute priority for both the Department and for the Education Authority. And so we are working our way through how we may stage or phase it or what impact that might be. But what we will not be doing is ceasing our work. It needs to keep going, and it will.
Yeah, I think just to echo Sarah's point there, the fact that we don't have a clear budget to work to has introduced a huge element of uncertainty in all our planning. Now, clearly, the whole area of special educational needs is a priority for us, but we have other priorities too, and in having to take forward our services in the absence of a clear budget, that does lead to difficult decisions. But certainly in respect of the suite of programmes, that is a priority. We're looking, as Sarah said, at whether we can do it all at once if the budget is available, and that's not clear, or whether we will have to phase it. But certainly we will be making it a priority to maintain services and also to take forward the review. What I can say is the review to which the Chair referred, which is the second review, which we're looking at the SEN review and provision. We will ensure that is taken forward, because that provides the vital information base that any future actions will be taken on.
And I think that's a very valid point, and that's why I think I probably speak for the entire committee. There's a disappointment that work hasn't commenced yet, because it is so vital.
Well, absolutely, Chair, but I think there's a whole process for these reviews that has to be gone through. I know the committee will not be interested in the internal workings, but there are business case reviews, there are approvals, they're securing the funding, they're securing DOF approval, and then there's working with CPD to get through the procurement process, and then obviously there's time out for people to respond to any specification that's put out. Then any tenders received have to be evaluated. So there is a natural time period for any of these reviews to be done, but obviously we would have liked to have done it quicker.
Yeah. Meanwhile, the young people in our schools, the teachers who work with them, classroom assistants work with them, the other people in their classrooms with them, and their parents are under those continuing pressures. Mr. Muir, you concluded in your questioning?
Yes, thank you, Chair.
Mr. Beggs?
I have to say I'm very disappointed at the slowness in addressing some of the recommendations that we made, and indeed flowing from the Audit Office report, which actually was 2017, or report over a year ago. Recently we had the head of the civil service here in front of the committee, and she was indicating how she felt it's important that the civil service would prioritise those areas where we can make a difference. That's not what I'm saying here, and I'll illustrate that. Our second recommendation was around reviewing how we actually provide SEN support. Asking for benchmarking. I take it if the paper exercise was done, that bit's done. But asking in particular to consider the funding of SEN services, including the delegation of budgets. Now, when we had our inquiry into special educational needs, I highlighted to a wide range of witnesses that there can be 3 classroom assistants standing at the back of post-primary schools doing nothing, primary school classrooms doing nothing. That's the way SEN funding is being utilised. The children are not benefiting. Since then, during the course of our TSN report, evidence was given us that it can be 4 and 5 classroom assistants standing at the back of the classroom doing nothing. So my question is, why are we not doing what some schools have been able to benefit from, the delegation of that budget? At the Boys Model, we've discovered a very successful use of that money, one-to-one teaching, small group work teaching, some classroom assistance, flexibility to those schools to get better outcomes, and clearly getting better outcomes. Some other schools are also benefiting from that flexibility. I've discovered the same thing has happened in Abbey Community College. I understand the same thing's happening in Hazelwood. Why can that not move forward without any funding?
Well, I'll make a few comments, and I think Sarah might want to refer to some work that's ongoing. There is flexibility for many schools, as you described, and the fact that those schools are actually utilising that flexibility demonstrates that is the case. In the early stages of the SEN Code of Practice, it's really down to the school to decide what support and how they provide the support to the children and young people, and the sort of actions that you describe and the approaches you describe are open to schools. Of course, there is provision that's made through statements that specify the sort of support that is required in some classrooms, and in some cases the sort of issues that you have identified can present. But I think it's important to get a balanced picture. There are many cases where we have highly skilled classroom assistants who work very effectively with the teachers in the classroom to provide the support that children need. I was out in Brookfield Special School on Monday with the principal there, Hilary Milligan, and she was full of praise for the work that the classroom assistants provide, how skilled they are and how critical they are to the effective operation of the school. So I think it's important to get the full picture. Of course there are issues that need to be addressed, and we accept that, and it's part of the whole review to look at that, but I think we need to get a balanced picture. You know, there are situations and circumstances where it's entirely appropriate to have a classroom assistant providing that support. There are other circumstances where perhaps the resources could be utilised in a different way. I don't know, Sarah, if you'd like to add a little bit of that.
Yeah, I think flowing out from the PAC recommendation and the comments that were made, one of the things that we have tried to put in place is a system, if you like, to evaluate the effectiveness then of using alternative models. So that will provide us with an evidence base for moving forward. So as part of the overall SEND strategic programme, there is a work stream called the Supporting the Learner Journey, and that is exactly about looking at alternative models, not using classroom assistants, some of the models that you have described, and actually tracking then the pupils through those journeys and absolutely providing us with the evidence base then around the effectiveness of the interventions and the different effectiveness of the different interventions and what might be the best model moving forward.
Information that's been provided to me is there are exceptionally good outcomes from both those schools where that flexibility has been granted. And just to be clear, I am not questioning the ability of classroom assistants. I am questioning what the Education Authority and the system is having them do. I know personally of a very, very skilled, effective classroom assistant who resigned rather than stand at the back of the classroom and do nothing. Classroom assistants are frustrated and young people are missing out on the opportunities to benefit from learning by better methods. Well, do you accept that?
Well, absolutely. I accept that, Mr. Beggs. There are certainly areas where more effective use can be made of classroom assistants, and there are equally areas where very effective use is currently being made of classroom assistants. And the point of the review is to get a better sense of the evidence around that, to highlight the different approaches that there are there and to encourage those to be taken forward. But I think there's also another aspect that needs to be addressed, and that is the wider perception of what having a statement or having specific support for a child involves, both among wider stakeholders and among parents. There can be an expectation that the only support that is valuable is having a classroom assistant. That is almost like the gold standard, and that's what people push for. So there is a very important piece of work that needs to be taken forward to try and change perceptions around the best form of support. What we want is the best outcome for the child, and for support to be provided in a way that produces that best outcome, and in doing that to allow principals, classroom assistants and the other experts to be able to establish what is best for the child and to agree that with parents. But there is a big piece of work to be done in changing the current perceptions in order to allow that to come in, and that, I think, it's going to have to be a part of any implementation.
Do you accept that giving that flexibility to the principals to utilise their budget might even allow some degree of earlier intervention for the benefit of everyone, and to catch up what's already happening in other places? And finally, do you understand my frustration? 1 year after highlighting this issue, I do not hear that issue move forward one bit whatsoever. Sorry to say.
I don't just recognise your...
I come in here, Chair.
Sorry?
Yes, just Dr. Brown was just making a point. I'll bring you in whenever he finishes. Okay.
I was just going to say that not only do I hear your frustration, but I think that Sarah and I would share your frustration. You know, we are keen to move on to get the reviews in place and to improve the service. All that we're trying to do is to improve the service. So we are very keen to move on and get the improved outcomes.
What is stopping it?
Well, as I say, all of these things, getting the review, I mentioned some of the things that had to be gone through. there's going to be a time taken for the actual research to take place, because if we want to identify the best ways forward, there has to be a sound evidence base. That is going to take time, but it will take time initially. But what it will do is it will produce better outcomes, and we'll get to the end result in quicker time. But there are, Mr. Begg, necessarily in any of these types of processes, there are essential time lags, and there has to be time given to allow work to be undertaken. And I appreciate everyone would like it done quicker, and we are seeking to try and expedite that as much as we can. Maybe if you want to come in.
Bring in an interpreter at this stage, and then Mr. Beggs can come back. Okay.
Yeah, thank you for this, and I think we share your frustration in relation to this. The classroom assistants, when they're allocated by the statutory assessment and review service, taking into consideration the advices that are received by them, including from psychologists and from parents and from others who know the children. Now, when those classroom assistant hours are being allocated, consideration is given to the number of classroom assistants in the particular classroom, and based on where the child is going to attend. And we know that there are occasions whenever it is our view that there would be a lesser number of hours required, but we find ourselves in a situation where there is challenge and indeed sentenced appeals because individual children are not provided with an individual classroom who only looks after that child, and that isn't what happens in other jurisdictions, for example, where there's teaching assistants allocated. And it's a different model. Now, what we do need to do, and it is one of the key work streams in the SEN transformation programme, is to review the classroom assistant, adult assistant model, so that it is more responsive to the needs of all of our children, and that's a critical element of the work as we proceed. I do also want to say, though, that we also have worked with schools, and I personally have been working with a number of principals where we have looked at the number of classroom assistants that they have, and with their consent and with the consent of parents, we have reprofiled how those classroom assistants have been allocated, and in fact, on some occasions, we have converted classroom assistant hours into teaching hours, where we felt that was more appropriate. So we're very keen to be flexible. We are working with schools to make a difference, but in order to deliver in the way that we need to do in a systemic, longer term manner, we need to take this SEN transformation work forward, and that will inform the policy moving forward.
Just a final question. If there are principals who might be following some of our comments in this, what do they have to do to get flexibility like some schools already have? Because I know there seems to be unanimous agreement that this should move forward. So what has to be done even to get temporary delegation of this and the flexibility to better manage the funds that are available for the benefit of the young people?
Every school has an aligned officer from the statutory assessment and review service. So those discussions are had at that level, at that point in time. But I suppose the important thing that the schools need to do is engage with parents, because whether we like it or not, parents want individual classroom assistants for their child, because it gives them that sense of security and confidence, because our stage 3 services aren't at the level that they need to be, and that continues to be a challenge for us.
And do the parents understand the role of most classroom assistants at post-primary school, to stand at the back of the classroom?
Well, I think parents are very involved in the statementing process, and they understand what is, and they're taken through that statement. And yes, we have situations where we have had parents who have insisted in having one-to-one classroom assistants for their child, for example, because they are concerned about their child's dyslexia needs or literacy needs or other needs, and they insist on it. And if it's written on a statement, it's a statutory statement, and we have to provide it.
I think, Mr. Begg, just to add to what Una said, that building of confidence and understanding and awareness among parents is going to be absolutely critical, because they are a key part of the whole process, and our ability to point to the evidence which demonstrates that different approaches, rather than having individual classroom assistants appointed to support a child, the evidence that we can gather there and the testimony that we will be able to get from parents where that has proved successful for their children. We will be part of all the process we need to put in place to build that confidence, to pave the way. Simply making a change in policy will only run into a lot of opposition from parents at present. We need to have a wider approach, I think, which takes parents with us, other stakeholders with us, and builds on the knowledge and the research and the evidence base that we have.
The educational outcomes shown to me at Boys Model, and also when I was at a visit to Abbey Community College, demonstrated exceptionally good outcomes for all children, including those with special educational needs, because of the flexibility that's been shown and the ability of those principals to give appropriate learning mechanisms for all their children.
Okay, thank you. Mr. Hilditch.
Thanks, Chair, and you're very welcome this afternoon, folks, coming back to us with the update. Just a couple of areas which I had covered previously was with yourself, Sarah. I'd asked you about learning from other places within the devolved situations in the UK, and you indicated that there was some of that going on. Has that continued and it hasn't been beneficial, or could you give us some idea of that?
Okay, it hasn't continued at the rate at which we would like to have continued, Mr. Hilditch, and really that's because of the circumstances we found ourselves in connected to COVID. So at that time we had made contact with the Local Government Association in terms of peer review and joining them on their peer review programme. We haven't been able to proceed with that simply because of the circumstances in which we found ourselves, although certainly in designing the SEND programme, and we have looked, so we've done our desktop, if you like, on some of that and looked to the alternative models and what they might look like. So that has informed us moving forward. It hasn't resulted in the impact and the shared learning across that peer review programme that we had originally intended, but it's certainly something we now intend to pick back up.
Back up as things improve then. Welcome that. Just on yesterday's situation in regard to the integrated education bill and any potential knock-on effect it has on budgets or anything like that, did you see that as a threat, a challenge to have to now maybe, I don't want to say detrimental to SEND, but certainly spread the budgets a bit further may have to happen?
Well, maybe I'll try and make an answer to that, but I mean, I think it's actually very difficult to tell at present, and part of what we will be doing in the department right now is just working through what the implications are of the integrated education bill and what precisely some of the clauses and so forth that are contained in there will actually mean. And that may take some time.
Yeah.
We have our own legal advice on what some of the clauses mean. Some of these may be tested at time, but we will be looking what the implications are for policy. But I think it's too early to say what the impact might be. But I wouldn't expect it to have an impact on this particular area. I would hope it wouldn't have an impact in this particular area.
Well, hopefully not. Thank you. And obviously you'll keep looking at that situation. The committee was concerned at one point about an independent review being carried out and who was carrying that out. Did we have anybody directly from the EA involved in that independent review? For instance, was the interim director of the Children and Young People's Services involved in that review?
Are you referring to the review of the EA or the wider review of the special educational needs services?
Probably the one that the committee.
There was two.
You're right, but there was one the committee was particularly concerned with as to who was actually carrying that out. I can't remember.
Well, the independent review of the EA is being carried out by a consultancy organisation. It is independent, and it will report to the department. So
it's totally independent.
But what it will be doing, obviously, as any review would do, is taking the views of those that are in the Education Authority, those that are in the department, wider stakeholders, the recipients of services and so forth, in gathering the evidence base for any conclusions or any recommendations that it makes.
Mm-hmm. And the other review then that you referred to?
The other review is the one that we're about to appoint, which is about the review of the SEN service provision and processes. And again, it will be an external body that will be taking that forward. But the same process will apply. They will be talking to stakeholders, talking to people in the Education Authority involved in delivering the services.
I think the question was that there's nobody at the top end of that actually carrying out the review as such from internally within EA.
It's an independent external body that will be carrying out the review and will be reporting into the department.
Okay, thank you. And finally, is there still ongoing issues on HR matters in relation to suspensions, retirements, long-term illnesses? Is there pressure coming from that end of things, HR, affecting the rollout of some of your work?
In the Education Authority?
Yes, yes.
I'll let Sarah answer that.
No, it's not. There is no HR issues that are impacting on the work and on driving the work forward, and we continue to do that within the Education Authority. So, no, we are content that the work is driving forward. As we've said, our probably biggest concern is our budget uncertainty as we move into next year. But at this point in time, this remains the EA's top priority, and it is being prioritised in that way.
Okay, thank you, Chair.
Okay, thank you. Ms Flynn.
Thank you, panel, for your comments so far. I just wanted to maybe come back to one of the points that David raised there around at the previous evidence session. We had that discussion around comparisons and learning from other jurisdictions in relation to some of these issues. And I know you had mentioned there, Sarah, that some of that work wasn't able to be carried out due to the pandemic. And I'm just wondering, is that down to a staffing issue, with staff having to be sort of redeployed to deal with the COVID, or have you a wee bit more detail on why that work with other jurisdictions maybe couldn't have went ahead, even via Zoom or whatever?
Okay, so the specific programme that we had intended to become involved in was a peer review programme, and so that effectively meant that Education Authority staff would be trained as peer reviewers, and that they would go and review other jurisdictions, local district councils in England. But equally then those local district councils would come and review the Education Authority and share best practice, etc. So that was a very active peer review process rather than, if you like, an academic or a desktop exercise. So it really was down to those constraints. As I say, obviously in terms of desktop learning, it has formed a clear part of the development of the strategic outline case that we have developed, but that was a much more active participation, ongoing continual programme of peer review and learning that we weren't physically able then to progress.
No, that's fair enough, and I understand that then if obviously staff had to go through that process of training, and that was like a specialised piece of work that they were going to carry out. But maybe just to follow on from that as well then, so has any work been done? Because I know at one of the last witness sessions we were asking the question around why our rates of SEN are much higher, in terms of comparing with other jurisdictions. And I know that some of the feedback was around, like the last time around, we couldn't get any clarity from the department or the EA as to some of the reasons behind that. So I'm just wondering, has any sort of research or work been undertaken to try and get to the bottom of that? That might be part of the reviews that you are carrying out. But has any work been done around that to provide some clarity to the committee as to why our rates are much higher?
Well, that actually is a key part of the second review, or the review that's in recommendation number 2, is to look at the differential rates and look at the potential factors behind that, and we anticipate that that will be undertaken by academics who will have experience and knowledge in that area, because it isn't clear precisely the extent to which this arises from particular environmental factors here, whether it's legacy of the Troubles, intergenerational trauma, whether it's linked to poverty, whether there are any other factors like that, or whether it's due to differences in approaches, or whether, as is most likely, it's probably a combination of both. But that's what that second review is intended to look at.
Okay, that's fair enough. Thanks for those responses. And then maybe just to move on to the issue around the educational psychology service. So again, I know we'll have previous conversations around this whole issue of unmet need, and that obviously all the pupils that were requiring that sort of support service, that weren't necessarily receiving it. So I'm just wondering, even outside of the reviews that haven't commenced yet, has any work been undertaken to try and identify that unmet need in terms of the number of children that are seeking that specialised access to SEN support services, because I know that schools haven't been able to refer all the pupils who might need that support to the educational psychology service. And do you have any idea around the numbers of children that we're talking about that are actually waiting to be referred to the educational psychology service?
So that work is underway. You're absolutely right. Our priority, as we said at the outset, was the statutory operations process, and we would then move forward into our pupil support services. So while the full review of educational psychology services has not yet commenced, that work is underway in terms of identifying the unmet need for the educational psychology service, because again, that piece of work itself will form a key part of understanding what the review of educational psychology services needs to achieve as well. So, I mean, they're very connected and very linked. So while we haven't undertaken the review, we have commenced the piece of work to identify the unmet need out at school level. And we are doing that through the educational psychology service and using a representative sample of schools to be able to indicate to us what that might tell us. And Una, I don't know if you want to add anything to that.
It's fair to say that the psychology services under the education psychologists are under particular pressure in relation to the demand. The more the demand, we've had an increased demand and we haven't had an increased number of education psychologists. And there's good reason for that. I suppose there's a funding issue, but over and above that, even if we had the funding, the educational psychologists aren't out there to recruit. So what we've also done is we have created an additional role called an assistant psychologist, and those are postgraduate officers who have a psychology degree, and they also have 2 years experience in working with children, and they are being recruited to work alongside the educational psychologist service to increase that capacity. The demand is increasing. It's challenging. For example, in 2015, for example, we had 140 full-time equivalent educational psychologists. And in 2021, we have 101 educational psychologists. Now, the health and psychology assistants have been recruited, but it's limited. Their role is very useful, but it is limited in terms of actually providing professional assessment. So that has been a particular issue for us. We have put forward a business case for an additional student psychologist, and we want to see the number of student psychologists increase to 14 per year over the next certainly 2 years and possibly 3 years in order to get the capacity of the educational psychology services back up again. But I think as Sarah indicates, the research that we're about to embark on is being led by the educational psychologist service itself. And these are doctors. They are doctorates in an academic sense, so they're well placed to carry out this research. And the research will involve 20% of our schools, which will give us a good baseline information in relation to where the gap is and where the need is, particularly in stages 1 to 3, because that's where we have a dearth of information. We know the number of children who are referred to for statutory assessments, and those children are prioritised by the educational psychologists because it's a statutory obligation. But my biggest concern and our biggest concern is building up our earlier intervention services, because that's where we're going to get more timely responses for children. That's going to result in more efficiency and value for money.
Yes, thank you. Rosanna, it's really worrying that if we're down to 101 educational psychologists, and as you said, then the demand with the young people and the children is rising. That's a massive deficit that's only going to get worse. So hopefully things can be improved there. And just to follow on, in terms of the targets, because I know that was another thing that came up the last time around, that the pupils that were export services, I think it was for stage 3, that they were getting the assessment by the educational psychology service, but that there was no targets on how quickly a child with SEN could access those support services. So has there been any work done or any changes to simplify that process and to set targets? Can any of that be done in the interim?
It's underway. It's not completed yet, but it is underway. So again, we very much started with our statutory operations service, but that work that we've done and those metrics that we have developed for our statutory operations service and all of that data analytics around how long children are waiting, all of that, we are now underway in terms of our stage 3 services. So that was absolutely our next focus and our next priority. So we haven't concluded that work yet, but it is underway.
Perhaps if I could just add a little bit to the broad thrust of your question. In terms of the educational psychology service, we would have plans to try and increase the recruitment there. That will again be dependent on future budget, and we're not clear about that at this point in time. The other element that will help in terms of the question that you asked about unmet need, I think at the moment a lot of this information is held in schools and may be held in a variety of different forms. So the development of the personal learning plan, which is part of the overall new code of practice, will provide a standardised basis that will set out the needs for the various children in schools. It will be held electronically, and not only will it reduce bureaucracy, but it will give us the opportunity then to run reports where we can get and collect that information on a consistent basis electronically from the school. So that will help us to assess the unmet need. But as Una was pointing out, we then have to be able to address the unmet need, which requires the additional investment of resources for that to be able to happen.
Okay, well, look, thank you very much. Thank you, Chair.
Okay, Mr. Boylan. Mr. Boylan, can you hear me? Oh, it seems to have dropped out. Can I just ask, when he tries to reconnect there, in terms of the regulations and the code of practice, have they been finalised yet?
The regulations haven't been finalised yet. As you'll be aware, we had a consultation some time back, and with the passage of time and with the further developments, we repeated that consultation, which is actually quite an unusual thing to do. And as part of that, in terms of the response to that, there threw up a number of issues which are being on which we've got legal advice and which we're working our way through. So our intention is that we will bring these forward on a phased basis in terms of implementation, and that will happen early in the next mandate.
So we have 2 independent reviews, one that started in October, not completed, and there's been no start to the new regulations and code of practice.
Well, the new regulations and code of practice obviously stem from 2016 Act, since when we've had 3 years without an assembly and 2 years of COVID. But more recently, we have been working on the regulations. There has been work taken forward. There was the second consultation, the analysis of the responses to that, DSO advice, and we have been back and forward with DSO clarifying that advice, and we are working through the final stages of those regulations, and we would hope that we can introduce them early in the next
3 years of suspension and then COVID are the reason why we haven't had the new regulations in the code of practice?
Well, they have had a significant impact because without ministers, we can't decide on the way forward in these areas.
Would you have had ministers for 2 years?
Yes, but we didn't have an executive. We didn't have a mechanism for taking these forward. So this is all.
Well, you did for 2 years.
This has all had an impact on the work. However, we have been taking forward work in the interim. In what's called in contemplation of legislative effect, and the personal learning plans that I described are one example where work has been taken forward in those. There has been a discussion with stakeholders, and we have developed the electronic approach around that, and we're hoping to be able to roll that out next year, all in contemplation of the regulations actually going through.
I'm not aware of any other member who's asked to be brought in for questioning. Can I just make you aware, you may know that the head of the civil service was in front of the committee on Tuesday, and we did push for the resource to be made available in terms of the First Start Closing the Gap recommendations to help address many of the issues. Just before I conclude the session, could I, sorry? Oh, Mr. McHugh, sorry, do you want to come in?
Yes, thank you, Chair. Chair, just in relation to ground that's already been covered by Ms Flynn, in terms of the educational psychologist and so on, and given the limitations of service there and the backlog that one has, is there any sort of effort at all made on the part of the department, even in dealing with schools, to allow where some parents have actually gone out themselves and paid for their own assessment of their children, to find then that the schools are reluctant to accept those same assessments?
I think I'll maybe ask Una to comment on that. I think what I would say is it is part of the work that we have been undertaking as part of the tribunals, because quite often the additional information that then is provided, that the EA then has to concede its tribunal on, is an independent psychology assessment. So we do know that it is an issue, and we are hopeful that when we undertake our review of educational psychology services and are able to move forward to develop that service, that we will be negating the need for that to happen. But as it stands at the moment, the tribunal will take into consideration an independent psychology assessment.
I'm glad to hear that, because it's an issue that is continuously raised with me. And as I say, not that I'm suggesting for 1 second that we should have a two-tier system, that whereby people that can afford it can actually access the service, but that it would be welcome if that's taken on board as well. Grandma.
Okay, thank you. And so just before we conclude this session, Mr. Donnelly or Mr. Stevenson, have you any questions or queries you want to ask?
No, Chair, thank you.
Okay, Mr. Stevenson. Okay, can you hear me, Stuart? You okay?
Chair, can you hear me?
Yes.
Nothing to add from a DOF perspective, Chair. Thank you.
Okay, well, look, thank you both very much, and to your colleagues who joined us remotely for your time this afternoon. I think it's fair to say, and I, on behalf of the committee, we are disappointed and unimpressed at the fact that one of the reviews that hasn't been commenced and the other hasn't been completed. We will have a discussion around the session now in close. So thank you both very much.
Thank you, Chair. Thank you, Chair.
Okay, members, with your permission, then we'll go into closed session to discuss the evidence session we've just completed. Agreed?
Agreed.
This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Broadcasting, can you confirm that we are in public session?
We're just emailing them. We'll know in a second. We can bring the. I think we're trying to gather up the witnesses. Oh. On time, very good. On time, very good.
We have another witness who needs to come in.
Come in here.
Yeah, no problem. That'll be fine.
Joining us. Sorry, she is. There she is.
Have we got any confirmation from broadcasting that we are in public session yet?
Okay. Oh, sorry, there. Sorry.
Okay, so members, agenda item 9 then is inquiring into planning in Northern Ireland. This pages 111 to 191 of your pack. We're pleased this afternoon to be joined in the meeting by members of the gathering. Mr. Dean Blackwood, Mr. San Harper, Mr. George McLaughlin, I think Ms. Nuala Crilly, who's joining us remotely. We also have in attendance Mr. Kieran Donnelly, CB, the Comptroller and Auditor General, and his team, and Stuart Stevenson of the TOA from the Department of Finance. In your pack are the relevant papers, the Northern Ireland Audit Office Planning and Report, pages 111 to 186. The gathering, a background on the organisation, 187. Suggest there is, in terms of the brief, 188. Gathering witness biographies, 189 to 191. So, without any further ado, I'd like to welcome Ms. Crilly and representatives of the gathering to the Public Accounts Committee today. Ms. Crilly, would you and your representatives like to make an opening statement, and then we will have some questions from members. Good afternoon to you all.
Hi, yeah, thank you. Can you hear me?
Yes. Yeah, yes.
Okay, great, thanks. Yeah, I'm going to speak and then Dean's going to speak on the key themes. So I just wanted to say thanks, first of all, for giving us the opportunity to speak today as part of the evidence-giving session. I think it's really important that the voices of local people are heard. I work in a place called St Commons Park House. It's a peace centre, and in that I coordinate a programme called Compassionate Campaigning, and through that programme I get to support the gathering. And I just wanted to give a wee bit of background about the gathering. It was formed in 2017 by 3 local community-based organisations who were concerned with the ongoing environmental threats posed by Maboy illegal dump on the outskirts of Derry. And in the years since, the gathering has grown hugely. We would describe ourselves as an open collective of individuals, communities, grassroots-based campaign groups and activists. The gathering embodies a dynamic repository of skills, knowledge, expertise and creativity gathered from our own lived experiences in pursuit of environmental and ecological justice. And we have some 60 affiliated communities through campaign groups spanning 10 counties across Ireland and all counties of the north. Representatives of these groups gather together every 3 months when we host speakers on a range of environmental issues, and we allow time for all campaigns to give voice to the campaign issues. A number of subgroups also operate within the gathering, examining broad issues that concern campaigners. And of relevance to today's meeting is the gathering's council/planning subgroup. And this group itself came about because over the past 4 years, as we listened to citizens talk about their planning concerns, it became clear that distinct patterns were emerging in the lived experiences of local people, even across different council areas. And we were uniquely placed through the gatherings and through our mini gatherings to record the patterns that were emerging across all of the council areas, as opposed to being the failings of one rogue council. So this gathering council subgroup met in June 2021 to discuss these emerging patterns and behaviours with a view to making representation to the Northern Ireland Audit Office review of the planning system. And additionally, as we discussed the growing number of cases that were coming before the courts, we wonder what was the cost to the public purse. We've submitted freedom of information requests to council areas for legal costs pertaining to planning matters, including the cost of judicial reviews, legal advice for complaints, and any other expense-related planning. Those responses coming back so far show that substantial costs are indeed being incurred. And the other thing I just wanted to note right at the beginning is to say that the majority of people involved in the gathering do so on a voluntary and an unpaid basis. And they do so because of their shared passion and desire to protect the natural environment and all of its ecosystems. There are local communities all over the north and beyond whose daily lives are impacted by bad planning and failing environmental regulation. And some of those lives are being made a living hell. So it's also important to note at this point that nobody actually undertakes any of these activities for the crack, to be vexatious or simply to cause trouble. Because the cost in terms of the mental and physical well-being to many members of the gathering has been immense. And it is part of our role within the gathering to provide solidarity and support and solace and strength to local individuals and communities undertaking actions to protect our shared environment. So I want to thank you for allowing me time, and I'm going to pass over now to Dean, who will talk in more detail about these recurring themes.
Okay. Thank you, Chair. Thank you again for the opportunity to present at what is a very important and emotive issue for many citizens and campaign groups that form part of the gathering's growing collective voice. In many of these community organisations, they only exist because of bad planning and a deep sense of injustice inflicted at the hands of what our collective experiences suggest is an increasingly dishonest planning system. We have 2 prominent campaigners here today who can testify as well as any the impacts of what bad planning inflicts upon the public purse, our environment, and importantly, personal health and well-being of our citizens. So it's in everyone's interest that Northern Ireland has a fit-for-purpose regime, because frankly, we could have filled this chamber today with people traumatised by engaging with a dysfunctional planning system. But it's also important to emphasise that there are many committed and honest public servants and planners, many of whom privately express their deep fears about the decline in the planning system to us, but worryingly also express their reluctance to raise concerns. This makes it all the more important that citizens are taken seriously when speaking up about wrongdoing in planning. In the context of the Audit Office report, I will set out our collective view on what needs to change within planning if it is to become a more fairer, balanced and transparent system for those it currently alienates. And at the heart of our concern is the squandering of the integrity and credibility of planning as a public institution, and whether the report goes far enough in seeking to establish the root causes of why the planning system commands so little public trust and respect among those it's meant to serve. What follows cannot be categorised or dismissed as matters of speculation, disagreements, or mere differences of professional opinion. Rather, comments I make about the planning system are firmly grounded in objectively verifiable evidence to support those concerns. Indeed, the gathering would contend that senior public officials are not ignorant of the evidence of neglect and wrongdoing that they are often presented with and continue to preside over. Our collective experience indicates to us that officials who should be engaging openly and ensuring high ethical standards are maintained within their public bodies tend to engage with citizens from a position of power and not intellectual honesty or credibility. Often this is done to evade addressing real issues of irregular and improper practices and conducts in planning, which I'd suggest remains a significant barrier to achieving cultural change that the Audit Office report recognises as fundamental. Emerging from the gathering's planning subgroup were three broad recurring themes, drawing from the lived experiences and testimonies from across our members. We categorise these themes as administration and failures of the system, professional competence, skills deficits affecting the system, and professional corruption that is increasingly characterising the system in the eyes of the public. While I could say a lot on the first two themes for the purpose of this presentation, I focus on the latter. Professional corruption is less to do with allegations of bribery or brown envelopes and more about the unethical practices and conducts within public service. Indicators of professional corruption are wide-ranging and include the deliberate withholding of information, an unwillingness to clarify or explain an action or misstatement, a persisting aversion to record keeping, unauthorised removal of documents from planning files or portal, a willingness to rationalise an obvious mistake rather than acknowledge and put things right, the use of false and misleading evidence or information, and I could go on. And as a planner who spent my entire career in public service in Northern Ireland, I say with deep concern that these are all examples of professional corruption that I directly and regularly experience when raising concerns about planning at both central and local government level. The same worrying patterns of professional corruption are experienced and documented by other numerous campaign groups associated with the gathering. Such actions must be seen as abuses of public trust and power unbefitting of public servants. And usually, professional corruption is corporately driven. There is a wide body of academic research which indicates that professional corruption, if not addressed, becomes learned, contagious, socialised and ultimately normalised into the culture of public institutions. The concern the gathering has is that this is what is being allowed to happen in the Northern Ireland planning system. This should be of concern to everyone, as not only do unethical practices and conducts corrupt the planning institutions that engage in wrongdoing, but can corrupt other public institutions, such as our judicial system, when the courts are taken in by false and misleading evidence. In adopting its high-level approach to review of the planning system, the Audit Office report misses a major opportunity to meaningfully address such evidence-based public concerns around professional corruption. Given that the report confirms that the Audit Office regularly receives concerns about planning decisions, it would seem appropriate to complement the high-level approach to review with a controlled case study methodology designed to swiftly and purposefully select and examine the veracity of some of the more serious concerns it has received from the public about planning. In the interests of restoring public trust in the planning system, the Committee is respectfully requested to exercise its authority to ensure purpose of case study inquiry is directed into the serious public concerns around professional corruption in planning. To allow professional corruption to become culturally embedded will only ensure that the planning system can never regain its integrity or public legitimacy, but will remain in a state of degeneration. and is set out in more detail in my submissions. For an equitable planning system, the public needs effective and independent oversight and scrutiny of the planning system, including robust mechanisms where the public can raise concerns about professional corruption, with the assurance that this will be taken seriously. The public needs equal rights of planning appeal that can ensure meaningful public participation and can counter the considerable risks to the planning system identified in the audit report, and that can address the United Nations findings of non-compliance set out in Section 3 of Decision VII/8S. The public needs planning portals that are fit for purpose and compliant with Section 5 of that same United Nations decision recently issued in October 2021. And helpfully, it sets out the obligations of UK councils under international law in respect of how they make planning applications available online. Measures such as those set out that can bring accountability into the planning system will go some way to restoring the public's trust that has been previously squandered. Thank you, Chair. I was just wondering also if it would be appropriate for my colleagues to make some...
We normally allow 10 minutes, and I mean, your colleagues will have an opportunity to respond to in terms of questioning, but you'll appreciate with a very busy schedule, and we want to hear from you as much as is possible, and so that interaction is vital. Can I just ask, before we do start that questioning, what parts of Northern Ireland do you all come from, respectively? I'll start with you, Ms. Crilly. Where do you reside?
I'm in Derry City, so Derry Strabane District Council area.
Okay, yourself?
I live in East Belfast.
I live in South Down, so ABC Council area.
Okay.
I'm in the Derry City and Strabane District Council area as well.
Okay, thank you very much for your time this afternoon. We're very keen to hear from you, and thank you for making that initial contact. You will know this committee has heard from the Audit Office. We've heard from the Department in terms of the Permanent Secretary and the Chief Planner as well, and we've heard from NILGA. But we wanted to hear from yourselves, because many of us have been involved in local government. I know most of us, given our age, prior to RPA, and not sort of directly involved in some of the issues that local government now faces in terms of planning. Can I just ask, and whoever can sort of answering, what are your views on the standards and ethics within the planning system? Sorry, just let me. Could I just ask? There's some interference there. Can I ask members if they could mute their devices if they're not going to be speaking? Thank you. Sorry.
I'll maybe start, and if anybody wants to come in, but in theory there are considerably good standards in terms of if it's in the department, for instance, the Civil Service Code of Ethics, or there's a similar, I can't remember the name of it, but within local councils, sets out the Code of Conducts for both councillors and indeed for public servants. Also planners, not all, but I imagine quite a significant amount of them are professional planners. So they would also be bound by the professional codes of conduct and their guidance on ethical standards, depending on whether they belong to the Irish Planning Institute or the Royal Town Planning Institute. So in theory, there is significant standards to comply with, but in practice we would find that very often those standards are blatantly ignored. In fact, I think I had mentioned in my detailed submission that with planning we're in danger of straying into a post-Nolan's Principle era.
Okay. Any of the others want to add to that?
Well, I'd be happy to add to it.
Okay,
that, you know, the experience that I've had with planners, both within ABC Council and within Department of Infrastructure as well, because we've been dealing with both bodies, is that very often questions go unanswered, reasonable questions go unanswered, and correspondence disappears often into a black hole. Sometimes you have to chase things. Sometimes you get an answer, but it's not to the question that you asked. And so I don't think necessarily they're I think they're very careful and they don't always want to answer reasonable questions.
In terms of the one of the things that has been sorry, yes, Mr. McLaughlin, yes.
Aye, sorry, just to continue with that, that particular theme of that question, particularly with codes of conduct, we have found that to be a very difficult area altogether, in that sometimes councillors will actually make incorrect statements at planning meetings, and that is not really followed by. We have a legal person sitting there at the council, but that is allowed to happen and allowed to continue, and that has resulted in one occasion in a QC having to be called in because of the fact that that was allowed to happen. And the code of conduct is one thing. I have a short statement ready for you if I have an opportunity to just maybe read that through quickly sometime, which would fill you in on that. But the other area is where our people, the council and all of that, one of our biggest problems is people making promises and not keeping those promises. And for example, in our council area, refusing to give information, and sometimes when you inquire about the information, you have to go through a whole complex procedure of the information commissioner and things like that, and or looking for information in different ways, having to go through round a whole lot of corners. They make it very complex for us altogether. Now the thing about it is they make it difficult, but our whole aspect is that even the top level of people in the council and even politicians have actually made us promises. They tell you to keep your head down, we'll keep you right and all that sort of thing, and we'll look after you. Doesn't happen.
I think that tactic of sort of delay, keep them happy, respond, whatever, certainly in our case, has been going on for almost 5 years, to the point where the turbine at Knockivey may become immune from enforcement action simply because nobody's doing anything, and that looks like it looks deliberate. Whenever you've been informed by a government body, as they were by the Historic Monuments Council, that the turbine permission should be revoked, it was an error. When everybody's in agreement that it was an error, when everybody's in agreement that it's a special place, and they just continue to go ahead, turning a blind eye to something like that that's so serious for almost 5 years, is it's hard to believe that that's just. It's hard to accept that that's reasonable conduct.
In terms of the one of the issues that we have heard recurring in the evidence sessions we've had so far is the restructuring of local government and the downsizing of 26 councils down to 11, and the fact that a lot of qualified and experienced staff decided to leave, that there's a skills shortage. Would you agree with that in terms of your experiences?
Certainly, it appears that there were occasions where we had a better understanding of the EIA regulations than the people that we were dealing with in the planning department. I think that's fair to say.
When you say was, is that now better?
No, it's not in court. They haven't actually made it to court yet, but the matters that were outstanding on the Hill are still outstanding, and they're in danger of timing out. And that's just one example of, and I mean, there'll be, there's 60 groups in the gathering, and I'm sure that they've all got an example where exactly the same thing has happened. So no, I don't think it's reasonable conduct, and I think it does raise questions about competency. When and Nuala, did you want to come in there?
Just hang on a second. I'll bring you in. I appreciate you want to come in, but I just want to take the people in the chamber first, and I will bring you in.
I was just going to add to that. Absolutely, there's a skills shortage, and I think I was probably one of those people that retired at a time. And putting it in context, it wasn't that significant in that it was something like 40 people out of 900 or whatever. But when it was added up in years, that was 1,500 years of experience that actually left on the same day within planning. But there's very clearly a skills shortage, and specifically Anne had touched upon EIA, environmental impact assessment, and that's been something that I have been raising for quite some time, and indeed you'll note from the submissions that I've made that whilst the courts seem very very content with the way the EIA process operates in terms of its seldom fines against the public authorities, the fact is that you have the European Commission and the United Nations both finding serious failures, systemic failures, in relation to how the environmental impact assessment process has been operated. And that has been largely down to me, not solely, but I made the complaint to the European Commission because I was so fed up with not seeing the improvements being made, but seeing the harm that was being caused because of it. And I also made the complaint to the United Nations in relation to the management of the environmental impact assessment, and their findings that came out this year, both from the Aarhus Conventions Compliance Committee in July 2021, and which has now found its way into that formal decision that I referred to, is a damning indictment on not just our planning system in relation to how it applies skill, or its skills deficit in relation to EIA, but also a damning indictment on how our courts operate in relation to judicial reviews on environmental issues.
Okay. Mr. McLaughlin, yes?
Yes. Talking about skill shortage, I very much learned about the fact that there was a skills shortage as a result of the Audit Office report, and that certainly seems to be the case. But there are skilled people within the planning service, and those skilled professionals are sometimes very frustrated because the profession...
Sorry, did you say frustrated or frustrating?
Sorry?
Did you say that those professionals are frustrated or frustrating? I couldn't quite hear you.
They're frustrated because
okay.
They are making professional planning decisions.
Yes.
And those decisions go to our councils and come before our local elected council members. And we have, this is made clear in the report and lots of other reports that we've had, the number of overturns, as we call them, by local councillors against the actual professional decisions of our professional planners is really it's very questionable altogether. And people are asking questions, why is this happening? What's the reasons for it? Should they not be asked to account and provide information about what informed those decisions, why they're actually disagreeing with the professional planners? That's one big concern at the present time, and that's why, yes, that's what I'm saying, skill shortage, yes, but sometimes the skilled people are being frustrated.
Okay. Ms. Crilly? You need to unmute yourself.
Okay, thanks. The comment I was going to make just ties in as well with what George has said there, but also previous comments. And the first one being, you know, when we were talking about codes of conduct and that kind of thing, and that's about being open and honest and ethical and having transparency. There was one case that came to Derry Planning Committee in 2019, I think, was withdrawn quite suddenly at the behest of the department. It came back a year later, and the recommendation of the planners was that it be rejected because to continue with it would be unlawful. And one of our local councillors still saw fit to try and approve that planning application. I can't get my head around that. When you're told it's unlawful, why would you try and approve it? So that's one thing. But other things, even that planners themselves have brought up, but the bad quality of applications that are submitted and then accepted, and this process of, you know, putting in repeat revised submissions, sometimes at the start of a planning meeting, which then means everybody has to stop for 20 minutes to try and read something, which is not enough time for people who have to make these decisions to digest the information. You know, that's something the planners has brought up, and that's something that we'd be bringing up too. But things not appearing on the planning portal, so you're just looking for information and it's not there. You know.
Yeah. Okay. You know, I absolutely share and empathise with your frustration. There's an appalling planning decision taken in my own constituency a number of months ago when there wasn't one set of legal advices that were ignored, but a number, and politicians across a range of parties decided to ignore that. But that will end up undoubtedly with a judicial review. Mr. Muir.
Thank you very much, Chair, and thank you everyone for taking the time to join us. I think it's really important we do hear from yourselves. from your perspective in relation to this inquiry. So I'm really particularly grateful that you're here. My question is probably touched upon, which was just mentioned just in closing there, which is in relation to overturns of planning applications whereby the officer presents a recommendation but members of the planning committee and the district council overturn that. Just wanted to say a bit more what your views are in relation to that and what concerns you have, if any, in relation to that issue.
Mr. McLaughlin, yes, go ahead.
Well, this is an issue that we have been raising for quite a long time now, and it just seems that a very strange situation that our professional planners, they come along to a meeting with very, very detailed reasons and having carried out surveys of certain areas. We've had this experience in our Perhen area, for example, but it's happening throughout the north, where the professional planners come along and you can see that they have thought this out. They have prepared very detailed submissions, and that all goes in front of council, and certain councillors, they decide, yes, for some reason or other, and we have no evidence that they have actually referred to particular planning policies or the conditions of the area plan or whatever. We have no evidence of that. And questions are being asked, and people are entitled to ask questions when that sort of thing happens.
Let me ask you a question then, and and I don't want you to name names, but would it be your, in terms of your experience, would it be the same councillors raising these same issues on an ongoing basis?
Mostly the same councillors, but at times it can be groupings of councillors.
Okay.
And there seems to be a kind of an attitude that sometimes councillors seem to come to the council with a predetermined notion of what they are going to do and what they're going to allow or going to decide.
Yeah. Okay. So, Mr. Blackwood, do you want to come
in? I would just add to that, certainly I would have concerns given the numbers and the patterns. But I think we also have to reflect on the fact that overturns is part of the democratic process. But they do need to be properly documented, and the public need to clearly understand them. And I do support the Audit Office position in relation to one of the potential checks that could be placed on in terms of overturns is ensuring that the public have a right to challenge them through the equal rights of appeal process, and that would certainly lead, I suspect, to better decision making, because if it was thought that overturns were likely to be challenged, I think we would have a lot more good planning decisions made than we currently have.
Okay. Mr. Muir?
Yes, I just want to touch upon that issue, which is I would describe as third-party right of appeal. I just wanted to maybe if you could tell us a bit more why you feel that would be crucial and how you feel that should work.
Sure.
Well, currently, the public, I mean, in our case, obviously it's an important site. It was advertised, but a lot of people further away wouldn't maybe have seen those advertisements, and had the alarm been raised earlier and people been able to actually get in and be heard in a third-party right of appeal, there's absolutely no doubt that all of this money wouldn't have been wasted. And we're talking, I listened in to the talk with the DFI and with NILGA, and they were discussing things like the cost of enforcement. Bad decisions, unlawful decisions, problems cause enforcement costs when things are done properly. And we're talking about an awful lot of money. And once things get to court, we've got nearly £1 million in ABC Council has been spent, and it hasn't even got to judicial review yet. So the costs of poor planning, that's far more than it would have cost to do the right thing in the first place. So it's mind-boggling, So, that's all I have to add on that.
I would maybe just add to that on a more overarching basis is that, first of all, the introduction of equal rights of appeal would help the UK and indeed Northern Ireland, because the Aarhus Conventions Compliance Committee does look at each jurisdiction within the UK separately as well. But it would help us comply with our international obligations, first of all, and that is very clearly set out. Let's see, I do have it here actually. But the Audit Office, the United Nations, actually finds that by failing to promote promptly make accessible. Sorry, that's the wrong one. Bear with me a second.
But in the absence of a third-party right of appeal, you know, there was a comment about judicial review. Judicial reviews are expensive, but there isn't an alternative if the public are to try and challenge decisions which they feel are deeply unjust. And some of them are deeply unjust. So what is the alternative?
Yeah.
It might assist a great deal with that.
The cost of a judicial review is inherently prohibitive to the vast majority of people in Northern Ireland, so I'm very conscious of that. I'm also very conscious of the benefits of third-party right of appeal and also how that works in the Republic of Ireland. So from my perspective, it's something myself and my party supports. But on the issue of enforcement, I'm aware that that is a discretionary issue, and I think that that needs to change in terms of enforcement, because that the use of that power has not been what it should have been. And to me, the planning process works if both the community and the society and also the applicants are able to get satisfaction from the process, and currently neither are. And so that's the situation, and I think it's really important that what I've seen time and again is when planning applications go in and they're going through determination, whilst the applicant has a right of appeal, the objectors, once that decision is made, the only way back in that is a judicial review, and frankly that is not an option for the majority of people. So I've seen that occur in communities, and the example you've given in relation to Knockivy is a perfect example of where the planning system has failed and the cost that has taken to both their environment and also to the public purse. So I think it's important to highlight that and highlight the issues around that, because it is an example where planning failed in relation to this.
Is that you finished?
Yes, it is. Thank you.
Mr. McLaughlin.
Aye. Talking about costs and judicial reviews, etc. One headline in the Audit Office report was the actual sort of the issue of financial sustainability in the planning service. And one of the big areas of cost in the planning service is the actual area of judicial review. And, for example, a very big concern with regard to financial sustainability is the massive waste of money being paid out in fees to external legal advisors. These payments could run into many thousands of pounds and sometimes up to near £1 million. This is all happening because of bad planning decisions being tested in court, whereas if the correct procedures were followed and the correct decisions were made in the first place, these exorbitant expenses could be avoided.
So let me put it to you this way, being devil's advocate, before I bring in Mr. McHugh. Is there a sufficient joined-upness across local government in Northern Ireland, or is practice different? And is NILGA really a toothless tiger when it comes to this stuff?
I don't think there is a joined-upness across local government. In fact, what we're starting to see is fractious conducts or fractious relationships. Particularly where, well, in fact, the Knockivy case is a classic one where the council's taken the DFI to court on it. But particularly, like for instance, another one where the department have failed to commence the review of old minerals permissions, and we're now getting feedback from councils. In fact, Mr. Muir's area, the Ards and North Down Borough Council, have now put a motion forward, or passed a motion, that the Department for Infrastructure take back responsibility for the review of old minerals permissions, because they have delayed the commencement of the regulations for so long, decades in fact, that there may now be a serious liability from the environmental harm that has been caused from not implementing that legislation. And there are very clear examples of that. The Craighall Quarry is the classic one, where a local ecologist has documented meticulously the priority Northern Ireland habitats that have been destroyed in the past 10 years because of the failure to implement the review of old minerals permissions.
And what about the point about NILGA?
Sorry, that one again.
We have no real relationship with NILGA.
We did do an FOI of all councils in Northern Ireland to see if they all dealt with turbine applications in the same way, and we did find a variation of how different council planning departments were treating these applications, whether they were doing them all in one as per the EIA regs, or whether they were actually breaking them up into smaller parts. So there is there is variance in our experience.
Mr. Chairman, I know your question was about joined-upness between councils.
Yeah.
I think a very big problem is the lack of joined-upness and a real disconnect between the department and the councils.
Yeah, it's beginning to that picture is beginning
so,
to.
What I'm saying is, I have actually written to the Permanent Secretary, etc., and to the Chief Planner about this this matter, and they are saying that councils are they have such an autonomy that they have no kind of responsibility for council spending or council activities with regard to planning. This doesn't seem right, because what they're saying is they are kind of the top of the pile, you might say, the actual department, but we have no evidence of them carrying out there's no scrutiny process of any sort happening, which is difficult.
Yeah, well, we have picked that up, and that's why I think I can speak with a degree of confidence on behalf of colleagues in the committee that we will be perhaps making a recommendation, will be supportive of the suggestion about a commission that looks at these things, because what's there at the moment, whether that's the Communities Minister and the Infrastructure Minister meeting, or the sort of council that they have, or whatever it's called at the moment, clearly isn't working. And apart from anything else, before you throw Delegate into the mix, there seems to be huge issues within the infrastructure department itself, whether it's roads or water or whatever around these things. Okay, Mr. McHugh.
Honourable Chair, for this 5-year-old of the lake, you're all very welcome, and in particular George, whom I know and worked with a number of years back. Given, and I know, George, you actually alluded again to Prehen and the likes of it, right, and I'm aware of some of the background there, but the decisions not taken on that particular application at the time was whenever they had, let's say, the old system, i.e. it rests entirely with the planners. But the system that we have now, it's effectively where the buck stops with the councillors in a sense, right? And yet and all, I know that criticism is there then, that whenever they would, we'll say, overturn particular planning recommendations by, i.e. the professionals that you referred to earlier on, that there's that criticism then of the councillors for doing that, and that sort of nearly implies that either they lack the skill, the ability, or maybe even worse again, that there's an abusive process there. What in fact do you think that it is? Or is it all of those things?
Well, I don't want to be sort of sounding this is vexatious or sort of vindictive in any way, but the main thing is lots of questions are being asked, and some of the decisions that are being made by the local councillors are completely incomprehensible, and people feel justified in asking questions. But I don't want to sort of I try and do things from a business-like and a dignified point of view, and I don't want to sort of point the finger too much. But just for some reason or other, I think the Audit Office proved this as well. This whole changeover from the previous planning regime to the present regime that we have now, I think it's just that our councillors were not ready for that. And there was a lot of sort of councillors who were given little weekends and one day, a days of training and things like that, and they are not really properly trained. But apart from training, there's just a sort of a whole term of sort of honesty and clarity and all that has to come into the thing that we're not getting from the councils.
Yeah, well, actually, you know, that I had written down here just, do you feel that it is a lack of training? And I know, George, you said there that you don't want to point the finger too much, but you are pointing the finger at the end of the day. And it sounds very much like the case that where you don't have that confidence and councillors in their input to the process. And how does it we arrive at decisions at the present time?
Well, what creates some of the questions is, for example, you know, we have one application in Prehen, and there's 14 reasons for refusal by the professional planners. And for some reason or other, not all of our councillors, but some of them actually they argued for actually putting this through, for ignoring the 14 reasons for refusal. That raises questions, you know.
Yep. Well, actually, can I just make another point here that very often councillors at the present time and I know this from being a councillor myself, actually depend on maybe suggestions or recommendations by those who were previously employed in planning. And they actually give them maybe a sound plan and reason why it is that they can object to the recommendation by, i.e. the planners. So like it is all part of the same system, nearly, in the sense that where that opportunity should be there for people to contest what it is that's been recommended by planners and overturn it or to pass it or whatever. But could I ask you and your group just what suggestions would you make specifically in order to improve the whole service?
Sorry. Very quickly, because I want to bring others in, if you don't mind.
Well, first of all, very quickly, just what we're dealing with at the moment, actually, with sort of the elected members making these sort of competent, sometimes controversial decisions. I think where you have elected members making decisions, and where you have professional planners actually making recommendations and decisions, and there's a disagreement, or it doesn't make sense sometimes, I think there's a need for a referee or some independent person to step in and say, look, we'll settle this.
Okay.
I was going to suggest something along similar lines, actually, that we just need a robust oversight body that monitors and looks at the...
So has the gathering taken a view what that robust oversight body should look like or should be?
Well, there is an example down in Ireland, the Office of the Planning Regulator. Now, I don't think they operate precisely like that, but set up a number of years ago, 2 or 3 years ago, the Office of the Planning Regulator monitors the performances of the councils down there, but it also has the authority to go on and look at if there are systemic issues of failures within planning.
That's part of government, is it?
I think they're an independent body. Certainly,
set up by government, though.
Sorry?
Are they set up by government?
I imagine they are. Yeah, they were set up as part. They were set up as part of after the Mahon Tribunal, when there was serious failures and corruption exposed within planning down there.
Okay, Ms. Crilley, did you want to make a contribution?
Still muted.
I can't hear you. You're on mute, I think.
Yeah, just a couple of comments. I'd reiterate what Dean and George have just said. And Andrew, about equal rights of appeal is really important change to be made to allow the voice of people within the system. That may reduce the need for, many judicial reviews, and, people who've taken judicial reviews in the past have often got some very bad press and have been called names, like mischief makers and that kind of thing. That's not true. It's only the recourse given to people. So equal rights of appeal might reduce that. Equally, some kind of independent office would be great. What we're finding with the gathering now is that they talked about an Environmental Protection Agency back in 2008. It never happened, and we're finding more and more, not because we want to be, but people are having to become experts and keep a watch on what's happening in their local council level, is that people within the gathering are a form of independent environmental protection agency in a sense, because we are monitoring and looking and seeing what's happening and having the challenge, and it's not what people want to do, but it's what people have to do. So that would be good as well. The quality of applications going into planning would need to change and be up a wee bit, which is what planners themselves have said. And the other thing I just wanted to say was, in terms of equal rights of appeal, when Andrew was talking about giving the objectors a chance, we don't consider ourselves objectors. Most of us consider ourselves protectors, and, we're trying to look after the environment and biodiversity, and the only recourse is through this system where we seem to be constantly challenging.
Okay, thank you.
Could I possibly come in on that same point? Just what would make things better? From my own experience, and I know the experiences of lots and lots of people, for me, central to what would make it better would be a transparent and respectful process. Quite often, I think, we're considered, it almost feels like gaslighting at times. It feels like you're being arm's length. It's a real hard fight to get anybody to listen to, concerns that you might have. So respect is really important, and then just to agree with everybody else, some form of mediation, because there is absolutely nobody piecing things together. There's nobody creating communication, and the whole thing has broken down. Our system, I mean, I've written here, our planning system continually pits communities against companies and neighbours against neighbours, creating division and misery, and it is totally broken.
So, you did say earlier, I think, that the gathering had written to the Permanent Secretary, yeah? Someone say that?
I did that. I did that.
Yeah, okay. Yes. And the response was?
She and the Chief Planner, I had written to the Chief Planner, and he referred to the Permanent Secretary. The Permanent Secretary referred it back to him, so we're kind of a bit of a circling.
Yes, Minister was the answer.
When I made inquiries about the fact that there was certain unhappiness about things and lack of information and queries about council and all of that sort of thing, the main message from her was that we were supposed to have what's called a two-tier planning system. But I can't understand that. From a business point of view, I can't understand it, because she's saying, yes, we have a two-tier system, but we are here as the department, and the councils are there of their own right, and we don't really connect with them. We don't scrutinise what they're doing, and that's the answer. And that's very kind of annoying, because it left us in a situation, where do we actually go for some satisfaction?
You see, this is the issue with this commission we were talking about, that hopefully if they establish something with a bit of teeth, we can get regularity and a level playing field.
Chair, I also have written to the Permanent Secretary.
We've written to the Permanent Secretary and the Minister on numerous times.
The response there is worth putting on record, in that I was highlighting some serious concerns about professional corruption or irregularity within the planning service. The response was totally refuting it, even though there's hard evidence to suggest what I'm saying.
And that was from the Permanent Secretary?
Totally refuting it, but also threatening further action if I did not retract it. Now, I did not retract it, and I have not seen any further action, but nonetheless, it's very often in planning, and it's written about by a guy called Eric Reid in British Town and Country Planning, that it's attack the critic rather than address the criticism, and unfortunately that's something we face quite a lot.
Okay. So did you want...
No, absolutely. I just would say that the effect that has on people, and this is worth stating, it's not financial perhaps, but it's certainly emotional, and you have to be pretty determined and pretty thick-skinned to get anywhere.
Okay. Okay, Mr. McHugh, is that you? No. Mr. Beggs?
You have collectively spoken of the lack of transparency and particular concern when councillors go against professional planners, and there's not really an explanation why those decisions have been made. I have seen that myself in some controversial decisions as well, so I concur with your view there. But you've actually raised it to a level where you've said you're concerned about professional corruption and unethical practice, and you've listed the withholding of information, removing of document filed, and even the giving of misleading evidence. I think there was a fourth issue, but I didn't get note of it. So my question around that, do you have a list of documented cases that illustrate those range of things? We haven't all day to hear it today, but maybe if there's one or two examples where you can demonstrate why you can use such strong language.
And it's language that I have used outside of this chamber as well. I've been raising it for 7 years on one particular case. And there's very strong documentary evidence, but the weird thing is nobody likes to go to look for it, despite the fact that it's sitting there in front of them. But I can stand over everything. The key example, in fact, two examples that specifically concern me, because it does not just corrupt the organisation that's engaging in those practices, but it also corrupts the court system because of the use of false and misleading evidence in the courts. And that's a very dangerous thing, because if the courts tend not to pick that up, which has happened in the two cases that I'm aware of, and in fact I'm all over them, I have very detailed analysis done of both of them, that becomes the truth essentially. And that also becomes a very worrying pattern that could be repeated. And in fact I will be arguing in my research that there is evidence that might suggest that with the transfer of planning functions may well have went the transfer of these unethical conducts. But absolutely those two particular cases I could set something down in front of you now where you would see within 30 seconds. Well, I don't have, when I say now, I don't have it with me actually, but I could set something down in front of you where within 30 seconds you would know what I am saying, what that's being denied.
I would welcome such evidence. That's all I would say. Now, at present, there's a local government commissioner of standards who can review councillors, elected representatives' behaviour, and I dare say there's a Northern Ireland Public Service Ombudsman if there are concerns about administrative processes. Have you engaged in those two means of examination where you have come across issues of concern?
I'm sure the Ombudsman's sick looking at me. I've had a number of Ombudsman's cases with the Ombudsman. Some I can't talk about simply because they are before the 2016 Act came in, so they were carried out in private. Others that are unpublished, so I'm not sure I can talk about other than I have received apologies for them. But two cases in particular in the last 2 years. One against a local authority, which did warn the authority that the lack of transparency can impact on the integrity of planning and environmental regulation. One against not a planning authority, but it was against the department when it was a joint department where NIEA and the authority, the planners were together. So the case is a planning case, and it's the case that went to the Our House Conventions Compliance Committee. And in that case, and I've never seen this before in an Ombudsman's report, but the Ombudsman found the practice of oral government. Now that's what was happening in RHA. And it also found breach of the Civil Service Code of Ethics and highlighted specifically honesty. So we have been exhausting those processes, and in fact I expect I'll be putting another Ombudsman's complaint in. And another case that I've just been dealing with in the last number of months, I've forgotten the other area you'd mentioned, the other scrutiny body.
There's the local government commissioner of standards for councillors' behaviour.
No, I've never reported a councillor, but I've come close.
Okay. Now, one of your suggestions has been a third-party right of appeal. There is a need for balance in everything, and there is widespread criticism of delays within the planning system, in particular with major planning applications. Are you suggesting there should be a third right of appeal on every planning application, or is it just those where perhaps councillors have overwritten professional planning opinions? Because there is a danger of the whole system being bogged down even worse and no decisions being capable of being made.
I'm glad you came back to that, saying as I messed up my answer the first time. But certainly in relation to the balance that's to be struck, of course there needs to be. But I think there are already indicators where those balances could be. Like for instance, we may, even the deterrent of a likely third-party appeal would suggest that that may encourage better decision making, so that might rule that out. Also, for instance, there was always the talk of that there could be vexatious appeals, and you can never rule that out, I suppose. But the deterrent there would be the Planning Appeals Commission currently can award costs against vexatious appeals, so that might also deter anybody from taking a vexatious planning appeal. But I suppose on the environmental side and the concerns that I have for the environmental side, I would probably always err on the importance of complying with the Our House Convention in relation. Now, the Our House Convention only finds, because I only complained about cases where significant environmental effects would occur, but they found that the UK is in breach of the convention by not allowing third parties or citizens the same rights as developers.
Could I just nip in and just...
Yeah, I want to try and get everybody in, so the answers could be brief, if you don't mind, because...
My personal view would be that that everyone should have scope to a right of appeal, but it could be curtailed in other ways as well. For instance, I'm going to say everyone, I mean, if somebody has legitimately objected to it, then that might be a mechanism that could curtail if you maybe shouldn't come in and appeal something that you weren't involved in or didn't make representation to?
In terms of providing comfort to developers and those who want to see the system sped up, it seems obvious to me that people seeking plan permission can currently not have any faith that their application is being handled properly or that it's not going to be open to challenge. So there's an argument there that having a third-party right of appeal would actually help give developers some confidence.
Yeah, I can't let 4 people answer the question.
That's all right.
So,
I'll wait. I'm prepared to wait to Anne finishes there. That's all right.
Yeah, I need to keep the thing moving. So
Anne, continue on there.
No, that's all I had to say on that. Thank you.
Just a brief follow-up for me. One of the mechanisms that's meant to be there at present is the department can draw into the centre decisions which give it concern. What's your experience of that? I've seen some cases where I thought they would have and they haven't. So what is your experience?
It's almost 5 years still waiting.
Right, okay. Can I bring the other 2 in? So I'm trying to be fair to everybody so we get the spread. I think, Nuala, you had been indicating to come in and then I'll bring Mr McLaughlin in. Go ahead.
Yeah, thank you. I mean, I just had a comment to make when the question was asked, have you gone to the local government commissioner? That's actually putting the onus back on the citizen to keep the process going, to scrutinise and oversee and then to lodge complaints. There was one case I was supporting that person, and I won't say the council area, but it was a long drawn out thing in a planning commission. One of the councillors in the meeting was quite evasive in the answers given, and evasive to the point where the answer was wrong. There was a solicitor sitting there on behalf of the council who said nothing, and the rest of the planning committee actually said nothing either. So, in my reckoning, actually condoned the kind of misleading statements that the councillor said. But the person in question, the local citizen, didn't have the energy left to go and lodge a complaint with the local government commissioner standard. So that's the thing. People are exhausted and tired, and you're getting one thing after another and another process to go through to lodge a complaint. And also I'd like to say there's quite a few people going through the different complaints procedures of each council, lodging the complaints, and some of them have 1, 2 and 3 stages. And I think that complaints process probably varies from council to council. I'm not fully sure, but again, those are quite exhausting procedures for individuals to constantly have to take on, and some of those have resulted in councils getting in external legal costs up to £30,000 in one case, so the onus cannot always come back on the individual. Have you done this? Have you done that? There should be standards to which people are adhering, rather than leaving it all to us.
Okay, thank you. Before I bring Mr Hilditch, Mr McLaughlin. Yeah.
I was actually trying to get on at the stage where you're talking about the Ombudsman, and I've been in touch with the Ombudsman. The Ombudsman actually, not on our behalf but another applicant, they found the Derry City Council guilty of malpractice, and they suggested that the council should have a look at their procedures and actually furnish the Ombudsman with a plan of action where they would correct things. We never saw any evidence of that. The council, even though the council were fined, they continued to behave in exactly the same way, and we ourselves have had inquiries and reviews conducted by experts, and the experts have found them guilty of bad practice, unfair practice, incorrect decision making, and these were all put to them. But somehow, again, we got that sort of satisfaction in a way that the councils, etc., and the planning were found guilty, but nothing happened, nothing changed. And this is why people are frustrated. You might notice in some of my documentation to you, I use the word frustration and hurt. And this is why there's frustration and hurt, and this should not be the case.
Okay. Mr Hilditch.
Thanks, Chair. And you're very welcome this afternoon, folks. It's been very interesting so far. Probably bypassed my line of question, but it was about really consistency across all the councils, which, as a former councillor, had to take some action myself then to try and highlight the inconsistencies. And I'm sure you folk with 60 organisations must see a huge amount of inconsistency across the councils. Is that the case? And further to that, there's some councils now being led, the planning area, by people who came out of enforcement, for instance. Would those be better led councils than maybe somebody just coming in from a planning consultancy or taking up employment with a council sort of new? Do you find that the enforcement people who are heading up councils maybe have that wee bit more sort of clout with their councillors, as it were?
I don't know, because on that second part of the question, I don't know, because I'm not sure which councils are headed up by the enforcement. I tend to sort of just focus on the areas that are causing me problems at the time, but I'm sure maybe somebody else might have a view on that. Inconsistency is a massive problem, and I think you're always going to expect it when you go to 11 councils, but you shouldn't expect inconsistency of approach when it's about administrative processes. And there's massive inconsistency. For instance, I think somebody mentioned earlier about putting key documents on the planning portal. I have been asking since 2014, including in the Northern Ireland Assembly when it was with the Minister, to please put documents that you're legally required to hold by law, like the environmental impact assessment determinations, habitats regulation assessments, which are absolutely key the public understanding how decisions are making.
I suppose, sorry, just to interrupt you there, some of those people you've mentioned there who should be consulting with the planners, they still have a sort of a silo attitude as well, and there are long delays in getting some of those legal documents back again too.
Well, these are when I say these are legal documents that are prepared by either the planners prepare the environmental impact assessment screenings, and their shared environmental services prepare, and there can be delays in getting the habitats regulations back, and there are massive delays in actually carrying out the environmental assessment process, the EIA screening process, which should be done within 4 weeks of the planning application, or 90 days, or a longer time agreed, no more than 90 days in writing with the applicant. What we're finding is those screenings are being done a week before the application is approved, so it might be 4 or 5 years into the decision, and then they do them. I come across one very recently where it was done on the day that the decision was sent out. And so that's one part of the reason why they're not being put on the planning portal, I suppose, if they're doing them so late. But where they have done them, again, they're not making their way onto the planning portals in a timely manner, and that's very disadvantageous to the public.
Okay. Ms. Harbour, would you like to?
No, I was just going to reiterate that there does seem to be variation in how the AIA regulations are interpreted and enforced, and enforcement varies a great deal from place to place and from council to council. And I guess, I mean, from our point of view, that's just not acceptable. Why should something be okay in one part of Northern Ireland and not okay somewhere else?
Okay.
Yep, big issue. Yeah. No, thank you.
That's you. Okay. Mr. Irwin.
Thank you, Mr. Chairman. And can I thank you for your presentation. In your early presentation, it was mentioned a number of times that there's professional corruption. What exactly do you mean by that?
It can vary, but I would suggest that it's sustained patterns of unethical conducts that are very clear to everybody, but are being denied simply through the abuse of power, so that as the public, we have no authority. We can carry out our investigations as far as we can, and we can come up with conclusions. We can even find hard evidence, but we can't come in and interview staff. We can't come in and find out what has gone on. So what then happens is these unethical practices whereby we're at the dead end, where the authorities say we've acted appropriately. They can't explain how, they won't explain how, and the reason why they can't explain how is because they know they haven't acted appropriately. But the fact is that that's the wall we come up against, and that's the unethical conducts by not being open and transparent, and indeed and sometimes misleading in respect of their engagements with members of the public.
The rest of you want to just early on, Mr. Irwin, sorry.
No, I mean, in our experience, failure to answer key questions at key moments in time has made a massive difference to how things have unfolded. And I would say that's intentional. I would say that if you deliberately ignore the first point in someone's letter and answer the second, and then you wait until the thing has happened before you then admit that you actually did have the power in the first place, that's not okay. You know, what's that all about? So yeah, that definitely raises the public suspicion that something is going on. And you know, if it's okay for some people not to follow the rules, why should anyone follow the rules? You know, we've got to be consistent.
Okay, Mr. McLaughlin, did you want to come in?
Can I say,
Sorry, go ahead.
Sorry, William. I just want Mr. McLaughlin's going to come in, and then I'll bring you back. Don't worry, I'm not going to exclude you. Go ahead.
Mr. Irwin, do you want?
No, go ahead yourself.
What I was going to say there, the Dean and Anne have kind of answered that quite well, but the big issue is that people in general and the public in general are so dissatisfied with the planning system that the planning system, we talk about maybe little things, introducing little things and various things that might make a difference. That we can't actually talk about things that are kind of, I've been doing this for a long number of years, and somehow things just do not change. It goes on and on and on and on.
Is it worse now than it was? I mean, you said that you would expect when you go from 26 to 11, that things. I would have thought when you go from 26 to 11 it would improve. I would have thought. I mean, why else would you do it? I mean, do you think it's better? Or?
I was one of those people who lobbied for democratic change.
Okay.
But I must say, it's worse now than it was.
Right.
The other thing, what I was saying is...
Hope you're not advocating North Korea or something.
What I would just like to finish off by saying, and I know we're running time short, but there's so much dissatisfaction, frustration and all the rest that little sort of sticking plaster ideas just will not work.
Okay.
We need, and this actually noted when, from my business kind of point of view, the model that our planning system is based on is wrong. It's obsolete. The whole thing is obsolete. It needs complete change. We need to bring a completely independent group of people or a team of people who are what I call change masters, that will actually kind of come in and just do whatever has to be done to make the system better, more credible system, more honest system, a more fair system.
Okay, Mr. Irwin, you wanted to come back? Well,
yes, I did, on a couple of issues, and one is I think professional corruption is unfair. It paints everyone in the planning service into that corner, and I don't think it's very fair to do that, because I deal in my capacity as an MLA with planners, and I have never met planners that have been corrupt. In my experience, many of them do work very hard and they have a very difficult job, and planning is open to interpretation in many issues, and by going to the Appeals Commission you find that out in some situations. You also accuse planners of not dealing properly with the environment, but surely they consult with the Northern Ireland Environmental Agency on all those major issues, and they take their guide from Northern Ireland Environmental Agency. Am I right?
Well, if I could take the first point, and maybe Anne might want to address the second point, but in terms of the professional corruption, I made very clear at the outset that there are many good planners, equally as frustrated with the system, but afraid to raise points for various reasons. And so from that perspective, it's not directed or trying to paint every planner with the same brush, not at all. I am a planner myself, and I know the pressures that many not anymore, well, I don't work anymore as planning, but the pressures that they face and the difficulties within that. Professional corruption is a specific term. It's defined by an author called Samuels, and it's about unethical conducts within public service. It's not about but it is defined as professional corruption. And any public servant that engages in unethical conducts could be deemed to be engaging in professional corruption under that academic definition.
And if I could just sort of chip in there, regarding corruption, it's cultural change that I think that George was referring to earlier on. That's what's required. It's how you treat people. And how that process works, how efficient that process is. And just to answer your second point on EIAs, and you mentioned that it was NIEA's role to sort of oversee that. NIEA don't have anything to do with historic environments. And in our case, we're dealing with a historic environment which requires an environmental impact assessment. So it's much, much broader than saying it's something that the planners should have properly understood and interpreted in the early days, rather than what we are now seeing, which is an attempt to kick the ball down as far down the line as possible until someone else sorts it out, without simply saying, okay, let's draw a line and fix the thing. So I think it's that cultural change of actually, sort of integrity that I feel is often lacking, and I would really welcome a cultural change within the planning system.
Okay, is that you, Mr. Irwin?
I'll do, yeah, thank you.
Yeah, Mr. Kelly, you wanted to add something, did you?
Yeah, I was just going to say I have a definition of the term professional corruption from the works of Samuels, if anybody wanted me to read it out, because when I first heard the term as well, I was, I wondered what it meant, but it said, simply put, professional corruption refer to observable symptoms that manifest in distinct patterns of abnormal behaviour, unethical conduct, have the ability to harm the organisation's reputation, tend to persist, generate tensions among its members and antagonism between the organisation and the public. If not addressed, these corruptions and pathologies become contagious within organisations, deeply penetrate their culture and require concealment from the public gaze. Perhaps the most concerning pathology for any public authority is the unavoidable abandonment of public service values that comes with the decision to conceal neglectful practice. So that came out of that book that Dean referred to, and I would just reiterate what he said. It's not all planners, some people in there wanting to make great change, but it's the overall patterns and behaviours and how it impacts on members of the public or information that's not available, that kind of thing.
Okay, thank you very much. Well, I think all of the members who wanted to ask questions have now had that opportunity. I would like to thank all of you for coming along and giving of your time and your experience and expertise today. It's much appreciated, helps us get a more holistic and rounded inquiry report when we do produce it. We do hope to be in a position to publish it on the 22nd of this month. It's very clear in this inquiry, although short, it's been very clear for us so far that the system is disjointed and it's not working, that there is a standardisation problem, and there's a huge issue around, if there isn't an issue around capacity, which I personally believe there is, there's clearly a huge issue around confidence in terms of planning in Northern Ireland. So the Audit Office have been here present during the presentation you've made, which is now, of course, on the record. So thank you very much indeed, and we really appreciate your taking the time to be with us.
Thanks so much.
Thank you. Okay, members, with your permission then we will go into closed session to consider the evidence session. And broadcasting, can you confirm if we are now in fact in closed session?
Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly, Senate Chamber, programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber